today's discussion with the arteries, and I'm talking about the first external carotid artery. We already have an idea about the external carotid artery. We discussed the branches actually in the scalp also and told you which branches will come there. But it is again important to understand these branches once again here so that I can visualize that where these arteries can be located in the triangles of the neck. Okay, so as we know, common carotid artery and internal carotid artery, they are seen relatively in the same line only, the common carotid and internal carotid. And then external carotid artery will come out. There is external carotid artery. So this here is the common carotid artery, which at the level of the upper border of thyroid cartilage, it divides into internal carotid and external carotid. So this is internal carotid here. So let us focus on the external carotid, the one which is outside the carotid sheath. We have 8 branches for the external carotid. Now there is, like, as I said, I'm not a very big fan of mnemonic, but sometimes you can use them. Like there's a mnemonic for all these 8 branches of external carotid, which says, which is true also, that some anatomist, not me, some anatomist, like freaking out poor medical students. बहुत सारे मिलेंगे. You'll find so many anatomists जो डराएंगे आपको ना कि anatomy अरे आफत है बवाल है and all that. Some anatomists. So some anatomists, definitely not me. मेरा नाम नहीं लगाना इसमें. Some anatomists like freaking out poor medical student. ये mnemonic मुझे इसलिए अच्छा लगता है. The reason I like this mnemonic a little because it is also telling you the branches of external carotid artery more or less in a sequence. Like when you say some anatomist, S is a superior thyroid artery and that will go in the front toward the thyroid gland, and that is the very first branch of that is superior thyroid artery, the first branch. Then we have this artery A, that is ascending pharyngeal artery. Ascending pharyngeal artery is the only branch you are not able to see because it is on the medial side of external carotid. So this is how the ascending pharyngeal artery would be. Let us say this is ascending pharyngeal. In few books they say that ascending pharyngeal artery is the first branch of external carotid, but guys, it is not. According to Gray's Anatomy, clearly it is not the first branch. कुछ books में उसको show भी किया हुआ, it is coming from the first, it is the first branch coming up, but don't mark it that way. Somebody asked this question, what is the first branch of external carotid? You better be sticking to the superior thyroid only. So ascending pharyngeal artery. L is a lingual artery. So that is a lingual artery going in front. F is a facial artery, which is just above the lingual artery. That is a facial artery. The lingual artery. Facial artery we've already discussed, that is facial. And the one which is seen opposite to facial artery, O, that is occipital artery. This artery here is the occipital. As I said, we've already discussed this, but एक बार फिर दोबारा से quick recap कर लेते हैं so that because this is very much needed in the triangles of the neck here. Now, out of the 8 branches of external carotid, the first 5 arteries that we wrote here, these first 5 guys, the first 5 arteries that we wrote, they are present in the carotid triangle. Now, that's one important thing to remember. Today, when we will discuss the carotid triangle, I want you to understand that in the carotid triangle, out of 8 branches of external carotid, 5 will be seen inside. Well, I would say 4 will be seen. 5th one may not be seen. Ascending pharyngeal is kind of hidden on the medial side, so you may not see it. But the 4 definitely will be seen. But these 5 branches are given off in what triangle? In the carotid triangle. What is carotid triangle? We will discuss that in the carotid triangle. Okay. Then we have one artery which is above occipital artery. That is the posterior auricular artery. That is posterior auricular artery. Posterior auricular artery will be seen in the triangle above. And then finally we have 2 terminal branches, which you very well know, the 2 terminal branches of external carotid. One of them is supplying the scalp. In fact, posterior auricular and occipital artery are also supplying the scalp behind the ear. That is superficial temporal artery. The superficial temporal artery, and then the largest branch of external carotid, that is the maxillary artery. Maxillary artery is the largest branch of external carotid. Superficial temporal artery, maxillary artery, बहुत बड़ी artery guys. Maxillary artery, if you remember embryology, maxillary artery was developing from the first pharyngeal arch artery. The first arch artery remnant is maxillary artery. It's a huge artery. It's a big artery. Having 16 branches of its own. Imagine, अपनी खुद की 16 branches है इसकी maxillary artery. So it's a big artery. So my point here is that I want you people to focus especially on the 5 branches of external carotid which are given off in the carotid triangle. So we will be using this discussion, and also guys try to remember that what is the direction of these arteries. If you can see facial artery, lingual artery, and superficial the superior thyroid artery, they are called as the anterior branches. They are running anteriorly, so we call them the anterior branches. Posterior auricular and occipital artery, they are called as the posterior branches. 2 of them are posterior one. Ascending pharyngeal artery is the only branch on what side? On the medial side. So it's simply called as the medial branch. The only medial branch. It is running on the medial side. And then of course, superficial temporal and maxillary artery, these are the terminal branches. These are terminal branches. That is how we classify the branches of external carotid. 3 anterior, 2 posterior, 1 medial, and 2 terminal branches. So guys, the first thing done, at least I have these branches of external carotid artery. Cranial nerve, we've already done. Subclavian artery, external jugular vein, you already know. That is how external jugular vein is formed. Now the only thing remaining is the branches of brachial plexus also we've discussed in the upper limb. So if I discuss the subclavian artery, so major, not saying all of them, but the major nerves and vessels of the side of neck will be covered. Then it's my job to put them together and serve you in the triangles of the neck. So let us talk about the subclavian artery, guys. Subclavian artery. Before subclavian artery, let me tell you about the muscle which is dividing the subclavian artery in three parts, and that muscle is scalenus anterior. Let me show you the picture, guys. I mean, we don't have to draw or anything like that. Just look at this image. This picture is showing you This picture is showing you all the scalene muscles. All the structures of the neck has been removed, and you can see the muscles which are in relation to the vertebral column. Previously, where we discussed about the scalenus muscle in the deep cervical fascia, when we took a transverse section, we saw that the transverse process of the vertebral column of the cervical vertebrae was giving attachment to the scalene muscle, scalenus anterior, scalenus medius, and scalenus posterior. Scalenus medius is the largest one. The scalenus medius is the biggest one. But we have to focus on the scalenus anterior. Now, let me highlight the scalenus anterior for you in there. Scalenus anterior is taking origin from the transverse process of C3, C4, and C5. I hope you can appreciate this one. This is the one. You cannot draw this, but at least you can write it down, guys. That scalenus anterior. I will draw it in the relation part. So scalenus anterior, origin of the scalenus anterior is from where? It is from the anterior tubercle. It is from the anterior tubercle of transverse process. Anterior tubercle of transverse process of C3 to C6. The origin of scalenus anterior. It's important to understand the attachment and the relations of this muscle. It's very, very important muscle. Scalenus anterior attachment or origin is to the anterior tubercle. Guys, if you look at the cervical vertebrae, the transverse process of the cervical vertebrae, इसको बनाने की जरूरत नहीं है. Transverse process of the cervical vertebrae looks something like this. The transverse process looks something like this. So it is having two tubercle. We have a foramen transverse serium. We have an anterior tubercle and we have a posterior tubercle here. So I'm talking about the anterior tubercle only. So it is taking origin from the anterior tubercle of transverse process of C3 to C6, and then insertion is to the first rib. It is actually inserted to the inner border of the first rib. First rib attachment is come. There is a tubercle on the first rib which is called as the scalene tubercle. So it is attached to the scalene tubercle of the first rib. That is the insertion of the scalenus anterior. Something about the scalenus anterior we discussed in the thorax also. Phrenic nerve. Phrenic nerve runs in front of it. You can see that nerve they are showing here. There is a phrenic nerve which is running in front of the scalenus anterior, and that's how it will go downward between the subclavian artery and subclavian vein and then enter into the thorax. Right? We discussed that. But that is not the only structure we have here. Our focus right now is this artery here. That is subclavian artery. Look at this, guys. Subclavian vein is in front of the muscle. Subclavian artery is behind the muscle. So basically, subclavian artery is divided into this first part, which is picho the first part here. The part which is behind that is the second part of subclavian artery, and this here will be the third part of the subclavian artery. The first part, second part, third part. First part is close to the midline, that is the proximal part. Second part is deep to the scalenus anterior, and third part is distal to the muscle. Before we start discussing the three parts of the subclavian artery, also please notice that if this is scalenus anterior, obviously the muscle which is behind that is scalenus medius, and the muscle which is behind that is scalenus posterior. Anterior, medius, posterior. And between scalenus anterior and medius, you have the brachial plexus and subclavian artery coming out. Between scalenus anterior and medius, we have subclavian artery and the brachial plexus coming out. That's the same thing we discussed again in the deep cervical fascia also. When we draw the transverse section, you actually drew the spinal nerve of the brachial plexus between the scalenus anterior and scalenus medius. If you understood this part, let us quickly have a discussion on the subclavian artery and the parts of the subclavian artery. Guys, we said scalenus anterior muscle is going to divide it. So there we go. If this here is the scalenus anterior muscle, that's how the muscle was, having 1, 2, 3, and 4 digitation for the origin, coming from C3, C4, C5, and C6. That is the scalenus anterior. Inserted below where? To the scalene tubercle of the first rib. Is attached to the scalene tubercle of the first rib. Not going to that part. Okay. Subclavian artery will be seen passing obviously behind it. From medial to lateral, you will see subclavian artery will be running like this. So here is the first part of subclavian. There is second part of subclavian, and this is the third part of the subclavian artery. The second part you can put a dotted line over there because you have to show the branches. This first, second, and third part. This is first part, this is second part, and this is third part. And further that we already know, axillary artery will start. Axillary artery first part, second part, and third part. The good thing about the first, second, and third part of axillary subclavian artery is that the branches from here can be remembered with the mnemonic vitamin C and D. Vitamin C and D, guys. Vitamin C and D. Vitamin C and D. Vitamin C and D. Vitamin VID. That means 3 branches will be coming from here. V. 1 branch will be coming from here. That is C, and 1 branch is coming from here. That is D. So vitamin C and D. V stands for the vertebral artery. V stands for the vertebral artery. This vertebral artery basically will ascend upward, passing through the foramen transversarium of the cervical vertebrae. Cervical vertebrae property क्या है? They have a foramen transversarium in them. They have a foramen present in the cervical vertebrae. So this is the first branch. That is the vertebral artery. That is a vertebral artery, and it is passing through the foramen transversarium. Foramen transversarium of C6 to C1. C7 नहीं. It is passing from the foramen transversarium of 6 cervical vertebrae, then from C5, C4, C3, C2, and C1. Not C7. First of all, 7 cervical vertebrae usually is not having foramen transversarium. Okay? It's atypical cervical vertebrae. But even if it is having, even if there is a foramen transversarium in C7, vertebral artery will not pass through it. Vertebral vein will pass through it, but vertebral artery will not go through it here. So that is the first branch here, the vertebral artery, very, very important artery, guys. But we will be discussing this artery in detail in the neuroanatomy. because vertebral artery supply in the neck is nothing. It is hardly supplying some muscles and nothing much. The major supply of vertebral artery is in the cranial cavity where it forms a basilar artery and then supplies the brainstem. That's the first branch. VIT. I is what? I is the internal thoracic artery. I is the internal thoracic artery. I don't have to tell you anything about internal thoracic artery. We already know that. Internal thoracic artery. Remember guys, internal thoracic artery also called as internal mammary artery. And this internal thoracic artery was the one which was running along the sternum and giving off all the anterior intercostal artery and then finally divides into the musculophrenic and superior epigastric. So that internal thoracic artery, also called as internal mammary artery. It's a main artery supplying the mammary gland. VIT. T is a very, very important one, and that is a thyrocervical trunk. Now there's a trunk called a thyrocervical trunk, and this thyrocervical trunk is having 3 branches. This thyrocervical trunk is having 3 branches. 2 of those branches will be seen in the anterior relation of the scalenus anterior, and 1 branch will be going toward the medial side. Okay, first of all, what is this? This here is a trunk called as thyrocervical trunk. Let me name it somewhere. This is thyrocervical trunk. And as the name suggests, thyrocervical trunk, there are 3 branches from thyrocervical trunk. Let me just write their initials only so that I can write them separately. One is the inferior thyroid artery. I'm writing I here, inferior thyroid. One is transverse cervical artery, and one is the suprascapular artery. So this TIS branches, CITs, SIT, SIT branches or TIS branches. So I is what? Inferior thyroid artery. I is the inferior thyroid artery. Guys, superior thyroid artery is a direct branch of external carotid. We just saw. Thyroid gland is supplied by 2 arteries. One is superior thyroid, one is inferior thyroid. Superior thyroid is directly coming from external carotid, the first branch of external carotid. Inferior thyroid artery is a branch coming from thyrocervical trunk, that is from subclavian. Then we have this artery called as the transverse cervical artery. You'll see that. And S is the suprascapular artery. Transverse cervical artery and suprascapular artery. Inferior thyroid, transverse cervical and suprascapular artery. Now, I hope you remember this transverse cervical artery and suprascapular artery. Now, आपने पहले भी सुने. These arteries are somehow also contributing to the anastomosis around the scapula. They participate in the scapular anastomosis. Before we go further, guys, this transverse cervical artery, you should know this. The transverse cervical artery further divides into 2 branches. One is a superficial branch which will go above. One is a superficial branch. We will be requiring this today actually. Remember that. One is a superficial branch, and then there is a deep branch of transverse cervical artery. Deep branch will go down and participate in the scapular anastomosis. Superficial branch of transverse cervical will go up, and then you will be seeing in the triangles of the neck also. I will tell you where. Superficial branch and deep branch. First part over, guys. First part, VIT, vertebral artery, internal thoracic and thyrocervical trunk. Although I did not draw it absolutely correct, but you can write that the thyrocervical trunk and internal thoracic artery are exactly opposite to each other. They're exactly opposite to each other. बिल्कुल एक दूसरे ऐसा होता है, एक ऊपर नीचे जा रहा है. They are exactly opposite to each other. So these are the branches coming from what part? From the first part. Second part, vitamin C and D. C, the branch which is coming from the second part, the name starts with C. Let me just draw it dotted here. And this artery is called as the costocervical trunk. Now tell me you heard of this artery, guys. Costocervical trunk. We talked about this artery a little again in the thorax only. Costocervical trunk. As the word says, costo and cervical. It is supplying the muscles of the neck. That's why the name is cervical. Costo because of the ribs. If you remember from our discussion in the thoracic wall, guys, we said the intercostal artery, posterior intercostal artery are coming from the descending aorta, but from where? From the third posterior intercostal, and then 4, 5, 6, 7, 8, 9, 10, 11, 12, all are coming from the descending aorta. 3 to 12. Not first and second. First and second posterior intercostal artery, the one which are supplying the intercostal space, will come from here only. So this will give a branch which comes downward called as superior intercostal artery, and then superior intercostal artery will give off the 2 first and second posterior intercostal artery. You can always go back into notes of the thorax and you will find it there that we have talked about this costocervical trunk. As I said, this costocervical trunk will give off an artery called as the superior intercostal artery first, and that superior intercostal artery will go downward and will divide into the first and second posterior intercostal artery. So basically they're supplying the first and second intercostal spaces. So we have one branch coming from costocervical trunk जो नीचे जाएगी पहले, and that gives out the first and second posterior intercostal artery. Vitamin C. अब आते हैं D पे. Okay. The branch which you may see coming from the third part of the subclavian artery is called as the D stands for the dorsal scapular artery. This is called as the dorsal scapular artery, and that is the branch which can be seen coming out from the third part of the subclavian artery. Now why I am saying can be seen, because in most of the cases it is not present. Why it is not present? See, dorsal scapular artery, please understand that dorsal scapular artery is basically the compensation for the absence of one artery here. यहाँ पर एक artery ऐसी है जो absent हो सकती है. And you know which artery is that? This one. Deep branch. If the deep branch of transverse cervical artery is absent, transverse cervical artery is coming from the first part, and one of the branch is what? Deep branch of transverse cervical artery. If the deep branch of transverse cervical artery is absent, only in those people we have what artery? The dorsal scapular artery. बेटा या तो वो होगी या ये होगी. One of the D will be there. Either that D will be there or this D will be there. So either you have a deep branch of transverse cervical or you have dorsal scapular artery. Please note that. इसको लिख लेना. Either a deep branch of transverse cervical artery is present. If deep branch is absent, then to compensate for the deep branch, we have dorsal scapula. If the deep branch is absent, for the superficial branch is always there for the transverse cervical artery. If deep branch is not there, then dorsal scapular artery will be seen. So this is the vitamin C and D we're talking about. Vitamin VIT, vertebral artery, internal thoracic artery and thyrocervical trunk, that is from the first part. Posterocervical trunk, that is artery coming from the second part. And D, dorsal scapular artery, if at all it is present, it is coming from the third part of the subclavian artery. Knowing about the branches of the subclavian artery, this is kind of again a connecting topic here. Internal thoracic artery we discussed in the thorax guys. This dorsal scapular artery or D branch of transverse artery and even suprascapular artery, we talked about them in the anastomosis around the scapula. So next time when you revise the anastomosis around the scapula, that again will make more sense to you. That's what I always keep saying. The more you go in the anatomy forward, you will actually understand the previous part even better. Ab aap jaake anastomosis around the scapula padhoge, so this will make more sense to you because now you know where exactly the arteries are coming from. Axillary artery also and subclavian artery also. Let us also talk about the relations of that one important muscle here, that is the scalenus anterior guys. What are the important relations of scalenus anterior? Now what relations you can presume from here guys? What are the relations you can make out from here? Now clearly, in the posterior relation of this subclavian artery, we have the subclavian arteries there. Second part of subclavian artery is the posterior relation. Anterior relation may, as of now, I can see the two branches of the thyrocervical trunk. Which two branches? The transverse cervical artery and suprascapular artery can be seen in the front. What else will be there in the anterior relation? Let's have a look on the picture, and after that, I'm also going to draw it with you guys. The scalenus anterior muscle, and here is the image which is showing you the relations of the scalenus anterior. Look at the anterior relations first, and look at the anterior relations that you are already aware of. So what you see that this is the first part of the subclavian artery there. This is the one. And this here is the thyrocervical trunk. You can see that. And I told you that one of the branch of thyrocervical trunk will go to the inferior thyroid artery. So inferior thyroid artery, it may or may not be seen in front of scalenus anterior. Sometimes you will see it turning like this. So it is not always in the anterior relation here. Okay. But these two are definitely in the anterior relation. Although we तीनों draw करते हैं, let's draw all three. So this is inferior thyroid, this is transverse cervical, and that is suprascapular artery, and they are in the anterior relation. One nerve you already know guys. What is the nerve present in front? The phrenic nerve. We were discussing it from a long time back. That phrenic nerve is present, and then phrenic nerve passes between the subclavian artery and subclavian vein के बीच में निकलता है. Carotid sheath. If carotid sheath is a content, you already know the contents of carotid sheath. There will be common carotid artery, there will be internal jugular vein, there will be vagus nerve is also there in the anterior relation. What is the posterior relation of carotid sheath guys? Posterior relation of carotid sheath is sympathetic chain. Look at that, you can see that. That is sympathetic chain also can be seen also in the anterior relation. So carotid sheath and content, sympathetic chain is the anterior relation. See again, because you know carotid sheath, so you know sympathetic chain is behind that. Phrenic nerve is there, three branches of the thyrocervical trunk is there, subclavian vein is also there, and clavicle, of course, ये तो obvious structure है, they are also in the anterior relation. The posterior relation, what do you have in the posterior relation? The subclavian artery, second part of subclavian artery is behind, and the trunks of brachial plexus are behind the scalenus anterior. Look into the relations. Of scalenus anterior. Well, to look into the relations of scalenus anterior, once again here we have the muscle. Drawing it slightly broader this time. The scalenus anterior, so let's start with the obvious relation that we have, the posterior one. We have this subclavian artery. Then we said the branches of subclavian artery, the thyrocervical trunk, and the three branches, 1, 2, and let me draw 3 like this only. Three branches of thyrocervical trunk can be seen. Carotid sheath and content, so let me just, for the sake of completion here, let us say this here is the carotid sheath. And of course, the contents of carotid sheath will be therein, which includes the common carotid artery, the artery will be there, the common and the ऊपर जाके internal carotid artery, the vein, that is the internal jugular vein will be there, and the nerve in between them, that is the vagus nerve. I'm not drawing it through and through, just for the memory sake. So that's the carotid sheath, and its contents. I don't have to say that carotid sheath. You already know what are the contents of carotid sheath. When you say contents of carotid sheath, obviously think about the posterior relation. Again, I'm not drawing it here. The posterior relation of the carotid sheath is the sympathetic chain. The posterior relation is the sympathetic chain. The nerve, phrenic nerve, will be seen passing in front. That's how the phrenic nerve is. We said the phrenic nerve will emerge from the upper bottom, that will be running in front. So that's phrenic nerve is also in the anterior relation. Okay, so coming to the anterior relation again, carotid sheath and its content, the posterior relation is the sympathetic chain, which also will be in the relation to the scalenus anterior. Phrenic nerve is also anterior. The three branches of the thyrocervical trunk, that is the inferior thyroid artery. Then we have, this is the, let me write it on this side only. Transverse cervical artery, and then this is the suprascapular artery. The suprascapular artery. Okay, so these are the anterior relations. Or what else we can add in the anterior relation? The vein, subclavian vein will be there. You've got a subclavian vein which is in front. And clavicle. The clavicle was also passing from the front. The clavicle is there as well. Subclavian vein and clavicle. So I wrote I wrote all the anterior relations here. Carotid sheath, its content, sympathetic chain, phrenic nerve, 3 branches of thyrocervical trunk, subclavian vein, clavicle, they are all anterior relations. But these are anterior relations. Two important posterior relations that you should write here is obviously one is subclavian artery, clearly you can see that, and then the trunks of brachial plexus, upper trunk, middle trunk and lower trunk will come out like this. The trunks of brachial plexus. So these two are the important posterior relations here. Trunks of brachial plexus, and subclavian artery. So trunks of brachial plexus and subclavian artery are the posterior relation. Well, you know, this relations of scalenus anterior, this can be a short note question also, a diagram draw type or a short note. And I'm not bothered about the questions here. I'm like, it is a very important to know about the relations of scalenus anterior, because in the root of neck, all these structures are very close by. So a surgeon who's dealing with the root of neck, he or she should have a very strong knowledge of the relations of the sternocleidomastoid as well as the relation of the scalenus anterior. So now we are in a very good position to talk about the triangles of the neck. We have all the raw material with us. अब इस raw material को use करते हैं to understand the triangles. Let me just take you to a picture first. Let me try to first help you identify the muscles which are forming the boundaries of the triangles, and then we'll draw it schematically, guys. It's always good to look at the images and then we'll move on. Here we go. Look at this picture. Like, there's so many muscles in there. We will justify all these muscles one by one. You know about few. Let's stick to them. Well, what muscle is that? The one we're highlighting here. That is the sternocleidomastoid, of course. That muscle here is the sternocleidomastoid. You can see it is having a sternal head. That is the sternal head, the one which I've just highlighted here. And this here is a clavicular origin, the clavicular head. This entire thing which I highlighted in yellow is a sternocleidomastoid. Two origin, sternal and cleido, that is clavicular, and attached to the mastoid process and to the superior nuchal line also. Then the muscle which is present at the back, this is the trapezius muscle. I wanted to people highlight, focus on the muscle which I'm highlighting here. That is the trapezius. You all read about the trapezius muscle in the upper limb also. That is the trapezius, big muscle there. Below is clavicle. Now, whatever triangle, because of the sternocleidomastoid, the entire neck is divided into two triangles. This whole thing here, is the posterior triangle of the neck. Okay? And everything left in the front here, this is the anterior triangle. So we can divide the side of neck in two triangles based on the muscle sternocleidomastoid. That's the most important muscle here, the sternocleidomastoid, and then that's how you divide the two triangles, the posterior and anterior. But how these triangles are divided further? These triangles are divided further by the muscles which are having double bellies, two bellies muscle. What is the two belly muscle? Digastric. If I may use a little different color here, look at this, guys. This muscle here is the anterior belly of digastric. I hope you can appreciate the blue color. And this here is the posterior belly of digastric. Anterior belly and posterior belly of digastric. And then there is a muscle that is omohyoid, the superior and the inferior belly. There we have the superior belly of omohyoid. This one is the superior belly of omohyoid. And this superior belly of omohyoid, deep to the sternocleidomastoid, will turn towards the scapula, that is inferior belly of omohyoid. Let me just quickly mark this muscle for you. That is sternocleidomastoid. This is the trapezius muscle. This here is the anterior belly of digastric. That is anterior belly of digastric. I'm going to draw everything with you again. This is posterior belly of digastric. Here is the superior belly of omohyoid. See, it is coming from the hyoid bone. Superior belly of omohyoid. And here we have inferior belly of omohyoid, which will all the way go to the suprascapular notch. You must have seen a notch on the scapula, the suprascapular notch. This is how the side of the neck is going to be divided into triangles, guys. Now what you see, that posterior triangle. Where was the posterior triangle? This is the posterior triangle. This posterior triangle beta is divided in two parts now. One which is above the inferior belly and one which is below the inferior belly. The small triangle below here. So this triangle which is present above is called as occipital triangle, and the triangle which is present below here is called as the subclavian triangle. And the simple reason, we have occipital artery coming into this triangle, we have subclavian artery present in this triangle. So the triangle is called as occipital, not suboccipital. Occipital triangle, pura triangle bade wala, that is occipital triangle, and the triangle below is subclavian triangle. Or you can call it supraclavicular triangle also, because it is above the clavicle, so you can call it supraclavicular triangle also. That is posterior. What about anterior? Now if you look carefully, in the anterior triangle, there are four subparts of anterior triangle. What are those four parts? If you see between posterior belly of digastric, superior belly of omohyoid, and sternocleidomastoid, this is the most important triangle we'll be discussing today, the carotid triangle. Your carotid vessels. We said the 5 branches of external carotid artery. So that's a carotid triangle. In front, above the anterior belly of digastric, from here till here, the base of mandible, this triangle here is called as a digastric triangle because it is present above the digastric muscle. So we call it digastric triangle. What gland is there? Submandibular gland. So you can also call it the submandibular triangle. Either you call it digastric triangle or you call it the submandibular triangle. Then we have a very, very small triangle which is present in front here, which is present above the hyoid bone, and you can only see half of that triangle. When you turn your head to one side, I can just see half of that triangle. That triangle is submental. Aapko submental triangle kaise dikhega? Like if I'm facing you, if I lift my head up like this is how you'll be able to see the entire submental triangle. That's the hyoid bone here. We have one anterior belly of digastric here, and one anterior belly of digastric is here. So between the two anterior belly of digastric like this and hyoid bone below, so that is a submental triangle. So when you turn your head to one side, I can only see half of submental triangle here. But that is third one. And the fourth one is a triangle which is actually like this. This is the triangle which is here. In this it doesn't look like a triangle exactly, but this is a triangle which is in front of the carotid and below the hyoid. The muscles which are present below the hyoid bone and in the midline. What muscles are those? Those are strap muscles. So this is a triangle which is having the strap muscles, and that's why we call it the muscular triangle. The sternothyroid, sternohyoid, omohyoid, some muscles here, all the strap muscles are there. And once you remove these strap muscles, you'll find the thyroid gland is situated in it. So thyroid gland is not the content of this triangle, muscles are the content, and that's why we call it the muscular triangle. That's why we call it the muscular triangle. So we have this one is carotid seed again, that is carotid triangle. This one is digastric triangle or submandibular. The one in front is the muscular because of the muscles, and this triangle is present below the mental protuberance, so we call it the submental triangle. The four parts of anterior triangle. Posterior triangle में we have two part. Posterior triangle we got two part. One above the inferior belly of omohyoid, that is the occipital triangle, and the one below here that is called as the subclavian triangle. उसमें occipital artery है, नीचे subclavian artery है. So that's why the name given to them. Let's get on with the diagrams and all. So guys, how we will show this picture? We'll show this picture from like if I turn my head to one side, I will be able to see all the side of the neck, and the triangles can be seen there. So let me draw it like this. This is the base of mandible. Here we have external auditory canal. Behind external auditory canal is the mastoid process, and then we have this occipital bone, right? Base of mandible, external auditory canal, the mastoid process, and occipital bone, right? These are all the bones that we have which are present over here. Base of mandible, the external auditory canal, then we have this mastoid process, and then finally the occipital bone. So this is basically the upper boundary for all the triangles in a way. I'm also trying to tell you that how to draw this in a schematic, because this is the anterior midline. Try to draw it with slight curve. There is a posterior midline, right? And here we have the manubrium, and this is the clavicle. You're looking at the side of the neck. That's how you can easily draw the side of the neck here. That's base of mandible, external auditory canal, mastoid process and occipital bone above, manubrium and clavicle below, and then you have an anterior and the posterior midline. The muscle, the main muscle which is dividing the triangle of neck, that is the sternocleidomastoid. So let's go with this. This is the sternocleidomastoid muscle having two origins. Below one is the sternal origin and there is a clavicular origin also. This muscle here is the sternocleidomastoid. This huge muscle at the back here, that is the trapezius muscle. The muscle that you will see at the back is trapezius. We're going to draw this kind of so-called, looks like a little complicated diagram once only. After that, we'll just follow the schematic line diagram only. This here is trapezius, right? Let me just quickly mark these muscles so that there is no confusion in the spaces. It's good that you draw with me at least once, because you obviously have to draw it in your exams also. The trapezius muscle, right? So you can see the two muscle and the triangle which I'm highlighting right now, that is a posterior triangle. This whole thing is a posterior triangle. The posterior triangle. I request you to try to label these muscles in short and along their length only. Like there is a trapezius muscle and this is the sternocleidomastoid. Please write them in short only because we have to show other muscles as well. To understand the divisions of the triangle, we said what we need is the hyoid bone, because the remaining muscle which are dividing the triangle are attached to hyoid only. So here we have a hyoid bone. Let's say this is the hyoid. You don't have to draw the hyoid bone with all the features. That's a hyoid bone. Digastric, guys. We have an anterior belly of digastric, which is like this. There is an anterior belly of digastric. And the one which is going backward to the mastoid process, that is a posterior belly of digastric. There is a posterior belly of digastric. And let me tell you, above the posterior belly of digastric, you will see one more muscle actually running along with it. That muscle is also coming in here. That is stylohyoid muscle. So when you look at the digastric triangle, you will see two muscles over there. One main is a posterior belly digastric, but stylohyoid is also there. If I just very quickly take you back again there, look at this. Can you see the two muscles over there? You can see posterior belly digastric, this one, and you can see another muscle which is there just above it, and then merging in the lower part to the hyoid only. That is stylohyoid. It's coming from the styloid process. So posterior belly digastric is attached to the mastoid process, and coming from the styloid process is the stylohyoid muscle, and both will contribute to the boundary of the digastric triangle above. So this is the anterior belly of digastric. Anterior belly of digastric. This here is the posterior belly of digastric, and this muscle is stylohyoid. Please make sure keep writing them in short only. Don't draw the line inside, otherwise your diagram badme samjh nahi aayega. And finally, omohyoid. We have a superior belly of omohyoid which will go deep to the sternocleidomastoid. You can see it is originating from the hyoid bone. It goes deep to the sternocleidomastoid, and then from the deep part, from there deeper to the sternocleidomastoid, there is a facial pulley present there, and from that pulley the muscle will turn toward the lateral side, will go to the suprascapular notch. That's the inferior belly of omohyoid. This is the superior belly of omohyoid, and here we have inferior belly of omohyoid which is extending into the posterior triangle, and that is how our side of the neck is divided in the triangles completely. Posterior triangle, guys. Let me write it here, and I'm trying to use the same highlighter. If you're using it, well and good, otherwise no issue. Posterior triangle, we have two parts of posterior triangle. Let me give them A and B. This is triangle A and this is triangle B. What is triangle A? Triangle A is occipital triangle. Triangle A is the occipital triangle. Call it occipital, don't call it suboccipital. Suboccipital is a different triangle which is present at the back of the neck. We're talking about the triangle on the side of the neck, right? On side definitely. And triangle B is called as the subclavian triangle. Subclavian vessels will be there. Subclavian triangle, also called as the supraclavicular triangle. It is above the clavicle. So it is also called the supraclavicular triangle. So we've got an occipital triangle above, and we have a subclavian or supraclavicular triangle which is present below. The two triangles. So that posterior triangle itself is a long question. We have so many important structures there, and very important, very interesting and important clinical anatomy also to be discussed from here. In fact, आप लोगों के लिए for the PGME exam also, they ask a lot of questions on posterior triangle. Then when you remove the lymph node from here, which nerve can get injured, what will be the features? So if you get a long question on the posterior triangle of the neck, we have enough content to write down. Especially in the clinical part, we have enough to write down. Coming to the anterior triangle, because anterior triangle we said is divided in four parts. Now, what four parts are there? There we have it. This is the one that is what triangle? That is a carotid triangle. Let me just quickly highlight those triangles for you first. That is a carotid triangle. The carotid vessels and all will be there. Then we have this triangle which is present below the mandible or between the digastric muscle, that is called as the digastric triangle. We have a very, very small triangle present in the front, that is above the hyoid bone and below the mental protuberance, that is a submental triangle. And then finally the triangle which is present right in front here, where we have all the strap muscles present, that is the muscular triangle. The 4 triangles in the anterior. Let's rub this off. Anterior triangle, guys. How about we give them numbers here? That is number 1. This is triangle number 2. This is triangle number 3. And this muscular triangle, that is called number 4. So what is triangle number 1? That is carotid triangle. That is carotid triangle. Triangle number 2 is the triangle number 2. It is popularly called as digestive triangle. Usually it's called digestive triangle, but because of the submandibular gland is situated here, the digestive triangle is also called as a submandibular triangle. Number 3, that small triangle which you can only see half from one side, that is submental triangle. And number 4, the triangle in front, that is the muscular. There is nothing much to discuss in the submental and muscular triangle. Muscular triangle we just have muscles. Submental triangle as a content we have just submental lymph node and submental vein is also there. So nothing much. The main content that is in the posterior carotid and digestive triangle. And as I said, my main motive here is to make you understand the continuity of the structures. If you talk about vagus nerve, so vagus nerve kahan jayegi? Glossopharyngeal nerve, hypoglossal nerve, cranial accessory nerve, spinal accessory nerve. So when you see these nerves, which triangle they will start, how they will go, where they will end, that we should be able to understand. So if you understood all these boundaries of the triangles, that how these triangles are formed, let us start with the posterior triangle, and I want you to draw it right. What schematic or easy diagram banayenge? Because this is the only complicated diagram, guys. Because we are trying to show the muscle the way they are. From now onwards, I will just draw a triangle like a triangle only. So have this picture in your head fixed. What triangle is where? What are the boundaries? So that we can write about it. Let us start with the posterior triangle, the very, very important posterior triangle of the neck. Boundaries. Well, what are the boundaries of the triangle? Boundaries of the triangle. What is the anterior boundary? If you look at the picture that you have, the one you drew, anterior boundary is by the sternocleidomastoid, or you can say the posterior border of sternocleidomastoid, isn't it? It's this posterior border of sternocleidomastoid which is the anterior boundary here. So anterior boundary is by the posterior border of sternocleidomastoid, whereas posterior border is by the anterior border of trapezius. Simple, eh? Posterior border of sternocleidomastoid, anterior border of trapezius. What about the base? It is a triangle, so it must be having a base and apex. The base and the apex. Base, guys, it is obviously by the clavicle, but not the entire clavicle, actually middle 1/3 of the clavicle. That is the one which is contributing to the base. The base of this posterior triangle is by the middle 1/3 of clavicle. More precisely, you can write the middle 1/3 of upper surface of the clavicle, of course. Middle 1/3 of upper surface of clavicle. And apex is formed by the sternocleidomastoid and trapezius junction above, which is at the superior nuchal line. Superior nuchal line. The junction of sternocleidomastoid and trapezius where? At superior nuchal line. That's the first thing, the boundary of the posterior triangle. Simple like आपको दिख रहा है diagram, it's the same thing. We are not like writing anything special or different. Posterior border of sternocleidomastoid, anterior border of trapezius. Base is by the middle 1/3 of the clavicle, and then apex is obviously by the sternocleidomastoid and trapezius. जहाँ पर join कर रहे हैं, that is at the superior nuchal line. After boundary, roof. See, that's how we usually discuss any fossa. When we even talk about the cubital fossa or axilla, or the people who read popliteal fossa in the lower limb, femoral triangle, we talk about any fossa. We first talk about the boundary, then we talk about the roof, then we talk about the floor, and then finally we talk about the content. तो पहले पूरा room तैयार करते हैं. Like if you start a building, if you just start making a building, people who must have seen the construction going on, how it starts. Actually, पहले wall बनती है. The first wall is formed. After wall, letter डलता है. That means roof is formed. After roof, then floor is formed, right? Floor बाद में. Once the roof is done, then the floor is formed. And after the entire thing is ready, then you put the content inside. उसके अंदर सामान रखते हैं अंदर. So this is like, it's a right way to answer. That's how it is done. So first, always talk about the boundary, then talk about the roof, then talk about the floor, and finally put the content inside. Roof of all the triangles that we're discussing here, posterior triangle, anterior triangle, whatever, superficial fascia, skin superficial fascia will be there, and this superficial fascia of the skin will be having a platysma muscle also. So I've kept a picture for you for this also. If you look at this muscle, platysma, guys, can you see that? The big muscle here, the platysma muscle. So within the superficial fascia, the platysma muscle is also there, and this platysma muscle is present on the roof of all the triangles. You can see the posterior triangle is here, the carotid triangle is here, the digestive triangle is here. So it is basically forming the roof of all the triangles. So skin, superficial fascia, and platysma in superficial fascia, ये तो हर triangle के roof में आपने लिखना ही है. That is, you have to write that in the roof of any triangle. So we got let me just write down the things that we can. That is skin, superficial fascia, and within superficial fascia there will be this platysma muscle. Skin, superficial fascia, platysma. Now there are other things to be added here, but let us understand those things with the help of a diagram. Posterior triangle, guys. The posterior triangle, there we go. This is the trapezius muscle at the back. That is sternocleidomastoid muscle here in front. Base is by the clavicle, and the muscle which is dividing this triangle in two parts is the inferior belly of omohyoid. I hope no confusion in this schematic diagram. That's how the posterior triangle was. Trapezius, sternocleidomastoid, clavicle, and the one which divides it is the omohyoid. I don't have to label it. What we said that superficial fascia obviously is there. That's a superficial fascia present. Apart from the skin, superficial fascia, and platysma, what else will be there in case? Again, something we discussed earlier. External jugular jugular vein is formed? External jugular vein was formed by the posterior division of retromandibular vein and posterior auricular vein. And these two veins unite together. The external jugular vein will run superficial to sternocleidomastoid, will come down and pierce the investing layer, and then it will go in. So it will basically, this roof here, we will be having an investing layer also. It's not only the superficial fascia and the platysma we have, deep to the platysma, the investing layer of deep cervical fascia will also be there. Investing layer will also be there because sternocleidomastoid and trapezius are forming the boundary. And I hope you remember from our discussion, guys, we said that both these muscles are enclosed in the investing layer. So we have investing layer covering this muscle, investing layer covering this muscle, so beach mein investing layer present hai. So roof mein we have investing layer also. The vein which is piercing it and coming down, that external jugular vein will be seen, which will come down like this, and it will pierce. It will ultimately go superficial to sternocleidomastoid, and as you can see, it is piercing this investing layer of deep cervical fascia to enter and drain into the subclavian vein. That's what the external jugular vein will do. Right? So this here, try to label it exactly where I'm doing it. This is the external jugular vein, which is one of the structure you can see in the roof now. Let's keep justifying every structure, guys. So one structure is external jugular vein, which we already know how it is formed. Why it is there? Because it is piercing the investing layer to drain into the subclavian vein. And let me remind you something again from the deep cervical fascia only, guys. Above the clavicle, what was the space above the clavicle? What space was present above the clavicle? The supraclavicular space. Remember, Burn's space was here and supraclavicular space was here. And two contents of supraclavicular space were, one is the external jugular vein and one is supraclavicular nerve, which we will see. Okay, what else is there here? Now, behind sternocleidomastoid, especially at the junction of upper 1/3 and lower 2/3, if I find out a point like somewhere here, at the junction of upper 2/3 and lower 1/3, there is a point from where 4 cutaneous nerve will come out. One will be seen running behind the sternocleidomastoid like this. One will emerge like this and run upward along with external jugular vein. That's important, the relation is important, along with external jugular vein. One will again go in front, deep to the external jugular vein, and will move forward like this. And then one will be first keep running deep inside, and then divides into 3 branches. It comes out as 3 branches, and that's a supraclavicular nerve. You already know there are 3 branches of supraclavicular nerve. So all these 4 cutaneous nerves are considered to be present in the roof also. What nerve is the one that you see going behind, guys? This nerve here is the lesser occipital nerve. Remember, lesser occipital nerve was also supplying the scalp. This is the lesser occipital nerve, which is also supplying the scalp, lesser occipital nerve. The root value for the lesser occipital nerve is C2. The one which is going above along with the external jugular vein, that is the great auricular nerve. The great auricular nerve will also go above, and this great auricular nerve is going to supply the lobule of the ear and angle of mandible. We will discuss that. It's a very important nerve. Clinically, it's very important. Great auricular nerve, that is, the root value is C2 and C3. The nerve which is running forward, the one which is running anterior forward, that is called as a transverse or anterior. एक ही बात है दोनों, या तो लिखो आप transverse, it is called as a transverse, or it is called as anterior cutaneous nerve of neck. Transverse or anterior cutaneous nerve of neck. Transverse or anterior cutaneous nerve of neck. And then finally we have a supraclavicular nerve. I will not tell you about the supraclavicular nerve. We already know it. We have 3 branches of supraclavicular. So transverse cutaneous nerve of neck root value is also C2 and C3. Transverse cutaneous nerve of neck root value is also C2 and C3. And then we have this supraclavicular nerves. 3 branches are there: medial, intermediate, and lateral. As you can see. If you remember, I told you that middle supraclavicular nerve or intermediate supraclavicular nerve sometimes pierces the clavicle to come down. And lateral supraclavicular nerve was responsible for the referred pain of the diaphragm to the shoulder. So something we have discussed in the deep cervical fascia already. But the 4 cutaneous nerve, and the important thing to be noted here that चारों cutaneous nerve एक ही point से निकल के बाहर आ रही है. They are piercing the investing layer of deep cervical fascia. Okay, 3 of them are actually emerging at one point. One is actually going a little deep from that point only, and then actually emerging in the lower part here. So this point here, this point where all these important cutaneous nerves are coming out from. Let me use a different color. This important point where all the cutaneous nerves are coming out from, this is also called as the nerve point. This is called as a nerve point. Supraclavicular nerve root value is also C. Supraclavicular root value is actually C3, C4, and sometimes C5 also. So lesser occipital nerve going post. Relation is important. When you draw this diagram, nobody is going to check your drawing skills, but they will check that whether you drew the diagram technically correct. Lesser occipital nerve, beta, it is behind the sternocleidomastoid. Great auricular nerve is superficial to sternocleidomastoid, and then along with external jugular vein. Anterior or transverse cutaneous nerve of neck. Now look at this. Anterior or transverse cutaneous nerve of neck will pass superficial to sternocleidomastoid first, but then deep to the external jugular vein, and then goes forward. And then supraclavicular nerve is also obviously passing superficial to the clavicle and coming down. So that's the 4 cutaneous nerve you will appreciate in the roof of the posterior triangle, right? Before I tell you anything about these 4 nerves and some important, especially some very important thing about the great auricular nerve, एक picture पे जरा नजर मारते हैं. Look at this image, guys. Do not focus on anything else. Just try to look for these 4 or 5 structures that we discussed in the posterior triangle. I want you people to focus only in this triangle, in the posterior triangle, and nowhere else. We first said external jugular vein. Can you see that? That's an external jugular vein. It is running superficial to the sternocleidomastoid, and in the lower part here, it will be piercing the investing layer. And you can see why it is piercing there, because to drain into what? Into the subclavian vein. I hope you can see the subclavian vein. 4 cutaneous nerve. From this point, the nerve point here, that is the 4 cutaneous nerve will be starting from here. One which is running behind the sternocleidomastoid and will be actually going and supplying the scalp also. That is the lesser occipital nerve. I can only see lesser occipital nerve in the upper part here. The reason is this picture is basically to show the carotid triangle mainly. तो उन्होंने इस इमेज में क्या किया, थोड़ा सा sternocleidomastoid को retract किया. They kind of retracted the sternocleidomastoid. Lesser occipital nerve is not very well seen. Lesser occipital nerve comes from cervical plexus और ऐसे loop करके ऊपर जाती है. It goes like this. So it can be seen. When you draw this diagram, make sure you draw it behind the sternocleidomastoid only. look at this. It is running superficial to sternocleidomastoid, but then passing deep to what? Deep to the external jugular vein. That is what transverse cutaneous nerve of neck. Don't worry about the branches. There are many branches, like 1, 2, 3, maybe 4. There are many branches of this nerve, but the nerve is simply transverse cutaneous nerve of the neck. Superficial to sternocleidomastoid, but deep to external jugular vein. Draw karte hue galti nahi karni. And then look at this vein nerve which is coming down. It is first running deep and then dividing into 3 branches. This branch number 1, this branch number 2, and that is branch number 3. What nerve is that? That is the supraclavicular nerve. So these are the 4 cutaneous nerve and external jugular vein, along with investing layer, platysma muscle and skin, which are forming the roof of the posterior triangle, right? Roof of the posterior triangle. अब इसके नीचे जो कंटेंट है वो कंटेंट्स है, don't bother about them guys. Don't look into the structures which is deep to that. Just focus on these. Okay. As I said, I got to tell you a little about this great auricular nerve. This is, as the name says, great auricular nerve. पहली बात तो आधे लोग उसका नाम गलत बोलते हैं. It is a great auricular nerve. It is not greater auricular nerve. Don't call it greater. It is great. Occipital nerves are 2. We have a lesser occipital, we have a greater occipital, and there is a third occipital nerve also. We saw it supplying the scalp behind the auricle. That's a great auricular nerve we are talking about, guys. See, what is the speciality or what are the things that you should remember about the great auricular nerve are, the first thing about the great auricular nerve is that it runs with external jugular vein. It runs with external jugular vein, right? That relation is important. Number 2, this great auricular nerve is supplying the skin of lobule of ear. Lobule, this part, lower 1/3. This portion is lobule. Upper 2/3 of auricle हो गया. The lower 1/3 is called as a lobule here, and it is completely supplying the lobule of the ear. इसका lateral surface है, medial surface. It is supplying both the surface here. So it is supplying the lobule of the ear completely. Lobule of the ear. There is a lower 1/3 I can say of the auricle is lobule. This nerve also supplies the skin at angle of mandible. This supplies the skin at the angle of mandible. This portion, this one, including the lobule of the ear, that is by the great auricular nerve. That is by the great auricular nerve. You can see the lobule of the ear is also covered in it, lobule of the ear, and skin at the angle of mandible. Skin at the angle of mandible is also covered in it. So that's a great auricular nerve here. इसको PG में क्वेश्चन पूछते भी हैं कि the skin of the face is completely supplied by the trigeminal nerve, but is there any nerve which, apart from trigeminal nerve, supply the skin of the face? And that is great auricular nerve. It is not the branch of trigeminal nerve, but it is still supplying the skin of the face at the angle of mandible. So that's why it becomes important. The great auricular nerve is the only non-trigeminal nerve. I can say that it is the only non-trigeminal nerve to supply the skin of the face at the angle of mandible. At the angle of mandible. We will talk about this great auricular nerve once again in the parotid gland. Why in the parotid gland? Because when it is supplying the skin at the angle of mandible, so obviously this is the parotid area only. This is the lower part of the parotid gland. So if the auriculotemporal nerve is injured, then sometimes auriculotemporal nerve will join with this, and that will lead to a sweating during chewing, which is called as the Fraze syndrome. I'm not going to talk about the Fraze syndrome here. The right time to discuss the Fraze syndrome is the parotid gland. But I'm telling you that this nerve is very, very important. And in the parotid gland surgery, this nerve can be injured. This nerve can be injured, or the accidental fusion can be there with this nerve. So there are some very important and very interesting clinical anatomy also related to this great auricular nerve. But that we'll discuss in the parotid gland surely. So that is, guys, this is about the roof. We just discussed the roof here. Now going to after the roof, the next thing we'll talk about is the floor. The floor. The floor of this posterior triangle is by the muscles which are actually, the prevertebral muscle, the muscle which are related to the vertebral column. Even in your MBBS curriculum, you don't have to remember these muscles in detail, except the scalene muscles. The muscles like splenius capitis, semispinalis capitis. When we'll discuss the base of the skull, we will just see where they are attached. But honestly speaking, you don't have to remember their origin, insertion, nerve supply, and action in detail. Not at all. For the posterior triangle point of view, yes, you should remember that what is the sequence of these muscles. Once again, if this here is the triangle, posterior triangle, the floor is formed by these muscles, guys. Like one muscle is there that you will see in the very much upper part, and there's another muscle here. And there's another muscle here. I'll show you these muscles, just write down with me. This is something which you have to kind of remember it, guys. This muscle here is called as the semispinalis capitis muscle. Capitis word came from caput. Caput means the base of the skull. That is called as caput. Head के लिए word caput use करते हैं. This next muscle is the splenius capitis. Again, don't bother too much about them. But just remember the name for now. If they are present in the floor of this posterior triangle, and that is like more than enough. You don't have to go into any kind of detail for these muscles. The important muscles to be remembered. This one, guys, levator scapulae. And then the 3 scalene muscle. That is the scalenus posterior. There is scalenus medius, and the most anteriorly we have this scalenus anterior. The scalenus posterior, medius, and anterior. Many books they just say scalenus medius, many say scalenus posterior medius, and some says all 3. Let me go with the one which is like covering everything, guys. Let's write all the scalene muscles are there in the floor. Scalenus anterior muscle, हालांकि just दिखती नहीं है because it is hidden deep to the sternocleidomastoid. Every time when I dissected the posterior triangle, I'm not able to see the scalenus anterior muscle in the floor. But again, I've seen some books actually say that it is in the floor. Even they say first digit of serratus anterior also. Imagine the first digit of serratus anterior. Serratus anterior is attached to first rib. So they're probably looking at the triangle from ऊपर से नीचे तरफ देख रहे हैं. We're not. So semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, all 3 scalene muscles basically. So they are the muscles which are forming the floor of this triangle. Before I tell you something added here, एक बार जरा फिर से आते हैं guys to the same picture where we saw the muscles forming the at this. This time we are looking at the posterior triangle, but we are looking at the floor. The one muscle which will be there very much higher. I can't appreciate that muscle as of now here. वो सिर्फ ऊपर वाले part में होगी. That will be the semi-spinalis capitis muscle. This muscle here is the splenius capitis. This is levator scapula. That's an important muscle. Remember, I'll tell you why it is important. And then we have the scalenus posterior, scalenus medius, and that is scalenus anterior. They have shown scalenus anterior also. That is scalenus anterior. You can in fact see the brachial plexus. Can you see the brachial plexus is present between the scalenus medius and scalenus anterior के बीच में? Okay. So these are the muscles present in the floor. So what muscles are these, beta? What if you remember? At least you remember the scalene muscles. When we discuss the deep cervical fascia, scalene muscles are attached to the vertebral column. These other muscles are also attached to the vertebral column. So they must be covered with what fascia? They must be covered with the prevertebral fascia. So when you look at the floor of the posterior triangle, the floor of the posterior triangle is made up of all these prevertebral muscles, and all these muscles, they are covered with prevertebral fascia. These are prevertebral muscles. So fascia is also prevertebral fascia. The fascia here is a prevertebral fascia. So when you talk about the floor में it's like that you put a tile in the floor. बहुत सारा आपने floor बनाते बहुत सारे tile लगाए अपने floor के अंदर, and then you just lay the carpet on it. So it's like the muscles are like the tiles over there, and the carpet is this fascia here. The prevertebral fascia is a carpet. In fact, it is called as a carpet also. It is called as the carpet of the posterior triangle. This prevertebral fascia is also called as the carpet of the posterior triangle. And it's a very protective carpet also. I'll tell you why it is a protective carpet. Because the major contents of the posterior triangle are present deep to that carpet. Content will be on the muscles only. Whatever content we'll discuss, not all of them, most of them. The major contents like subclavian vessel, brachial plexus, they are all present on the muscle here, but deep to the prevertebral fascia. So prevertebral fascia is basically protecting all those structures. So this carpet of the posterior triangle is very important because it provides protection to the structures in the neck here. But there are few contents which are obviously present in the roof or which are present superficial to this prevertebral fascia, and that's why they are vulnerable to injury also. So done with the boundary, done with the roof, done with the floor, come to finally to the contents. Guys, the contents of the posterior triangle के लिए, once again, let me just put the triangle here. There we go. This is the trapezius, sternocleidomastoid, clavicle, the dividing muscle, that is omohyoid. Just for our sake, I'm kind of just separating this triangle so that you can understand that what content is specifically in which triangle here. Let's start with the one above, guys. The one above is the occipital triangle, the one below is a subclavian or supraclavicular triangle. Both are part of posterior only. We said that the reason we call upper triangle as occipital because of the occipital artery. If you remember the 5 branches of the external carotid artery which are given off in the carotid triangle, out of those 2 branches are running backward. One was occipital and one was posterior auricular. So carotid triangle will be somewhere here. Obviously carotid triangle is somewhere here. So occipital artery will come from the carotid triangle and you will see it running as a content of this triangle, and that's how it goes backwards here. So one main content beta यहाँ पर is occipital artery. Sternocleidomastoid and trapezius, they both are supplied by the spinal accessory nerve. We discussed it yesterday. So spinal accessory nerve will also be coming somewhere from the base of the skull like this, and it will be coming down. And then what you'll see, that spinal accessory nerve is passing deep to the sternocleidomastoid, supplying it obviously, and then it goes deep to the trapezius muscle, and that's where it will be gone, vanished. So that's the important nerve supplying both the muscle, and that is spinal accessory nerve, the 11th nerve. Now, the reason I put an arrow there so that आपको याद रहे कि what direction the structure is running, how it is coming. Sternocleidomastoid and trapezius, they also have some additional nerve supplying them. Sometimes they come individually, sometimes they will join with the spinal nerve. Sometimes they will join with the spinal nerve and come down, and that is to take proprioception from the sternocleidomastoid and trapezius. So that nerve are the C3, C4 nerve. The cervical spinal nerves only, which are taking the sensation, proprioceptive sensation. That is C3, C4. So these C3, C4 are not motor nerves. They are not supplying the sternocleidomastoid and trapezius. They are just taking what? They are taking proprioception from them. They are the nerve carrying the proprioception. That also will be seen there. If I take you to the triangle below here, this triangle, obviously it's a subclavian triangle, so we'll be having subclavian vein and artery. We know that subclavian vein is present in front. If you go with the relation, guys, we know that subclavian vein was the anterior relation of scalenus anterior, and subclavian artery was the posterior relation. So subclavian artery will be at the back. That's subclavian artery and subclavian vein. Along with that, between scalenus anterior and medius, the trunks of brachial plexus will be coming out. We'll be having the upper trunk, middle trunk, and the lower trunk of brachial plexus. Don't have to draw anything fancy here. Just simple diagram to remember the content here. These are the trunks of brachial plexus. These are the trunks of brachial plexus. And we got subclavian vessels. And when I say subclavian vessel, I'm basically looking at mainly the third part of the subclavian artery, the one which is after the scalenus anterior. This is what you need to draw. I can obviously add some more content, but that we'll write it down. Don't have to draw anything. So even for your exam, guys, when you're drawing, when you're writing about the posterior triangle, do not waste by just drawing some branches of the trunks of brachial plexus, subclavian artery. Important content you should draw. Occipital artery, spinal accessory nerve, proprioceptive nerve coming from C3, C4. Sometimes they're joined with the spinal accessory only. Trunks of brachial plexus and subclavian vessels. More than enough the structures we need to draw in the content separately. How the content, when I start writing the content will increase. Why it will increase, guys? For 2 reasons. Ek to, the structures that we saw here in the roof, the structure that you saw in the roof, they're actually coming from the content only, na? But how they went into the roof? They first were coming from the cervical plexus, or anyway, they're coming from the cervical plexus, which is actually present deep, And then these branches, the great auricular nerve, the lesser occipital nerve, will go toward the roof, and then they'll come out from the roof here. So whatever nerve we wrote here, whatever nerves we wrote here, they are in the content also. The beginning part is in the content. वो पहले अंदर है, deep है. External jugular vein is also going deep to drain into subclavian vein. So terminal part of external jugular vein is also content. And then whatever content we discussed here, anyways they are content only. And how will you add more to these contents? Again, this is something, again, sequence is important. Whatever we discussed earlier will help you guys. If you know the trunks of brachial plexus, we know in the trunks of brachial plexus only upper trunk gives of the branch. Which two branches are coming from the upper trunk of brachial plexus? Suprascapular nerve, nerve to subclavius. Don't draw it. You can simply write that suprascapular nerve and nerve to subclavius will also be seen in this triangle. Subclavian artery is present there. Now, what was the branch of subclavian artery which we said the branch will be running transversely? And transverse cervical artery will be coming, and that transverse cervical artery is having an ascending branch also, which is going upward. So transverse cervical artery is also the content. Subclavian artery and one of the branch of thyrocervical trunk, that is transverse cervical artery, will be the content. You don't have to draw it. We can identify them in the atlas image also. But when it comes to writing the content down, let's write like this, guys. The content includes the initial part of what? Lesser occipital nerve, great auricular nerve, transverse cutaneous nerve of neck, and supraclavicular nerve. Agree? All the nerves that you saw in the roof, unka initial part, lesser occipital nerve, great auricular nerve, transverse cutaneous nerve of neck, supraclavicular nerve. Then what content? External jugular vein. External jugular vein, what part of external jugular vein? Terminal part. Because it is going below down and then it is piercing the investing layer of deep cervical fascia. That is where. And because external jugular vein is piercing the investing layer of deep cervical fascia, I told you this earlier also, the walls of the external jugular vein are actually adherent to the investing layer. And that is why if there is any rupture, if somebody get a stab wound injury, if somebody get like, is a knife stab in the neck. So if your external jugular vein is punctured, you have to put a pressure on this immediately, on the external jugular vein. Even if you doubt there is a puncture of external jugular vein, make sure that the pressure should be applied to the external jugular vein, because if the air embolism goes inside the external jugular vein, that can even kill a person. What else apart from this, guys? In the content we said occipital artery will be there. Occipital artery, which is actually running backward through the triangle. The spinal accessory nerve, which is coming there to supply the sternocleidomastoid and trapezius. C3 and C4 proprioceptive nerves. C3 and C4 proprioceptive nerves will be there. So this is where you have to add, guys. Trunks of brachial plexus. Trunks of brachial plexus will be there, and you already know that out of the 3 trunks of brachial plexus, only upper trunk will give the branch. Middle trunk or lower trunks the branch nahi hoti. So from the upper trunk, we have 2 branches which are coming out. One is the suprascapular nerve, and one is the nerve to subclavius, which are also considered as a content. Suprascapular nerve, nerve to subclavius. Subclavian vein. Subclavian artery will be there, and a branch of subclavian artery which will be flaring in this triangle as a transversely run kar raha hoga, there is a transverse cervical artery. The transverse cervical artery mainly will be seen running in this triangle. All sorry branches subclavian artery, but the transverse cervical artery, the name says transverse, it is running transversely in the neck, will be seen in this triangle also. So these are the overall contents of this triangle, which I'll show you in the picture. Overall contents of this triangle. But there is a very special discussion which is coming up on the spinal accessory nerve, guys. It's a very, very interesting discussion on this. But before that, let me quickly show you the content in the picture here. Then I will talk about the spinal accessory. Same picture again, nothing new. Look at this. This time, I wanted to focus on actually everything, because I told you the structure which are in the roof are also the content. So one lesser occipital nerve that is above, that you can see the above was there. Let's focus on the other things. In the content, we have to write the great auricular nerve is also there. We have to write the terminal part of external jugular vein also we have to mention. We have to mention the transverse cutaneous nerve as well. Now look at this nerve running inside, that is the spinal accessory nerve. The spinal accessory nerve. I hope you can see the supraclavicular nerve also, that is supraclavicular nerve. Okay. Then, can you see the trunks of brachial plexus? Look at this, all these are the trunks of brachial plexus. These are the trunks of brachial plexus. Below that, you can see the subclavian vessels. Subclavian vessels can be seen. And the one main branch, guys, I tell you, one main branch of the subclavian artery that you need to focus on here is this one. The transverse cervical artery. That is the one which is actually running transversely in the neck, the transverse cervical artery. It's a branch of subclavian only. It is coming from where? It is coming from the first part. Transverse cervical is a branch of thyrocervical trunk. Okay. Third part, क्योंकि आपको third part दिख रहा है, तो dorsal scapular artery can also be mentioned there. In the content, you can write down. I told you dorsal scapular artery is not always present. Dorsal scapular artery is not always present, but if at all dorsal scapular artery is present, that also will be counted as a content there. Dorsal scapular artery. इन्होंने बेटा suprascapular artery भी दिखाया हुआ है. They have shown the suprascapular artery, but many authors say that नहीं दिखता है, suprascapular artery is not seen. The dorsal scapular artery that you should mention. If you want to write this also, you can write that also, suprascapular artery. Both suprascapular artery and transverse cervical artery is coming from the thyrocervical trunk. So you can, they are the branches of thyrocervical trunk which are running horizontally over the scalenus anterior. They are the one which are seen as a content. Visible होते content now. I hope you are able to appreciate the contents at least. So we can see the floor also, we can see the content also. Everything can be seen simultaneously. Boundaries, floor, content, roof. My fascia is not shown. Otherwise, everything else is shown in there. A little discussion that I have to have on this nerve, that is spinal accessory nerve. But I told you that major content. I'm not talking about the cutaneous nerve. I'm not talking about the external jugular vein. The major content like subclavian vessels, trunks of brachial plexus, these contents of the brachial plexus or of the posterior triangle are present deep to what fascia? Prevertebral fascia. So they are protected. Prevertebral fascia is covering them, so they are protected. But spinal accessory nerve is running superficial. Spinal accessory nerve is present superficial to prevertebral fascia. It is deep to investing layer. Obviously, it is deep to investing layer. Investing layer is forming the roof, but it is superficial to what? Prevertebral fascia. And because spinal accessory nerve, that's a very, very important thing. It is a content running. It is a content running superficial to prevertebral fascia. The major content, one of the major content running superficial to prevertebral fascia is the superficial, is the spinal accessory nerve. And why it is important? Because if this nerve is running superficial to prevertebral fascia, so obviously this nerve is susceptible to injury in the posterior triangle. There's injury to posterior. When we do if there is any surgical intervention in the neck, अगर आप कोई भी surgery कर रहे neck, and especially when you have to do when you want to remove any lymph node from the posterior triangle, कोई swollen lymph node आपको remove करना है, or you want to do the lymph node biopsy, then the spinal accessory nerve is the one which is actually vulnerable to injury because उसकी placement ही ऐसी है, just deep to the investing layer. So injury to spinal accessory nerve is a very, very common thing which is seen in the surgeries of the posterior triangle. Because it is superficial to prevertebral fascia, so spinal accessory nerve, it can be injured in posterior triangle surgeries or any surgical intervention, lymph node biopsy or removal of lymph node, whatever it is, the spinal accessory nerve can be injured in posterior triangle. Now, when I ask this question even to the interns and post-intern, then I will say, okay, spinal accessory nerve is injured. Now, what will happen? Then everyone will say the sternocleidomastoid and trapezius muscle will be paralyzed, and obviously there will be feature according to that. But फिर हम ये चीज भूल जाते हैं यहाँ पर, if this spinal accessory nerve is passing deep to the sternocleidomastoid and then coming into this triangle and then going to the trapezius. If the nerve is injured here, beta, if the nerve is injured in the posterior triangle, here, only muscle to get affected is the trapezius muscle. Sternocleidomastoid तो पहले supply हो गया. It is supplying the sternocleidomastoid first and then going into the posterior triangle. No? So every time they say injury to spinal accessory nerve in posterior triangle, you have to remember that sternocleidomastoid is spared. वो तो बच जाएगा ना. So don't think about the sternocleidomastoid. Sternocleidomastoid is spared. Trapezius is involved. Trapezius is involved. And when the trapezius muscle is involved, what will it lead to? What are the functions, overall functions of trapezius muscle? Now, upper border of trapezius muscle, upper fibers of trapezius muscle are for the shrugging of shoulders. Middle fiber of trapezius are for the retraction of the scapula. Then upper fibers and lower fiber of trapezius together, they help in the overhead abduction also. You know, serratus anterior and the trapezius, they together helps in the overhead abduction also. So they are all function of trapezius. So because trapezius muscle is involved, the three main things that you will notice here is, number one, you will see there is difficulty in shrugging of shoulders. There is difficulty in shrugging of shoulders. Number two, there will be difficulty in retraction of the scapula. Difficulty in the retraction of scapula because this muscle is responsible for the retraction of the scapula. Middle fiber are doing the retraction of scapula, and there also will be difficulty in overhead abduction. Abduction above 90 degree will be very difficult because only serratus anterior is working. We need two muscles for overhead abduction. Overhead abduction is done by the rotation of the scapula, and rotation of scapula is done by the serratus anterior as well as by the trapezius. Trapezius काम नहीं कर रहा है, so there is a difficulty. It's not, nothing is lost here. It's all difficulty. Difficulty in shrugging of shoulder, difficulty in retraction, because retraction can be done by the rhomboides, major rhomboides, minor also. There is a difficulty in the retraction, and there is a difficulty in the overhead abduction also. So this is about the posterior triangle. Not that difficult, right? If you just go in a sequence, so it's all understandable there, and I'm sure if you just try to draw this schematic diagram once with your own hand, you will be able to remember these contents easily.
Part 2.
Anterior triangle, I was saying either the whole anterior triangle will come as a long question, or they might give you carotid triangle or digastric triangle separately also. So let us start our discussion with this triangle, the carotid triangle. Now what you can see in this picture itself, this carotid triangle, three boundaries, guys. We have a boundary that is present posteriorly, sternocleidomastoid, anterior superiorly, because anteriorly or superiorly, anterior superiorly and anterior inferiorly. We have posterior belly of digastric and superior belly of omohyoid. So let's start it from there itself. Carotid triangle. So boundaries, as I said, the boundaries are, we have first posterior boundary. Posterior boundary is by the anterior border of sternocleidomastoid. This time it's the anterior border, na? It's the anterior border of sternocleidomastoid. Anterior superiorly, it is the posterior belly of digastric, and anterior inferiorly, it is the superior belly of omohyoid. First thing first, the boundaries. Anterior border of sternocleidomastoid is the posterior boundary, then anterior superior and anterior inferior. Posterior belly of digastric and superior belly of omohyoid. Roof, guys, again, said nothing to draw in the roof of the carotid triangle because it is very much understood that what will be there in the roof. See, roof of this triangle will be having once again skin. There will be superficial fascia. The skin, the superficial fascia. Along with superficial fascia, again, which muscle in the superficial fascia? The platysma muscle will be there. Now, what else, guys? Platysma is supplied by what now? Platysma is supplied by the cervical branch of facial nerve. Out of the 5 branches, the cervical branch of facial nerve will be actually crossing this digastric triangle and then coming into this triangle here, carotid. Posterior में नहीं हो. So the 5 branches of this facial nerve we know, and this is the cervical branch of facial nerve, which also will be seen in the roof of this triangle. That is supplying platysma. So platysma muscle will be seen, and the nerve supply of platysma, that is by the cervical branch of facial nerve. Remember that the cervical branch of facial nerve, it supplies platysma only. Supplies platysma only. And is there any other content, or is there any other structure in the roof of posterior triangle you can think of which will be there in the anterior triangle, guys? What was the nerve present in the posterior triangle in the roof which was running forwards? Remember, that was a transverse cutaneous nerve of the neck. So normally transverse cutaneous, that will come in front, but that also will be there in the roof. So you will have a transverse cutaneous nerve of neck. So all these structures will be there in the roof. The skin, the superficial fascia, the muscle in the superficial fascia, platysma, cervical branch of facial nerve which is supplying the platysma, and then transverse cutaneous nerve of the neck also. The two diagrams that we need here is to understand the floor and to understand the content, guys. To understand the floor and the content. See, if I have to show you the carotid triangle somewhere here, where is the carotid triangle, guys? But let me just put the carotid triangle for you. Now the muscle here is the sternocleidomastoid. The sternocleidomastoid will be going like this. The sternocleidomastoid muscle will be going like this. This here will be the posterior belly of digastric and stylohyoid will be there. And obviously the superior belly of omohyoid will be, let us say, something like this. Just trying to tell you that this is a portion which is covered by this triangle, that is a carotid triangle. That's where the carotid triangle is between these 3 muscles. So we have a sternocleidomastoid, that is the posterior belly of digastric and superior belly of omohyoid. Okay, look at the muscle which you see deep to it, and what are the structures that you will see deep, and that will help you. Now I can see a part of hyoid bone extending inside, right? That is a hyoid bone extending inside, guys. And I can see a part of thyroid cartilage is also extending inside. If thyroid cartilage and hyoid bone are present, then obviously what membrane will be there? The thyrohyoid membrane. We discussed that. So thyrohyoid membrane is there. What is the muscle which is present between the thyroid and hyoid? That's the smallest strap muscle. That's the thyrohyoid muscle. Not shown in this. This is a picture for the pharynx actually. So we have a muscle here called as a thyrohyoid. A muscle which is present with thyroid and hyoid, that is thyrohyoid muscle will be there. So muscle is also there. Membrane is also there. Achha, what else? What other muscle you will see? What constrictor is that? The one which comes from thyroid cartilage. So we have the inferior constrictor. You can see a part of inferior constrictor in the floor of the triangle, and you can see a major chunk of the middle constrictor in the floor of this triangle. So I can see middle constrictor and inferior constrictor there, along with one more muscle that you can see, which is originating from the hyoid bone. Look at that, and going above, and that is going to the tongue. That's a muscle coming from hyoid bone and going to the tongue. That is hyoglossus muscle. From the hyoid bone to the tongue, that is hyoglossus. So overall, you will be able to see 4 muscles. Which 4 muscle? And out of the 4 muscles, 3 are attached to hyoid bone only. Imagine, one is hyoglossus attached to the hyoid, middle constrictor attached to hyoid, and thyrohyoid also attached to hyoid. And then you will see a muscle that is which constrictor? That inferior constrictor is also there. So 2 constrictors, one is thyrohyoid and one is the hyoglossus. The 4 muscles along with the thyrohyoid membrane are present in the floor of the carotid, of this carotid triangle here. Because if you look at this picture of the triangle here, not all the muscles will be visible from here because they are kind of hidden by some other structures there. So not everything is visible, but yeah, you can still see a constrictor muscle can be seen. You can see the inferior constrictor can be seen, a part of middle constrictor can be seen, but hyoglossus is also there in this. Hyoglossus is also there. Let me draw it for you, and then it will be easy for you to remember. So as I said, to understand the, let us say the hyoid bone, the thyroid cartilage, the membrane in between, that is thyrohyoid membrane. That's a thyrohyoid membrane. A muscle which is we said originating from the hyoid bone and going above to the tongue, that is a hyoglossus muscle. That's how it is. That's a hyoglossus muscle. It will go from the greater corner of the hyoid as hyoglossus. The constrictor muscle which will originate from the oblique line of thyroid cartilage, that is the inferior constrictor. It's a part of inferior constrictor called as thyropharyngeus, inferior constrictor. One constrictor which you will see coming from the hyoid bone itself, that is the middle constrictor. And then muscle which is stretching between these 2. So we have a muscle also between the thyroid and hyoid along with the membrane. Make sure you draw the boundary in such a way that all these are covered in this, all these 4 muscles are covered in this. So we said we have the sternocleidomastoid there. This is the, let us say, the sternocleidomastoid. To the hyoid bone, obviously that will be the posterior belly of digastric, and this, let us say, is the superior belly of omohyoid. So yeah, it's my suggestion to you that when you draw the floor of the carotid triangle, it is always wise to draw the structure in the floor and then draw the triangle on it. A triangle draw it will be a bit difficult. So this is the hyoglossus, the muscle of the tongue which is originating from the hyoid bone, hyoglossus. Here we have middle constrictor. And still the discussion on all these are still pending. I mean, we have to discuss the hyoglossus muscle when we talk about the tongue in detail. Tongue is a long question. Pharynx is a long question. We will be discussing about the pharynx. So we will be talking about this middle constrictor muscle and everything. So all these things will keep on coming up again and again. Even if you understand this now, so imagine how strong your concept will be by the time you reach the detail of all these. That what exactly is the precise origin of the middle constrictor or inferior constrictor or hyoglossus. This is inferior constrictor, especially the thyropharyngeus part, that is the inferior constrictor. And there we have thyrohyoid, muscle and membrane, both. Thyrohyoid, muscle, membrane, they are all present in the floor of the carotid triangle. This सब कुछ floor में है. That is all in the floor. The four muscles and a membrane. Middle and inferior constrictor, hyoglossus muscle, thyrohyoid muscle, along with a membrane deep to it, that is a thyrohyoid membrane. So finally coming to the contents here. The contents of this triangle. So this is, again, whatever contents we have in this triangle, every single content we've already discussed. Carotid artery will be there. We've discussed the carotid artery and its branches. Carotid sheath will be there. We've discussed the carotid sheath. Internal jugular vein is a content of carotid sheath. Vagus nerve, we've discussed vagus nerve yesterday. Glossopharyngeal nerve we have discussed. We've discussed that accessory nerve. Hypoglossal nerve we have discussed. So whatever is going to be the content here, we have kind of discussed them already. Now I want all of you guys to draw one diagram with me. And I want you people really to practice this diagram and try to revise it as soon as possible. Try to draw this diagram one more time because it's a very important, technically very important diagram. This diagram will not only help you remember the contents of carotid triangle, it will also help you remember the difficult content of the digastric triangle. So, दोनों triangle content cover हो जाएंगे इसके अंदर, and also you will get a very good orientation about the arrangement of the structures in the neck here, on the side of the neck, in the anterior triangle. So, before I start writing the content or draw this content separately, I want you to draw this diagram with me, which is a little elaborate diagram, in which we are covering two things. We are covering the content of carotid triangle, and we are going higher also. Time लेना भले आराम से, but draw it nice and easy, guys. Okay, this here is the common carotid artery and internal carotid artery. Let's say that's a common carotid and internal carotid. The one which will emerge out as a branch, that is the external carotid. Right, so this is the common carotid artery dividing into internal and external. I don't have to tell you which one is internal, which one is external. We know internal carotid artery is in line with the common carotid. So we will label everything at the end. Just keep drawing with me. If this is internal carotid and that is common carotid, obviously internal jugular vein is along with them in the carotid sheath. What I request you here, although there is no gap in between at all, they are very close to each other. But I want you to draw the internal jugular vein slightly away from this artery so that I can show you important nerves in between. Not very far, not very close. Just leave a little gap in between, guys. Let us say this here is the internal jugular vein, which is also the content of the carotid sheath. Please keep drawing it with me, because you and try to remember the sequence in which I'm drawing, because that way you will remember how to draw it and how to draw it technically. The diagram should be technically correct. The nerve we expect to see in between. The vagus nerve, right? There has to be the vagus nerve in there. So let us say this is the inferior ganglion of the vagus nerve. Yesterday we said we have a superior ganglion and inferior ganglion. So let me start from inferior ganglion. And there is the main vagus nerve running in between the two. It is very much sandwiched between these two structures, so it's not easy to see the vagus nerve. When you open the carotid triangle, आपको दिखता नहीं है vagus nerve. You actually have to separate the internal jugular vein and carotid artery, then only you are able to appreciate this vagus nerve in between them. I'm just using a little highlighter here because I really want this diagram to go well. One time investment है बेटा, draw कर लो अच्छा रहेगा. So there is the artery, whatever red color you have, that's the only access to red I have for the highlighter, although it is orange. So that is the carotid artery, common carotid, carotid sinus will be there, and then we have the internal jugular vein, of course. The reason for I'm putting a color in this because I have to show you some structures which are actually passing between the external carotid and internal carotid. That is the main thing which I want to tell you here, that there are certain structures which are present between the common carotid, internal carotid and external carotid that I have to show. So the few structures which you will appreciate passing between running between the internal carotid and this external carotid will be, first of all, two nerves will be there, and there the branches of one branch of vagus nerve will be seen passing in between. So you will see it is going between, like it is superficial to the internal carotid and it is deep to the external carotid. That's a branch of vagus nerve you will see passing in between. Make sure you draw it in this way that they are in between the two. This internal carotid artery is deep and external carotid artery is superficial to this nerve, and this nerve here is the pharyngeal branch. This is the pharyngeal branch of the vagus nerve. That is the pharyngeal branch. Of course, it's coming from the vagus. That is pharyngeal branch of vagus nerve. Glossopharyngeal nerve. See, carotid sheath content of these are the contents of carotid sheath, right? These are all the content of carotid sheath: internal carotid artery and internal jugular vein and the vagus nerve. But because carotid sheath is going above and fusing with the jugular foramen, so whatever other nerves will come from jugular foramen, they also have to pierce the carotid sheath. The other nerves which are coming out of the jugular foramen, when they come out, because carotid sheath is attached to the margin of jugular foramen above, so obviously that those nerves have to pierce this carotid sheath and then only they can come out. Like glossopharyngeal nerve, like 11th nerve, they are also coming out of the jugular foramen only. But jugular foramen is giving attachment to the carotid sheath. That's why those nerve pierces and comes out. Like just above this pharyngeal branch, you will see again passing in between is the glossopharyngeal nerve. See, this is deep and this is superficial. Again passing same, just like pharyngeal branch. Above that you will see what this is the glossopharyngeal nerve. 9th nerve is coming in. That is basically piercing the carotid sheath and coming out. Piercing the carotid sheath and coming out. Then the nerve that we see in the posterior triangle, guys, what triangle will be here at the back? Posterior. This is carotid triangle, somewhere in the carotid triangle, somewhere here is a posterior triangle. The nerve that we saw in the carotid triangle, that's spinal accessory nerve. Spinal accessory nerve is also coming from the jugular foramen, so that nerve also will be seen passing like this, and then it is obviously becoming the content of the posterior triangle. So that is the spinal accessory nerve will also be there. Spinal accessory nerve will also be there. What else? What about hypoglossal nerve, guys? 12th nerve. Now, first of all, as I said, there's no harm in writing it. 9th nerve and pharyngeal branch of vagus nerve, they are present in between internal carotid and external carotid. Hypoglossal nerve comes from the hypoglossal canal. which is more posterior. So hypoglossal nerve will start from more posterior from the hypoglossal canal, and what you'll see, hypoglossal nerve will pass superficial to everything. It will pass superficial to everything. It is not bothered about in between or anything. It will just pass superficial to everything here. So hypoglossal nerve, when you draw, just you keep a free hand, it will go like this and will go in this manner. So that is the hypoglossal nerve, and if you want, you can write it there. It is passing superficial to the vagus nerve, the spinal accessory nerve, the superficial to the internal carotid, superficial to external carotid, superficial to all these structures. It is passing superficial to all these structures. Unlike those two, ninth nerve and pharyngeal branch of vagus, which is in between the external carotid and internal carotid. Guys, if this is hypoglossal nerve, I'm pretty sure that you will not have difficulty in identifying what is this. Descendens hypoglossi. If this is descendens hypoglossi coming from hypoglossal nerve, so obviously descendens cervicalis will be coming from the cervical root C2 and C3. So let us just example here, let us say C2 and C3 somewhere here. So C2 and C3 will meet and form the descendens, and that's how the anther cervicalis is formed. So as we said, that anterior relation of carotid sheath is anther cervicalis. You can see that is the anterior relation of carotid sheath. These are all contents of carotid sheath here. My diagram is going technically correct here. So we have descendens hypoglossi, which is running exactly in front of the internal carotid artery and common carotid, and then you will see that's descendens cervicalis together forming the ansa cervicalis. Anther cervicalis. Let me add one more here, one more note here. Again, as I said, no, this is just for your own understanding, guys. I mean, you don't have to draw such a detailed diagram. Maybe the examiner will not check कि आपने दोनों nerve इनके पीछे बनाई नहीं बनाई. This is for your own good. If you remember one more branch of vagus nerve that we discussed yesterday, the superior laryngeal nerve, and we said superior laryngeal nerve will divide into internal laryngeal and external laryngeal. See how superior laryngeal nerve will. Superior laryngeal nerve will pass deep to all these. These two nerves are deep to external carotid. This is internal carotid. Now, even deep to internal carotid is another branch of vagus. Look at this. That branch of vagus nerve which is passing deep to internal carotid will come like this. Will go in here. Will come like this. And divide into two branches. So that nerve is what? That is a superior laryngeal nerve. That nerve over there, let me just kind of highlight that now so that there's already too many nerves in there, quick confusion now. So this one, that's a superior laryngeal nerve which is going to divide into two branches. Which two branches? One is internal laryngeal nerve which will pierce the thyroid membrane, and external laryngeal nerve which is supplying the cricothyroid. Okay. Now, as I said, this diagram is also going to be helpful in understanding the triangle which is above. That's why I wanted to draw this picture here. Now I need a demarcation. I need a line here which separates the carotid triangle. There must be carotid. These are the contents of carotid triangle here. They are the contents of carotid triangle, which I'm going to put it in the diagram again. But what I want to tell you here is that what is the line here which is demarcating the content of carotid triangle, and the above is digestive triangle. So, एक line draw करते हैं. I'm drawing a very thick line here and using a different color also so that I can clearly show you the demarcation. Remember hypoglossal nerve, guys. Hypoglossal nerve is a content of both triangle. It is content of digestive triangle as well as the content of the carotid triangle. So make sure the line should be above the hypoglossal nerve, something like this. That's basically is a posterior belly of digastric. It is just like a posterior belly of digastric. That line over there is like a posterior belly of digastric. Whatever you see above there, they are contents of what triangle? Digastric triangle. So it will include what? It will include the internal carotid artery is there, external carotid artery is there, glossopharyngeal nerve is there. You can see the pharyngeal branch of vagus nerve is there, and beginning of superior laryngeal nerve is also there. Hypoglossal nerve is also there. Spinal accessory nerve is there, as well as the internal jugular vein is there. What is not there if you compare? The branches of internal laryngeal nerve is in the carotid triangle. Superior laryngeal nerve is coming down, but the branches are given up there. Hypoglossal nerve is there in this triangle. Ansa cervicalis is present in the triangle below. It has nothing to do with the triangle above. Okay. So this line here is kind of helping you to differentiate between the structure which are above or below. Before I write down the contents of carotid triangle, this is like out of all the things that we're discussing today, this is my request to you. Please go and at least practice this diagram once. You should know that what structure is where. If I just very quickly revise it for you, अगर deepest से start करें इस time. Superior laryngeal nerve seems to be the deepest. Superior laryngeal nerve is passing behind the internal carotid, behind the external carotid, and then divides into the internal laryngeal and external laryngeal. Then we have internal carotid. Then more superficial to internal carotid, we have the two nerves that you see in between them. What two nerves are in between? Glossopharyngeal nerve and pharyngeal branch of vagus. More superficial to that is external carotid artery, and then you have the nerve which is passing. But again, before doing that, there another question which is asked to you guys as a short note or something, that what structures are present between internal carotid and external carotid overall. We did not draw. We just drew two structures passing between the internal carotid and external carotid. But there are a few more. Just again for the sake of completion, before I write down the contents, let me just do that again. In between the internal and external carotid, if I may request you to please draw it again. Again, you don't have to draw it in that detailed manner or something. This is the common carotid, internal carotid, external carotid. But a structure between them. Now, one structure which is again I'm going from superficial to deep. Styloid process is passing in front of the internal carotid. This is internal carotid. That is styloid process which is passing in front of the internal carotid. And the two muscles which are attached to the styloid process, one is styloglossus which will go to the tongue, is going deep to the external carotid. That's how it will. Styloglossus, that is a muscle of the tongue, that's styloglossus. And one muscle of pharynx, that was stylopharyngeus. देखो अभी आपको एक और बात समझ में आएगी. That is stylopharyngeus. Make sure to draw them deep to external carotid. So they are passing between internal carotid and external carotid. What muscle is that? That is the styloglossus, and this muscle here is the stylo. What was the nerve supplying the stylopharynx? The only muscle supplied by glossopharyngeal nerve, and that is why we discussed already here that glossopharyngeal nerve will be seen passing between them because it has to supply the stylopharynx. That's the ninth nerve, the glossopharyngeal nerve. And one more nerve that I wanted to just put in between here, that is the very much in the upper part. बिल्कुल external carotid and internal carotid are close to the base of the skull. You will see some part of the parotid gland also in between them. You will see some part of the parotid gland is also in between. Just the lower part of the parotid gland will be there in between. The very much lower part of parotid gland is in between. So these are the structures passing between the internal carotid and external carotid. That's a straight question here. What are the two structures? Parotid gland, the lower part of parotid gland, styloglossus muscle, stylopharyngeus muscle, styloid process itself. Styloid process passing in between the two only. It is present in between the two. इतना gap होता नहीं ऐसा मैं show किया हुआ. Then we have glossopharyngeal nerve and we have pharyngeal branch of vagus nerve. Remember these mainly the 5 structures which are present between internal carotid and external carotid. Structures between ECA and ICA. So this separately can be a question for you, that what are the structures between the two, and this again is also going to help you remember the content of the digestive triangle in the posterior part. Generally people have difficulty in identifying or understanding the content in the posterior part of digestive triangle because we can hardly see them. वो बहुत ऊपर होते हैं. It's not easy to dissect this upper part of this triangle unless you remove the sternocleidomastoid and digastric and all the muscle. Then only you can see those contents. So they're very very much in the upper part. But let me come back. Let me switch back to the original topic we were discussing, the carotid triangle, guys. So as I said, everything that you see below this line here obviously is going to be the content of carotid triangle. I made you draw the structure so that you don't have to remember separately these two things. The same structure continuing above below can be remembered as the content of carotid and digastric. So how about if we just write down and draw the contents of carotid triangle specifically? So we've already talked about the roof, the boundary, the floor. Content is the last thing there. And yes, this time I'm gonna put a line here so that we can just limit ourselves. Here is the sternocleidomastoid. This is the posterior belly of digastric, and here we have the superior belly of Ponghi. That's how the carotid triangle is. As I said, let's keep it simple, guys. This time you don't have to draw them very clear. This is the internal carotid, which is a continuation of common carotid artery. Here is the external carotid artery, which is dividing this triangle itself at the level of upper border of thyroid cartilage. There is internal jugular vein. So the internal jugular vein is also there. The nerves, when we talked about the nerves, guys, if you remember, the accessory nerve was running like this. So it is a content there in this triangle, and then it goes to the posterior. The vagus nerve is running in between. And we said hypoglossal nerve will go in front. Glossopharyngeal नहीं होगा, guys. Glossopharyngeal ऊपर वाले triangle में था. But just I said, when you draw the hypoglossal nerve, you just go superficial to everything. I mean, obviously deep to the muscle, but superficial to all these structures here. Don't draw the ansa cervicalis and all in this unless you're drawing the previous diagram for your content. That is up to you. Okay? We'll write it down, but let's not draw that. And the 5 branches of external carotid artery. 1, 2, this tortuous 3, 4, and the one which will be present on the medial side. I can't see. Internal jugular vein. You will be able to identify all this in the picture I'll show you. Internal jugular vein. This is internal carotid artery. This is external carotid artery. That's the hypoglossal nerve. This here is the spinal accessory. The vagus nerve obviously is in between. Common carotid artery and carotid sinus will be the content as well. And then 5 branches of external carotid which I draw, but I'll write it down for you. So overall, when I start writing the content, let me start like this, guys. Internal jugular vein, from the vein if I start, internal jugular vein, common carotid artery, carotid body, as well as carotid sinus will also be the content. Then obviously common carotid artery dividing into internal and external. Internal carotid artery is not doing anything. It is like not giving any branch in the neck, so internal carotid. Then we got external carotid artery, and there are 5 branches of external carotid there. Which 5 branches? Let's write that also. That is superior thyroid artery, 1. Ascending pharyngeal artery, which is on the medial side, can't see it. One more anterior branch, that lingual artery. Another anterior branch, that is the facial artery. And one posterior branch, that is the occipital artery. Occipital artery. अच्छा सर, इसके अलावा क्या हुआ? Obviously when these are there, तो carotid sheath is a content as well. Now, if carotid sheath is a content, the relations of carotid sheath will be the content. The posterior relation of carotid sheath is the sympathetic chain. That will be there. The anterior relation of carotid sheath is the ansa cervicalis. That also will be there. That also will be there. Sympathetic chain and the cervicalis. When it comes to nerve, 10th nerve. 10th nerve is there. 11th nerve is there. 12th nerve is there. Right? 10th, 11th, 12th, all the 3 nerves can be seen here. And because you are able to see the 10th nerve, the branch of 10th nerve, that was superior laryngeal nerve I discussed already, and the 2 branches of superior laryngeal nerve, that is external laryngeal and internal laryngeal nerve, are also the content. The 2 branches of the vagus nerve, that is superior laryngeal nerve and external laryngeal nerve, will also be the content. So understand this, like you can always write about and elaborate any content that you want here. So these are overall contents of the carotid triangle. As I said, guys, I mean, if it is a short note type of question, just a suggestion to you, try to draw the diagram like this, a simple diagram in which you don't have to mark everything. And just, but if you get a long question or something on carotid triangle, or there's a diagram to be drawn on the carotid triangle, then I would say go with this one. Draw this diagram and try, if possible, you can branches of external carotid artery है, but मुझे लगता है थोड़ा complicated हो जाएगा. But at least nerve you should show with the correct relation, which nerve is deep, which nerve is superficial. Then how you should show it. So let's see how much we understood in this, and that we can do by comparing it with a picture. Carotid triangle की picture लेते हैं. Let's take a content of the carotid triangle. Let's mark the content here. First of all, boundaries are very much defined like this. You can see this here is the that muscle is what? That is the posterior belly digastric here. The superior belly femoid. They have cut the superior belly femoid a little, okay, and clearly sternocleidomastoid can be seen. So when you look at the content, let me start with this vein here. That is what? Internal jugular vein, beta. That is internal jugular vein. This main artery here, that is what? Common carotid artery. Now look at the common carotid arteries continue above as what? That is internal carotid. This is IC, that is internal carotid, I'm not labeling it. And this is external carotid artery. Let's go sequence one by one. He said how many branches of external carotid artery in this? 5 branches. One we can't see. Which one? Ascending pharyngeal. So leave ascending pharyngeal, look at other branches. Look at this branch which is going down and then passing deep to the strap muscles because thyroid gland is there. So that artery will be the superior thyroid artery. That's a superior thyroid artery. This artery which is running upward here, that is the lingual artery. That is lingual artery. Facial artery is also originating there only. Actually, it's very difficult to, I don't know whether you can see, there's an artery originating there, that's facial artery. You can see it better here. Can you see facial artery better? This facial artery is actually originating here only in this triangle. So, this artery or this artery here, that is what? That is the facial artery. So, 3 anterior branches. Medial branch I can't see. What is this posterior branch? Look at this artery here, that is the occipital artery going backward. So, out of the 5, 4 can be seen here. Superior thyroid, lingual, facial artery is going above, occipital artery, 1 will be on the medial side, that is ascending pharyngeal. अब nerve पे आते हैं. What is the nerve you expect to see between internal jugular vein and common carotid? That is the vagus nerve. So, this here is the vagus nerve, the 10th nerve is there. The nerve which is running backward, look at this, the nerve running backward and also seen in this triangle here. What nerve is that? That is the spinal accessory nerve. You can see 11th nerve can be seen running backward, 10, 11. Or better we said the nerve which is passing super, look at this. This nerve is passing superficial to internal carotid also, external carotid also. So what nerve is that? That's a hypoglossal nerve. That is the hypoglossal nerve. It is passing forward and it is passing superficial to both the carotid arteries. If this is hypoglossal nerve, look at this guys. If this is hypoglossal nerve, can you see a branch descending from the hypoglossal nerve exactly on the internal carotid first and then common carotid? That is descendants hypoglossi. This is descendants hypoglossi, this is descendants cervicalis together forming the ansa cervicalis. So you can see these are the 2 limbs of ansa cervicalis can be seen. 2 limbs of ansa cervicalis can be seen. It is giving a branch to the superior belly femoid, this one you can see. So like all major contents can be appreciated, if not everything. I mean, obviously superior laryngeal nerve cannot be seen here dividing. What nerve is this? Actually, what nerve is that? See, it's a branch coming from the hypoglossal nerve, but it is not hypoglossal nerve. If you remember, it is supplying this muscle here. And that is a strap muscle. The smallest strap muscle is thyrohyoid. So this is a C1 nerve via thyroid. I told you C1 nerve joins the hypoglossal nerve, it goes forward and then supplies the thyroid here. So this is the C1 nerve which is supplying the thyroid. That's a C1 nerve which is supplying the thyroid. Nerve to thyroid, yeah, it is the nerve to thyroid, Snigdha. It is, yeah. So it is the nerve to thyroid which is coming from where? It is coming, so it looks like it's a branch of hypoglossal nerve, but it is not. It is a C1 nerve which will go and supply. So this is about the contents of the carotid triangle. You don't have to write that now separately. I'm just saying the major contents that we've written: internal jugular vein, common carotid artery, internal carotid, external carotid, carotid sinus, carotid body, 5 branches of external carotid, 9, 10th, 11th nerve, 10th nerve की branches which is not shown here, superior laryngeal nerve dividing into internal, external laryngeal, carotid sheath, but what is the relations of carotid sheath? Posterior will be the sympathetic chain which we can't see here, anterior relations and cervicalis can be seen. So this is overall the contents of the carotid triangle. Okay, so with that, there is another picture in which the sternocleidomastoid is removed, and although it looks a little confusing because you can see the cervical plexus in between, so just don't get confused with this. It is all hidden by the sternocleidomastoid. That's why we don't count the cervical plexus in any of the triangle. Neither it's a content of posterior triangle, but the branches coming from that can be seen. The lesser occipital can be seen going, the greater auricular can be seen going there. But this is basically, this picture is to mainly to show you about the ansa cervicalis. Look at this, clearly the ansa cervicalis can be seen here. The descendants hypoglossi can be seen, and the descendants cervicalis coming from C2 and C3, that is also can be seen, and the branches also come. So it is after the removal of the sternocleidomastoid when all the structures will get mixed. You can see the phrenic nerve is running, it is running superficial to this muscle, that is scalenus anterior, and then you can see this passing between the passing anterior to scalenus anterior, and there is virtually passing between the subclavian artery and subclavian vein. So that is absolutely phrenic. That is the digastric triangle. Let's understand how the boundaries of digastric triangle are formed. For that, once again, if I look at the base of mandible, this was the external auditory canal, and that's mastoid process and occipital bone. Right? Let's say hyoid bone is that there is a hyoid bone here. The hyoid bone. So the boundary of the digastric triangle, anterior boundary, as you can see, anterior inferior both this one, anterior inferior boundary. It is by the anterior belly of digastric. It is clearly by the anterior belly of digastric. That is the anterior inferior boundary. Posterior inferior boundary is by the posterior belly of digastric, but as I said, it is not the only muscle we have here. It's the posterior belly of digastric accompanied by the stylohyoid muscle also. Just draw a thinner muscle that for a diagram, there is a stylohyoid muscle also. Anterior inferior boundary, posterior inferior boundary. Okay. Then apex, obviously that's the apex at the hyoid bone when they are all these muscles are fusing. What about the base here? To understand the base of the digastric triangle, that's how it is described in the book. That base is by the base of mandible, and then by the imaginary line which is connecting the angle of mandible to the mastoid process. Just presume a line, an imaginary line which is connecting the base of mandible to the mastoid process. That is considered as the base of this digastric triangle. Once again, writing the boundary here, that is the anterior belly of digastric. Anterior belly of digastric is forming what boundary? It is forming the anterior inferior boundary. Is anterior inferiorly present. This here is stylohyoid, and along with stylohyoid, here we have the posterior belly of digastric. Remember, both are supplied by facial nerve only, right? stylohyoid and posterior belly digastric, they both are supplied by the facial nerve. So stylohyoid and posterior belly digastric, they both together are forming the posterior inferior boundary. Apex over here, that is apex, no doubt about that. Now base. Base is by, let me write it separately here. Base of this triangle is by the, number one, by the base of the mandible. By the base of mandible. And by the imaginary line. Imaginary line connecting the angle of mandible. Connecting the angle of mandible to mastoid process. To the tip of mastoid process. So this here is the digastric or submandibular triangle. This is what you call as a digastric or submandibular triangle. So base of the mandible and imaginary line connecting the angle of mandible and the mastoid process. This triangle may, the way to remember the contents of this triangle is by understanding a relation of a very important muscle in the floor, and that muscle is the hyoglossus muscle. Obviously hyoid bone se yahan se, from the hyoid bone, the muscle which will go above in the tongue will be hyoglossus. So the floor of this triangle is by there are three muscles actually. One of them is hyoglossus, and that hyoglossus muscle ka relation is very, very important. You get a separate again diagram based question on the relation of hyoglossus or a short note on the relation of hyoglossus, and again this will help you understand the content also. When it comes to the relations of the muscle in the neck, two muscles extremely important. Scalenus anterior we discussed today, and the next we will discuss next, that is the hyoglossus muscle. So that is the boundary, like no confusion in the boundary, right? There is no confusion in the boundary. Anterior inferior boundary, posterior inferior boundary, and then we have the base and the apex can be seen. Okay. Roof, again nothing to draw in the roof, again simply we have to write down what's there in the roof is the skin, superficial fascia, platysma will be there. You have a skin, superficial fascia, platysma, and same again investing layer. Investing layer of deep cervical fascia is also there. Investing layer, it is present in the roof of all the triangle. It is like basically it is investing the neck. So skin, superficial fascia, platysma, investing layer are the structures which are seen in this. And the same now guys, the cervical branch of facial, we said that there are 5 branches. The cervical branch of facial nerve, isi ke roof se hote hue, it is coming to the carotid. So it is in the roof of carotid triangle, cervical branch of facial nerve. It will be in the roof of this triangle also. So platysma and along with its nerve, what nerve? Cervical branch of facial nerve. So these are the main component present in the roof here. Nothing to join there. Skin, superficial fascia, platysma, cervical branch of facial nerve, and the investing layer of deep cervical fascia. Floor and the content. Ab jo main game hai yahan pe, that is the floor and the content. And I tell you, if you understand the floor of this triangle, then content is nothing. There's nothing in the content because the relations of the floor you have to understand here. So all of you please focus on the digastric triangle for a while. But this muscle here is the boundary, that is anterior belly of digastric. Right? That's the anterior belly of digastric. I'm going to draw it for you. Just look at this here. Anterior belly digastric. This muscle here is mylohyoid. Remember the muscle which is present in the floor of the mouth? That is a mylohyoid muscle. It is attached to the hyoid bone below, and above it is going to the inner side of the mandible. There is a mylohyoid line in the mandible where it is attached. So that's a mylohyoid muscle. Deep to mylohyoid somewhere here. There is a muscle called as a hyoglossus. From the hyoid bone, the muscle will go above, and that will be the hyoglossus muscle. Look at this guys. This is the picture in which you can see the floor of this triangle. All the 3 muscles can be seen. I should have taken this picture first. This is the posterior belly digastric and stylohyoid there. And imagine if this is the base and the mastoid process, that's an imaginary line. Now, what are the muscles you have? The mylohyoid is there. This is the mylohyoid muscle which is in the floor. And see, we are going deeper and deeper. The mylohyoid is deep. More deep to mylohyoid, there's another muscle. That is hyoglossus. Look at that. The one which I'm highlighting here. Coming from the hyoid bone and going toward the tongue. That muscle is hyoglossus. And more deep to hyoglossus is what constrictor you can see coming from from the hyoid bone, which was partly present in the carotid triangle also. That is the middle constrictor. So you can see a part of middle constrictor also in this triangle. Part of middle constrictor will also be there in this triangle. This line should be more like this from the mastoid process. So part of middle constrictor will also be seen in this. So for the namesake, if I have to remember the muscles here, mylohyoid, more deep to mylohyoid is hyoglossus, and more posteriorly and deeply placed is the middle constrictor. Guys, again, middle constrictor is not my main concern here. My main concern here is the hyoglossus muscle and mylohyoid, and understand how they are related to each other. So beta, writing about the floor first, let's write about the floor. What muscles are forming the floor? And there's no harm in just very quickly drawing them as well. ये तो हो गया boundary, so this is the boundary here. The muscle which are in the floor, we have mylohyoid. One muscle that is in the floor is a mylohyoid. Try to draw the fibers in different directions. So can you see the one muscle which will be coming from below and passing deep to mylohyoid, that is hyoglossus. Hyoglossus muscle will be there. And a part of inferior constrictor or middle constrictor also will be seen. Mylohyoid, the muscle forming the oral diaphragm. What was the nerve supplied to mylohyoid? Inferior alveolar nerve. A branch of inferior alveolar nerve which comes down, coming from the mandibular. This is what muscle? This is hyoglossus. And because hyoglossus is a muscle of tongue, it is supplied by hypoglossal nerve. And this here is what constrictor? Middle constrictor. Middle constrictor is one of the pharyngeal muscle. It is supplied by cranial accessory via vagus, vago accessory complex, VAC. All of you look at your screen here guys for 1 second. Instead of discussing these contents separately, if I talk about the relations of hyoglossus, whatever relations, superficial relations of hyoglossus will be here. Superficial relations of hyoglossus will be the deep relations of mylohyoid. Everything which is passing superficial to hyoglossus will pass deep to which muscle? Mylohyoid. So all the superficial relations of hyoglossus and all the superficial relations of mylohyoid overall are the content of a triangle only. Digastric triangle. If you see the content is passing superficial to hyoglossus, which obviously will go deep to mylohyoid, or you can see the structures which are passing superficial to myelohyoid. Overall, they will be the content of this digastric triangle. So rather than discussing or writing those contents blindly, let us talk about the relations of hyoglossus first. Relations of hyoglossus. It anyways is very, very important to remember the relations of hyoglossus. It is asked in the exam also. But the relations of hyoglossus ke liye, let us draw the, this is, we have a hyoid bone. Start drawing slightly below because we have to go above. And this here is the hyoid bone, greater cornua of the hyoid and lesser cornua of the hyoid bone. So we're looking at a hyoid bone with its greater and lesser cornua. The muscle that we're talking about here is coming from the greater cornua and going above. This is the muscle we're going to talk about. That is the hyoglossus muscle. It's a tongue muscle. Obviously, let's say it's tongue here. It is going to go into the tongue here. So we have to discuss the relation of this muscle. Please draw it with me. This is the hyoglossus muscle, which is originating from the greater cornua of the hyoid, greater horn, you can say, greater horn or greater cornua of the hyoid bone, and then obviously going into the tongue, hyoglossus. We will be discussing superficial relation also, deep relation also, but our concern will be the superficial relation for the contents. Let's look at the superficial content first, guys. One of the superficial content of this hyoglossus is a muscle coming from the styloid process, and that muscle is a muscle of tongue only, the same muscle of tongue which was passing between the external carotid and internal carotid, guys. What muscle was that? That is styloglossus. It's a tongue muscle only. It's a muscle of tongue, but you can see it is passing superficial to the hyoglossus. So that is a styloglossus, and styloglossus is one structure passing superficial to hyoglossus. This is the styloglossus. You will see a nerve actually here, which is running superficial to hyoglossus. And that nerve is lingual nerve, one of the branch of the mandibular nerve, lingual nerve, right? Lingual nerve is there. And if lingual nerve is there, obviously what is the ganglion which is topographically connected to lingual nerve? That is a submandibular ganglion will be there as well. There is a submandibular ganglion is also there. So we have a styloglossus muscle, below that we have lingual nerve. Lingual nerve, it is connected to what ganglion? Submandibular ganglion, right? There is submandibular gland, obviously the submandibular gland will be here. How exactly it is? It is the deep part of submandibular gland that you will see, not the superficial part, it is a deep part. It is a deep part of submandibular gland which will be seen. And the duct which is coming from the submandibular gland comes from the deep part only. So we have this submandibular duct. It is also called as the Wharton's duct. Wharton's duct will go above like this and it winds around the lingual nerve to open in the floor of the mouth like this. This is the Wharton's duct here. So this here is the deep part of submandibular gland, deep part. This is the deep part of submandibular gland. And what is the duct along with it? The duct is a Wharton's duct. Let me write it here only. And Wharton's duct. Wharton's duct is a name given to the duct of submandibular gland. That is called as the Wharton's duct. हम जब submandibular gland discuss करेंगे in coming days, we'll be talking about these ducts and gland and everything. देखो बड़ो, हमारा आधा काम यही हो जाएगा. If you understand the relations of hyoglossus here, then you don't have to like break too much of your head in understanding the relation of submandibular gland. This is a deep part. Why we are calling it a deep part of submandibular gland? Because superficial part is superficial to myelohyoid. एक बार वापस इस picture को देखो. Just look at this image once again and try to understand what I'm saying here. Can you see submandibular gland? What muscle is that? That is myelohyoid. So this is a submandibular gland which is present here. That is a superficial part of submandibular gland. And then deep to it, you will be having a deep part of submandibular gland going like this here. So deeper part of the submandibular gland will be superficial to which muscle? Hyoglossus. This is a superficial part of submandibular gland, and then अंदर की तरफ जो होगा, there is a deep part of submandibular gland which is superficial to hyoglossus. Deep to myelohyoid, but superficial to the hyoglossus. Superficial to the hyoglossus. So that's why we wrote here. That's a deep part of the submandibular gland along with its Wharton's duct, and then you will see a nerve also passing here and going and supplying the tongue muscle. That is the hypoglossal nerve will be seen. Along with the hypoglossal nerve, you can see some vena comitant also. Don't bother too much over it. Some vena comitants can be seen. A small vein, one or two, can be seen running along with the hypoglossal nerve. But that's not important. Hypoglossal nerve, you got to remember. You can visualize that how important relation of submandibular duct is. Wharton's duct relation कितने important है. ऊपर we have lingual nerve, below we have hypoglossal nerve. So if somebody is having a stone in the Wharton's duct or submandibular duct, then surgeon has to be very, very careful because ऊपर की तरफ lingual nerve है. If you injure the lingual nerve here, then you are not only injuring the lingual nerve, you are also affecting the chorda tympani nerve also, because chorda tympani joins the lingual nerve only. So injury to the lingual nerve here will lead to the loss of general sensation as well as taste sensation. And obviously the injury to the hypoglossal nerve will lead to the tongue paralysis as well. So that's why it is very important to understand these relations of this. This is an area which a surgeon, a neck surgeon has to deal with them in their daily basis. So they should be very, very careful about the relations of the hyoglossus. You got to see where the duct is, where is the lingual nerve, especially lingual nerve, which is, you can see the duct is winding around the lingual nerve and then going above, the hypoglossal nerve below. So these are the superficial relations. So as I said, these are all superficial relations of hyoglossus. Whatever is superficial to hyoglossus is deep to what? Deep to which muscle? They are deep to the myelohyoid. So these structures are superficial to hyoglossus. Superficial to hyoglossus and deep to myelohyoid. Of course, myelohyoid muscle is more superficial, so there is a deep to myelohyoid. Superficial to hyoglossus and deep to myelohyoid. Now, although the next content I'm going to talk about are not the content of digastric triangle, they are definitely the content of digastric triangle. I'll write it down for you later on. Let me just finish off this first part first. What are the deep relations of hyoglossus? What structures are deeply placed to the hyoglossus? Not too many guys, not too many. Just like you can draw a smaller diagram for that. Once again, that's a hyoid bone. The lesser cornua, greater cornua. Once again, that's the hyoglossus. पूरा बनाने की जरूरत है, important structure, the three important deep relations that you got to remember is one is again coming from the styloid process, but this time it's the ligament. What ligament? Stylohyoid ligament, guys. Stylohyoid ligament starts from the styloid process. It goes deep to the hyoglossus, and that is how it reaches the lesser cornua of the hyoid bone. That is the stylohyoid ligament. The nerve that you see passing deep to hyoglossus is the glossopharyngeal nerve, ninth nerve. This is the stylohyoid ligament. This is the glossopharyngeal nerve. Now let me remind you something. When glossopharyngeal nerve was starting from behind, it was coming between the external carotid and internal carotid. You have to connect all these things. Glossopharyngeal nerve was coming between the internal carotid and external carotid, and then it goes further and passes deep to what? Passes deep to hyoglossus. So in the cranial nerves, when we discuss about the glossopharyngeal nerve, this is something you can remember about the relation of glossopharyngeal nerve. That when the glossopharyngeal nerve comes out of jugular foramen, it pierces the carotid sheath by passing between the internal carotid and external carotid. It goes forward, it passes deep to the hyoglossus. And lingual artery, one of the branch of the external carotid, the lingual artery will also go deep to it. It will go above also. I'm not drawing the entire course. The lingual artery is also present deep to hyoglossus, guys. That's a lingual artery. So all these structures are present deep to hyoglossus. They are present deep to hyoglossus. Guys, what all we discussed? Well, look at me. Just let me again give you an overall idea. If I start from this side here, you saw the deep relations of hyoglossus. There are some structures passing deep to hyoglossus. You saw superficial relations of hyoglossus. Whatever is superficial to hyoglossus is deep to which muscle? Mylohyoid. So they are deep to mylohyoid. Now the only question is, what is superficial to mylohyoid? What is superficial to mylohyoid is, again can be seen in this image. The structure which is superficial to mylohyoid can be seen here. This is a mylohyoid muscle. This is a mylohyoid muscle. What according to you is superficial to mylohyoid? We have a superficial part of what gland? Submandibular gland. That's a superficial part of submandibular gland can be seen. One. Okay. What else? I can see anterior belly of digastric is overlapping the muscle. You can see anterior belly of digastric is also overlapping it. Okay. What nerve is that better? That is a nerve to mylohyoid. Remember? We said nerve to mylohyoid comes and supplies mylohyoid and anterior belly of digastric. And it is only the nerve, but there is an artery to mylohyoid also. We have blood vessel also. There is an artery to mylohyoid or vessels to mylohyoid which are also there here, which is a branch of maxillary artery. We haven't discussed the maxillary artery yet. We will discuss it in the next one. So nerve to mylohyoid and vessels to nerve and vessels to mylohyoid. So superficial part of submandibular gland, nerve and vessels to mylohyoid, and anterior belly of digastric, they are present all superficial to mylohyoid. They are all running superficial to mylohyoid here. They are all running superficial to mylohyoid. You can write this. I give you the time for that. Please just make a note. Structures superficial to mylohyoid are superficial part of submandibular gland, nerve and vessels to mylohyoid, and anterior belly of digastric. Please write it down in your notes first, and then I will show you that picture. Superficial part of submandibular gland, nerve and vessels to mylohyoid, and anterior belly of digastric. All these structures are superficial to mylohyoid. Now we have seen everything, guys. Superficial to mylohyoid, deep to mylohyoid. Deep to mylohyoid means superficial to hyoglossus. And then we also saw the structures which are deep to hyoglossus. Overall, they are all content of the digastric triangle. Whatever you just saw here, everything which is present here is the content of digastric triangle. The anterior part of digastric triangle, not the posterior part. That's the anterior part of digastric triangle. But before I make you write down the contents of the posterior part of digastric triangle, this is what I want you to do. There we have it, guys. That's a coronal section. This section was samjho and then try to answer this. This is a coronal section. The section is taken like this. It's a coronal section here. And let me mark the two important muscles for you, and you can go from there. This muscle here, beta, is mylohyoid. And this muscle here, it is going to the tongue, that is hyoglossus. I'm writing HG here, that is hyoglossus. Mylohyoid and hyoglossus. I'm writing few structures here, and I want you to start answering it in this way. What is A? What is B? What is C? D? This obviously is a deep part of submandibular gland. It's a deep part of submandibular gland that you can see here. This E is the superficial part of submandibular gland. What is B here? That obviously is the Wharton's duct. The submandibular duct or the Wharton's duct is there. See, you can see the nerve which is in very close relation, which can be injured. That is a lingual nerve, which is, see, that is very close to it. The artery D is deep to the hyoglossus. It is reaching the tongue. It's an artery of the tongue, and it is present deep to the hyoglossus. That is how it reaches the tongue. That is the lingual artery. It's lingual artery. The nerve which is superficial to the hyoglossus, and it is running with the vein. I mean, it's a bit odd here. Usually veins are seen with the artery, but we have this vena committed which is seen with the hypoglossal nerve, and that is the hypoglossal nerve, the 12th nerve is there. This facial artery itself. Just to tell you guys, this is a facial artery here, just for you all. Actually, facial artery, when we discuss the facial artery, I told you it first goes inside, and then it loops around, and then it goes up again. Hello, under jata mandible, and then it comes out, and then goes over. So that's the inner part of the facial artery to the mandible, it goes out. Although facial vein can be seen more superficial to the gland. That's a facial vein. Artery is going inside the mandible, in the angle of mandible, and then comes out and then runs on the face. Facial vein, the facial vein doesn't go deep to the mandible or anything. Now, whatever we discussed, guys, we said the point is we need to look into the contents of what triangle? Contents of the digastric triangle. But the contents of digastric triangle, anterior content, when you talk about the anterior content, you just have to tell about the relation of mylohyoid and hyoglossus. And the posterior content, we already discussed the posterior content because those posterior content are the structures passing between the external carotid and the internal carotid. The posterior wali content. Okay, let me write that for you. Contents of the digastric triangle. So we will write the contents of the digastric triangle in this way. First, anterior part of triangle. So when you look at the anterior anterior part of the digestive triangle, then you just have to think about the relations of higher glosses. Higher glosses. So what from there? First of all, superficial part of submandibular gland. Why I am saying superficial part of submandibular gland? It is superficial to mylohyoid. Superficial part of submandibular gland is there. Mylohyoid nerve and vessels. Mylohyoid artery, mylohyoid nerve and vessels are seen. I just showed you something. Obviously, facial artery and facial vein are passing from there only. The facial artery and facial vein are also passing from there, so you have to add them also. Facial artery and facial vein, which I just showed you, are also the content of this triangle because they are passing in relation to the submandibular gland. Hypoglossal nerve. Hypoglossal nerve. अब आपको भी हमने बाकी कंटेंट क्यों नहीं लिखे? The reason I have not written the rest of the contents because when you say content, that should be visible. You get the point? They are there in this triangle. Once you remove the mylohyoid muscle, then obviously you will see the rest of the thing, the lingual nerve, the submandibular ganglion, the styloglossus muscle, the Wharton's duct, the deep part of submandibular gland. But that you will be able to see when you remove this mylohyoid. So if without removing mylohyoid, if you see, only hypoglossal nerve can be seen coming from the posterior side and entering here. So from the superficial relations of hyoglossus, the one major structure that you have to add here is the hypoglossal. You can still say there are many books write other contents also, so other contents are will be लिखे हुए books right? But we have to write the contents which are at least seen, they're visible in this triangle here. Yeah. If I just open this, if you look at this picture here once again, when you see the side here, everything is what is the visible content beta here? Visible content is this nerve is there, vessel will be there, this gland is there, artery is there, vein is there, and look at this hypoglossal nerve is visible. Rest is there, but deep है. You cannot see it from outside. So that is like those contents are passing deep to the mylohyoid. So you have to remember the relations of hyoglossus that way, but you should not write them all of them blindly as a content of the digestive triangle. अगर आप लिख भी दोगे तो गलत कोई नहीं करेगा. Nobody will say that is wrong because they are ultimately deep to mylohyoid. Examiner will understand that okay, you know the structures which are deep to mylohyoid also, but as a content are the ones which are visible in the triangle. So they are not accessible, they are not visible. Whereas this is the anterior part, right? When you look at the posterior part of triangle, when you look at the posterior part of the digestive triangle, the contents are arranged. The contents are arranged like there are some superficial content. There are some superficial contents. There are some deep contents. इसमें कुछ मेहनत नहीं करनी पड़ेगी हमको देखो. Deep contents, and then there are deepest contents. Superficial content, deep content, deepest content. You know, this is I don't teach like this to the PGs when they're preparing for the PG examination because nobody is going to ask you this kind of detail. But let's say if you get a question, a long question on the anterior triangle, then you will be writing all these contents in their sequence also. Superficial and deep and the deepest content here. The superficial content beta here is the parotid gland. The lower part of parotid gland, and the external carotid artery, which is entering into the parotid gland. We know that external carotid artery enters into the parotid gland and gives off superficial temporal maxillary artery. Can you see parotid gland? Can you see? In this picture, you can see at least parotid gland can be seen. That's the parotid gland region. So that's a very superficial content. The parotid gland will be there, and this external carotid artery नीचे से उसमें enter कर रहा होगा. So that's a very superficial content of the posterior part of the digestive triangle. Deep content, the major content are the deep, the maximum content are the deep, but it is very simple, guys. You just have to think about the structures between external carotid and internal carotid, which we have already discussed, and your answer is there. Whatever structures we discussed between internal carotid and external carotid, क्या कहते हैं? Styloglossus muscle, stylopharyngeus muscle, then glossopharyngeal nerve, then pharyngeal branch of vagus nerve. The structures between the ECA and ICA. Structure between ECA and ICA. Okay, you can ignore the parotid gland from there because we have already written the superficial part is superficially present. Remaining contents, whatever we have here, they are all contents. The deep contents. What will be the deepest content? The deepest content are the remaining contents. Like what is the deepest structure here? Internal carotid artery. What vein will be running with the internal carotid artery? What vein will be there? Internal jugular vein will be there. And what is the nerve in between them? That's a vagus nerve. There is the deepest content here. So when you look at the structures here in the posterior part of digestive triangle, the superficial content are this parotid gland is there and external carotid artery, which is entering into the parotid gland only. Then deep content are the structures passing between external carotid and internal carotid. Deepest content, internal carotid artery, internal jugular vein, and the nerve in between the vagus nerve are the deepest content. That is how the structures are arranged in the digestive triangle, and that's why I said you should practice this diagram and you should practice this diagram as well, because this will help you remember the contents of carotid triangle, digestive triangle, what is superficial, what is deep, and how they are arranged as well. So, just to complete this thing, the deepest content is ज़्यादा कुछ नहीं है. It is internal carotid artery, it is internal jugular vein, and it's the vagus nerve, the main trunk of vagus. इनको elaborate करके लिखोगे वैसे. Deep content, you have to like write down all the deep contents over there, which is the pharyngeal branch of vagus, glossopharyngeal nerve, stylopharyngeus muscle, styloglossus muscle. They are the deep content. This is about the content of the digestive triangle. That's about the content of digestive triangle. So we have to write the contents of digestive triangle in the anterior part and posterior part separately. Right? So that is all. बाकी दो triangle में कुछ भी नहीं बेटा. दोनों triangle में आपको कुछ discuss नहीं करना. There's nothing to discuss in both the triangles. I mean, if you still want me to just quickly just tell you what is about the remaining two triangle. One triangle is what? Submental triangle here. The submental triangle boundary are what? Anterior belly of digestive and hyoid bone is the boundary. What is there in the submental triangle? Submental lymph node. Game over. That's nobody's going to ask you submental triangle. Muscular triangle. When muscular triangle is here, what is there in the muscular triangle? Muscles are there. Only muscles. Strap muscles are there. Sternothyroid, sternohyoid, omohyoid. All the strap muscles are there in this muscular triangle. So these are the two least important triangle. Nobody asks you that. आप चाहो पढ़ सकते हो उसको पढ़ना चाहो, but obviously the posterior triangle, the carotid triangle, and the digestive triangle is something that you have to. Right. So I will be be, that's why I try to use the same picture over and over again. अब इस triangle बेटा posterior triangle भी कर लिया हमने, इसमें carotid triangle भी discuss किया है, इसमें हमने digastric किया है. Now everything in this picture here, almost 99% thing in this picture, I hope you are able to identify. But there are a few things which we discussed earlier also. Remember this vein, that's a facial vein is there, that's an anterior division of retromandibular vein. You can see common facial vein going inside. That's external jugular vein is formed in here. Today we saw the internal jugular vein, common carotid artery. So gradually धीरे-धीरे जैसे हम add up करते जा रहे हैं, that is how you will be able to identify the contents. Cranial dura mater and dural venous sinus. Three layered, three meninges. We all know about the three meninges. We have a dura mater, arachnoid mater, and the pia mater. Dura mater is the thickest of all the meninges. It is also called as a pachymeninges. It's pachymeninges, and the remaining two meninges, arachnoid mater and pia mater, they are thin meninges. They are together called as a leptomeninges. Lepto is thin, so it's a leptomeninges. So we have pachymeninges. Pachymeninges is name given to the dura mater, and leptomeninges, that is a thin meninges, is name given to the arachnoid and the pia mater. The topic specifically says cranial dura mater and dural venous sinus. Now, what is so special about the cranial dura mater, which is not there in the spinal dura mater? And that special thing is that we have two layers of the dura mater in the cranial cavity. If you look at the spinal cord dura mater, it is just one layer. But when you look at the cranial cavity dura mater, it is having two layers. One layer of the dura mater is adherent to the bone, and one layer is going along with the curvatures of the brain, the major fissures of the brain, major sulcus and fissures of the brain, and that is called as a meningeal layer. So one is an endostal layer, which is adherent to the skull bone, and the one will be called as a meningeal layer of the dura mater. So what I'm saying here is the cranial dura mater is made up of two layers. There's two layers in the cranial dura mater. One is called as the endostal layer. We got the endostal layer, and we have this meningeal layer. Endostal layer and the meningeal layer. Just to make you understand this, imagine if I take a coronal section of a skull bone, coronal, whatever section you feel like. Let's say if this is a section of a skull bone, guys. Let us say this is a section of a skull bone, right? It's a bone. So what you will see that there are, as I said, there are two layers of the dura mater. One of the layer will be adherent to the skull. Now this is the layer, look at this, this is adherent to the skull here by the connective tissue. And this is obviously called as the endostal layer. It is just like a periosteum, it is like an endostal layer of dura mater. Endostal. Like if you remember outside the layer, the last layer of scalp was SCALPP was pericranium. Pericranium, or it's like a periosteum only, is continuous with the endosteum inside. So that is this endostal layer. So endostal layer of dura mater. And the other one, which is running with this only, most of the places you will see it running with this endostal layer. But at some places you will see it will separate from the endostal layer and will go in between the different part of the brain. So like if it will dip between the two cerebrum, or will go between the cerebrum and cerebellum, or will go between the cerebellum, wherever it finds a major space between the brain, that layer will dip inside. And in doing so, what will happen? In doing so, as I said, this here is the endostal layer. I'm writing EL, that is endostal, and this one here is the meningeal layer. So because of this meningeal layers move, at some places it move away from the endostal layer, it forms a sinus here, it forms a space here, and these spaces are what you call as a dural venous sinus. Like this is the one which I'm highlighting here, that is a dural venous sinus. In fact, even this one here is a dural venous sinus. So this is DVS. DVS is dural venous sinus, and this also is dural venous sinus. So it's a venous sinus. Venous blood is present here, guys. In this. So dura mater is having two layers, and you can imagine like there are two layers of dura mater which are adherent most of the places, but wherever they will separate from each other, one layer is endostal meningeal layer which can be easily separated from each other, and that will be holding a venous sinus inside. That is a dural venous sinus. From this picture, you can make out, from this diagram, you can make out that the dural venous sinuses are, most of them actually, are present between the endostal layer and meningeal layer. They're present between the endostal and meningeal layer. But there are some dural venous sinus which are present only in the meningeal layer of dura mater. That's a question also, guys. When we talk about all the dural venous sinuses, we'll make a list of all the dural venous sinus. Most of the dural venous sinus are present between the endostal layer and meningeal layer. But there are some dural venous sinus you will find present only in the meningeal layer. You can see here, endostal layer का कोई role नहीं है. Only meningeal layer is participating and forming the dural sinus. Which one are those? I want you people to answer it once we discuss that. But see, one thing is quite clear again from this image, that the two layers of the dura mater, the one which goes away from the skull bone, goes between the brain and comes back, goes again and comes back, is which layer? Is the meningeal layer. And that is why whatever dural folds we have inside the cranial cavity, when you open the cranial cavity, you will see certain dural folds present between the cerebrum, between the cerebellum, between the cerebrum and cerebellum. So those different dural folds are made up of what layer only? Are the meningeal layer only. So it's a meningeal layer which is having a liberty to go away from the skull bone and come back. So this meningeal layer of dura mater is the one which is responsible for forming the dural folds. All the dural folds are made up of the meningeal layer of dura mater. Now, what are the names of dural folds? Number one, like we have the falx cerebri, just write with me, and then I'll explain to you. Falx cerebri. We've got falx cerebelli. Be careful with the cerebri and cerebelli, guys. That is falx cerebri, this is falx cerebelli. Then we have tentorium. Tentorium cerebelli. The word tentorium is actually for the tent only, like a tent on the cerebellum. There are two cerebellum, we all know that we have two cerebellar hemisphere, and on that we have a tent-like structure which is called the tentorium cerebelli. And finally, diaphragma celli. Diaphragma celli. Diaphragm is like a diaphragm, anything which separates two, like we have diaphragm here, we have an inlet diaphragm here, so the different diaphragm in the abdomen. So different diaphragm, so it's again like a diaphragm only, and celli word came from the sella turcica. I hope you know what is sella turcica. Pituitary fossa is called a sella turcica. So it will be present on the pituitary fossa or on the sella turcica, and it will be separating the pituitary gland with the rest of the Dancer block. So the stock of the pituitary will be going through it. You will see that. So these are the four major dural folds we have: falx cerebri, falx cerebelli, tentorium cerebelli, and diaphragma celli. Diaphragma celli. First of all, what is the literal meaning of the word falx, guys? Falx means sickle shaped, like a sickle. I mean, I'm pretty sure you all know how the sickle looks like. That's how the sickle is, right? That's how the sickle is. Okay. So the sickle shaped, the one which is called, that is called the falx. So the sickle shaped fold of dura mater, which is present between the two cerebrum, is falx cerebri. And similarly, the sickle shaped fold which is present between the two cerebellum is falx cerebelli. And the one which is horizontally present, like you know that above we have cerebrum, below we have cerebellum. So the one which is horizontally present on the cerebellum, that is tentorium cerebelli. And basically this tentorium cerebelli is separating the cerebrum from cerebellum. It is basically separating the cerebrum from cerebellum. Right? I will be showing you all of these, but I want first of all you to draw with me. See, and then we'll write about them. Okay, let me say falx cerebri, the two main dural fold for which you should know attachments also. Falx cerebri and tentorium. Now how falx cerebri is attached? Sickle shaped fold, the sickle shaped fold, the fold looks something like this. It is present between the two cerebri. This is the falx cerebri. So when you see the skull bone, when you see the cranial cavity from the side, that is how you will see. You will have cerebrum on that side and you have one cerebrum on this side. So it is basically present between the two cerebral hemispheres. This is the anterior end. That is the anterior end here. And what you see, the anterior end is attached to the projection of the anterior cranial fossa, which I'll show you immediately after that. That is called as the crista galli. Crista galli is a projection which is coming from ethmoid bone. There's a projection of the ethmoid bone coming in the anterior cranial fossa, which is giving attachment to this, the anterior end of the falx cerebri. Posterior end, this one, this is the posterior end here. The posterior end of the falx cerebri is basically resting on the tentorium. We said tentorium is like this, horizontally placed. Above we have cerebrum, below we have cerebellum. So this falx cerebri which is present above, so anteriorly it is attached to what? Crista galli. And posteriorly you will see it will come like this, and it is actually resting on the superior surface of tentorium cerebelli. So posterior end, it is surfaced on the superior surface of tentorium. It is present on the superior surface of the tentorium cerebelli. How exactly we will see that? Superior surface of tentorium cerebelli. Then it is having one. This is a, what do you say? It is a concave end, and this is the concave end. This convex end. Sorry, the lower end is a concave here. So this concave, convex upper end, upper border or upper margin. You can see the upper margin which you can see is convex, and this upper margin is attached to the sulcus, which is called as the sagittal sulcus. I'm going to show you all of these. Just please keep writing with me, guys. Sagittal sulcus. There is sulcus called sagittal sulcus. To the lip of the sagittal sulcus it is attached, and this lower margin is free. This here is the lower margin, and the lower margin is free. That means it is not attached anyway. It's just like hanging. This is called as the falx cerebri. Anterior end attached to the crista galli. I'll show you what is crista galli. Posterior end to the upper end of the upper surface of the tentorium. Upper end is, or upper margin is attached to the sulcus in the skull bone. That sulcus called as sagittal sulcus, and the lower margin is free. So first have a look at how exactly this falx cerebri will look like. If I just show you the falx cerebri, so this is the picture showing you. Don't pay attention to the sinuses. Don't pay attention to what sinus are there inside. I want all of you to just look at this fold. This is the fold, guys, we're talking about here. This is the anterior end which will be attached to what? Crista galli. I'll show you the crista galli. Posterior end here, this one is attached to tentorium. They have cut the tentorium in half. They have cut the tentorium exactly from here, so that they can show you the falx cerebri clearly. Otherwise, tentorium it is like this. Tentorium is present in this plane, in the horizontal plane. That is tentorium. Right? So it is resting on the tentorium. Upper margin you can see attached to the skull bone, and that sulcus which is present in the skull bone is obviously in the sagittal plane. So we call it sagittal sulcus. And you can see the lower margin is free. This is the lower margin of this falx cerebri, and it's a free margin. So if you look at the skull bone, where is crista galli? Just to show you, look at it. That projection over there that you're looking at, this one here is called as the crista galli. This is where the falx cerebri will be attached to the crista galli. Then it will be running like this, and above, as above, it is attached to what? It is attached to the margin of the sagittal sulcus. I've kept a picture for that also. There we have the sagittal sulcus. Look at this. This is, you're looking at a skull cap from inside. This is my skull cap here, and if you see it from inside, I hope you all can notice this sulcus here. This sulcus is called as the sagittal sulcus. regardless of which bone it is present in. You can see it is partly in the frontal bone, partly in the parietal bone, partly in the occipital bone, but there is a continuous sulcus which is present here in the calvaria, in the skull cap, on the inner side, which is called as the sagittal sulcus. So it is attached to the lip of the sagittal sulcus. It is attached to the lip of the sagittal sulcus. That is your attachment. I hope attachment is clear. Anterior attachment crystal line, superior attachment to the sulcus of the sagittal, lip of the sagittal sulcus, and posteriorly we said it is resting on the tentorium cerebelli. Tentorium cerebelli looks something like. Let me show you the picture of tentorium. That is a better picture of tentorium. Look at that. Although they have cut the tentorium from one side, they have cut the tentorium from one side. Don't bother about it. This thing is a tentorium because above this, यहाँ पे क्या रखा होगा cerebrum. You remove the tentorium, below will be cerebellum. So cerebellum will be there on the inside there. So it is separating the cerebellum and cerebellum. So this is the line of attachment where the falx cerebri is attached posterior, anterior and posterior and superior, and the lower margin we said already it is free. Similarly, as I said, attachment thing is important. Then we'll see what sinuses are there. Now, what about the sinuses, guys? In this falx cerebri, the sinuses which are related to it. Now you will see one sinus which is running in the upper margin of the falx cerebri like this. One sinus will be seen running in the lower margin of falx cerebri, and the one sinus is present where at the posterior end, where it is resting on them. It is at the junction of the falx cerebri and cerebellum. Important thing which is not shown in the book is always draw this direction so that you know that what is the direction of the blood flow. So blood flow in this direction. Falx cerebri, upper margin, lower margin, and then we have one sinus here. Now what are the names of these sinuses? The sinus that you see running in the upper margin of falx cerebri, this is called as the superior sagittal sinus. Makes sense? It is superiorly placed, and in the sagittal plane, so we call it superior sagittal sinus. So similarly, this is called as the inferior sagittal sinus. Superior sagittal, inferior sagittal sinus, and this sinus is running backward, straight backwards. So simply call it straight sinus. So these are those places where the dura mater, where the dura mater endosternal layer will separate from each other, and they will hold the venous sinus inside. So as of now, you are looking at three venous sinuses in relation to the falx cerebri. Superior sagittal sinus, inferior sagittal sinus, and the straight sinus. The straight sinus, three sinus in relation to the falx cerebri. Let me show you these three sinus. This is a topic in which you keep on building gradually. We're just talking about the falx cerebri, and then we'll see later part. Like once again, if I take you back to the picture here, there we have it. Right, you can see the sinus here is what? That is a superior sagittal sinus. That is superior sagittal sinus. This one here is an inferior sagittal sinus, and you can see this inferior sagittal sinus in continuation with the straight sinus, which is running backward. That is straight sinus. This is not showing the direction of blood flow, but you have to keep it in mind that how the blood is flowing. Then only you will be able to understand that what is the direct, how exactly the cranial cavity will drain the blood outside. Superior will take the blood backward, inferior will take the blood backward, and straight will also take it backward. That was about the falx cerebri and the related dural venous sinus. Okay. One question which can be answered from here only. We said majority of the dural venous sinuses are present between the endosternal layer and meningeal layer, but we also said there are some sinuses which are present only in the meningeal layer. How will you find out the sinus is present only in the meningeal layer? Well, it is very simple. If it is away from the bone, then obviously endosternal layer is not contributing to it. Endosternal layer is in relation to the bone only. So which sinuses you see as of now are not close to the bone is clearly one is the inferior sagittal sinus, this one, and also the straight sinus, guys. They have no contribution from the endosternal layer. They're just made up of which layer only? In the meningeal layer itself. They just made up of the meningeal layer. So this again is a point which is worth writing, that inferior sagittal sinus and straight sinus are present only in meningeal layer of only in the meningeal layer, present in the meningeal layer of dura mater. Endosternal layer has no role to play in the inferior sagittal sinus and straight sinus. That again could be an MCQ type of question. Now coming to the second major fold, that is the tentorium. When it comes to attachment, which as I said, the detailed attachment you should know for the falx cerebri, and more important, definitely more important, is a tentorium cerebri. How about we'll discuss it based on the picture first? Now let me just discuss it on the plain skull, and then I will try to show it in the picture as well. But a tentorium cerebri, understand that what exactly is the function, where it is present, and what will it be doing. Like tentorium is present like this. It is like a tent, which is present, first of all, keep in mind, in the posterior cranial fossa. This is anterior cranial fossa there, this is middle cranial fossa, and this one here is a posterior cranial fossa. So the tent-like structure that you see in the entire posterior cranial fossa, that is tentorium cerebri, number one. Number two, you cannot have a continuous tent here. Imagine if there is a continuous layer, then how brainstem will go downward and then become the spinal cord. You get my point? So in the tentorium cerebri, there has to be a notch here, there has to be a notch, and that notch will be providing the passage to the brainstem to go down. And that notch is called as a tentorial notch. So that notch is called as tentorial notch. That is why you will be having two margins of the tentorium. See, one margin of the tentorium cerebri will be like this. Let us say, one margin of tentorium cerebri will be like this. Just look at this first. And the other margin of tentorium will be like this. And this whole thing is tentorium. Just look at this highlighter here. As I said, I want to show you on just, we're going to draw it also, just look at this first on the skull bone. Now just look at this yellow highlighter, this is all tentorium. Obviously below will be the cerebellum here, and above there will be occipital lobe of cerebellum here. The name is tentorium cerebelli, separating the cerebellum from cerebellum, or like a tent on the cerebellum. There are two margins. This margin here, the one which I'm pointing at right now, this is called the free margin of tentorium. That's free margin. And this one here is the attached margin of tentorium, the one which is attached to the bone. So we've got a free margin and we have attached margin. And obviously between the free margin or inside the free margin, this notch here is called the tentorial notch. The tentorial notch, which is basically providing the passage to the brainstem. Otherwise, if this also is covered, our brainstem will go down. Point to be noted is that, guys, the free margin is attached more anteriorly. I hope you all know what are these processes here. These are called as anterior clinoid process. They are the part of sphenoid bone, lesser wing of sphenoid bone, and they are called as anterior clinoid process. So it is attached to the anterior clinoid process. It goes backward. It makes a notch here and comes here. That's what margin? Free margin. Whereas attached margin, again the Attachment of the attached margin, you have to describe it in two parts. What is the posterior lateral attachment, this one? And what is the anterior lateral attachment? Now let me tell you the anterior lateral first. Anterior lateral attachment is to the petrous part of temporal bone. We've discussed this earlier also, guys. This bone which is present here is a petrous part of temporal bone. So it is simply attached to the upper border of petrous temporal bone. It is attached to the upper border of petrous part of the temporal bone. Whereas posterior laterally, it is attached to the sulcus, which is called the transverse sulcus. Can you see a sulcus over there? Can you see a depression on this, like this here? That sulcus is called the transverse sulcus. If you have watched that cranial cavity wala video, they must be knowing what I'm talking about. The sulcus which is on the side here, that is called the transverse sulcus. The transverse sulcus. So this is about the attachment. This is about the attachment of the tinctorium here. Let me show you a picture for the tinctorium. Look at it. The same image that we saw earlier. Now this time, let's look at the one side here, guys. This here is the attached margin, and you can see that start where at the anterior clinoid process. This is the attached margin which you see go back and forming the tinctorial notch. A free margin, sorry, not attached. That's a free margin which is attached to the anterior clinoid process. And this attached margin, first it is attached to this bone here. That is to what? To the superior border of petrous temporal bone. And then posteriorly or posterior laterally, it is attached to the sulcus in the occipital bone, which is called the transverse sulcus. Sulcus is pressed transversely, so we call it transverse sulcus. So let's talk about it and then we go further than that. So the next dural fold we are looking at is the tentorium cerebelli. Tentorium cerebelli. As I said, tentorium cerebelli in the transverse section will look something like this. This is the free margin. And as I said, the free margin is attached to the anterior clinoid process. Anterior clinoid process, which is a part of the lesser venosus anterior clinoid process. Whereas there's a free margin, attached margin having an anterior lateral attachment and posterior lateral attachment. So anterior lateral attachment is to what? Is to the superior border or upper border of petrous temporal bone. Upper border or the superior border of petrous temporal bone. Petrous part of temporal bone, petrous temporal bone. And posterior lateral in fact. Posterior laterally it is attached. Posterior laterally it is attached to what? It is attached to the lip of the transverse sulcus. It is attached to the lip of the transverse sulcus. And when you trace this posterior laterally, anterior laterally, it is finally ending by attaching itself to the clinoid process that we have here. These are the posterior clinoid process. I show it to you. These are the posterior clinoid process, not as prominent as the anterior one, but they have a posterior clinoid process as well. To which, what margin is attached? If I just first write that, what margin is that? That is the attachment of the attached margin. That is the attached margin of tentorium cerebelli. And this is the free margin of tentorium cerebelli. And I said because of that, there is a notch in here. This notch here is called the tentorial notch. You can write it somewhere, guys. I'm just writing in short, tentorial notch. The one which is giving passage to the brainstem, the tentorial notch is present. So once I'll show you all connected with each other, all the dural venous sinuses will make sense. Now what dural venous sinus we expect? What dural venous sinus we expect to see here? First of all, there is no dural venous sinus present in the free margin. Tentorial notch ke andar koi dural venous sinus nahi. There is no dural venous sinus. We have a dural venous sinus which is present in the attached margin. Now first, one sinus which was present at the junction of the falx cerebri and tentorium was straight sinus. So straight sinus was running something like this. So we have straight sinus which is present at the junction of, the blood was running backward. That is junction of falx cerebri and the cerebellum. Then what sinus is that? We have a sinus running like this. Now what sulcus it is? That is a transverse sulcus. So obviously the sinus is also called as a transverse sinus. So we have a sinus which is running posterior lateral like this. This is called as a transverse sinus. And again, pay attention to my arrows here. That is transverse sinus. And anterolaterally, there is a sinus which is actually coming from cavernous sinus and that is running backward toward this, basically draining into this only. That sinus which will be running in this direction and bringing the blood towards the transverse sinus, that is called the superior pectoral sinus. Makes sense? It is in the upper part of petrous temporal bone. So we call it superior pectoral sinus. So let me just mark that for you guys. The sinus that you see here is the superior petrosal sinus. It is in the superior border of petrous temporal bone. This sinus is in the transverse sulcus, so we call it the transverse sinus. That is transverse sinus, and you already know this one is the straight sinus. The one which is running backward is the straight sinus. So these are the three sinuses that you will see in relation to the tentorium cerebelli. Nothing in the tentorial notch, nothing in the free margin, all in the attached margin. Anterolaterally, we got superior petrosal sinus, transverse sinus posterolaterally. And you can see transverse sinus and superior sinus, they're fusing with each other. That is an important thing to understand, that they're fusing. Let me again show you this picture, but this time with the sinus here. If I show you again the picture of the cranial cavity, this is without the dural venous sinus are hidden inside, but look at this, they are more clear in this picture. So guys, clearly what sinus is that? The one which is running backward, that is the straight sinus. Then obviously the one which is running like this, it is a transverse sinus. Okay, just look around this side only, on that side tentorium is cut. There is a transverse sinus. And this transverse sinus is merging with the sinus coming backward, that is superior pectoral sinus. It is coming from cavernous. I will tell you more about cavernous in a while. So it is the superior pectoral sinus. If you try to look at on this side, so the point is the blood actually from the transverse sinus is going like this, which receives a tributary which is called the superior pectoral sinus. And then this transverse sinus will continue downward into the cranial cavity as a sinus called the sigmoid sinus. There is sulcus over there, sigmoid sulcus, so sinus is also called as a sigmoid sinus. If you look at this empty cranial cavity, then I can try to show it to you guys. Let me just rub this off. If I remove this, can you see? This is the transverse sulcus. And once this transverse sulcus having a transverse sinus receives the superior pectoral sinus here, then whatever sinus is found here, that will go into this sulcus through the jugular foramen. And look at the shape here, because it's a sigma shape, so we call it a sigmoid sinus. That sinus will be called as a sigmoid sinus, which is the sinus taking the blood out of the cranial cavity. So, falx cerebri and the tentorium cerebelli, you saw their attachments, and you also saw that what are the sinuses which are in relation to them. You will see them together also. Then there is a sinus, a very small dual fold called as a falx cerebelli. The falx cerebelli will be present here, because see, one cerebellar hemisphere is here, and one cerebellar hemisphere is here. If you can see these two depressions here that you're looking at, these are called as cerebellar fossa. In the posterior cranial fossa, in the occipital bone, we have these depressions where the cerebellums are placed, and that's why we call it a cerebellar fossa. So in the cerebellar fossa, we have the two different cerebellar hemispheres. In between them, there is a dual fold present here, which is attached above to what? It is above attached to again to the tentorium only. Falx cerebri is attached to the upper margin tentorium. Falx cerebelli will be attached to the lower margin. So it's a very, very small dual fold that is present in here. And where it is present, look at this crest here. This crest is called as an internal occipital crest. Protuberance to here. This is protuberance. This is called as crest. Internal occipital crest. There is a crest on the outside also. This is inside. So we call it internal occipital crest. Where what sinus? What fold? Sorry, the falx cerebelli will be attached. So if I just write a note on that first before we go any further. Falx cerebelli. We said it is attached like this. If this is a transverse tentorium cerebelli, let us say, if this is tentorium cerebelli, so what you will see that this falx cerebelli is attached on its undersurface like this. On the undersurface, below the tentorium cerebelli, it is. So one attachment is to the tentorium only. This lower attachment on the apex, you can say that is actually merging with the foramen magnum only. It is going downward to the foramen magnum. This posterior margin here, this posterior margin is attached to what? It is attached to the internal occipital crest. Longitudinal elevations are called as crest. Whereas this anterior one, that's a posterior margin, anterior margin is again free. That's a free margin. All these dual folds are having some free margin. Falx cerebelli was having lower margin free. Tentorium cerebelli is oriented like this, like for me. If it is oriented like this, so posterior is attached, anterior is free. Tentorium is the horizontal plane. So obviously the inner margin was the tentorial notch was a free margin, and one is attached margin. And once again, the dual venous sinus that you see in the relation here, the dual venous sinus which will be running like this, along with the internal occipital crest and taking the blood upwards, that sinus is called as the occipital sinus. It is coming from the occipital bone, so we simply call it occipital sinus. I'm going to correct all these. Just look at this. Occipital sinus. Falx cerebelli done. Tentorium cerebelli done. And the one which is underneath the tentorium, that is falx cerebelli, is also done. Diaphragma cell. Diaphragma cell is basically present between the clinoid process, anterior clinoid process, posterior clinoid process. So it is stretching between the clinoid process on the sella turcica. What is sella turcica? Pituitary fossa is. If you go here again into the section of the cranial cavity, look at this. This is where the pituitary gland will be present. That's a site for the pituitary gland to be present here. This one. So diaphragma cell is attached between them like this. So it is between the clinoid, anterior clinoid process. We have this posterior clinoid process and dorsum cellae. Both is going up each other as dorsum cellae. So this all is providing the attachment to what? To the tentorium, to the diaphragma cell, which is like a diaphragm on the sella turcica. Pituitary fossa is called as sella turcica. Turcica means Turkish saddle, like a saddle of a horse. So this, if you look at the shape, as well, there's a body back. When you sit on a horse, there's a special thing which is kept on it that is called the turcica, the saddle. So it looks like that saddle only. If I rub this off, look at this. It looks like a saddle only that you can keep one leg on this side, one leg on this side. So it looks like a saddle, so like a Turkish saddle. So sella turcica. And the thing about this, what do you say? The diaphragma cell is separating the pituitary gland. Pituitary gland will be below. Above we have diencephalon, above we have hypothalamus. But the stalk of pituitary, the pituitary gland is having a stalk. That stalk of pituitary is piercing this diaphragma cell and diaphragma cell going through it. So it's a stalk of pituitary and that's the pituitary gland. So we have a diaphragma cell which is over there, only giving passage to the stalk of pituitary, right? To the stalk of pituitary. Like if you look at the pituitary gland, just to tell you, this is the pituitary gland here. We have a neurohypophysis, we have adenohypophysis, two part, and this is what we call as a stalk here. So that's how exactly the diaphragma cell is conceived. So guys, this is about the dual fold. The first thing that you should know is about the dual fold attachment, because once you have a sound knowledge of the dual fold attachment, then only the rest of the topic can be discussed, that what and where the other dual venous sinuses are. At times people try to read the dual venous sinuses without knowing like particular detailed attachment of the dual folds, and that we are not able to understand how exactly blood is running through these dual venous sinuses and how it is going to drain outside. Now think of one thing, wherever those dual folds are, falx cerebelli will be like this, like in this vein here, then tentorium is present like this, falx cerebelli will be below here, and diaphragma cell is here. Ultimately they are all holding some dual venous sinuses. Ultimately these dual venous sinuses are having blood which is coming from the different sources, and we have to take this blood out of the cranial cavity. Now keep that in mind, that we just have to take the blood out of the cranial cavity. Whatever blood gets collected into the sinuses, we have to drain it out. We drain it out through MS3 veins, we drain it out through other veins, and we drain it out mainly through the internal jugular vein. Internal jugular vein is present where? In foramen here, there is jugular foramen is there. Below that we have internal jugular vein. So majority of the blood we have to bring toward this guys, toward this jugular foramen. So चाहे वो आगे से आ रहा हो blood, बीच में से आ रहा हो, पीछे से आ रहा हो, coming from any of the cranial fossa, from any of the dural fold, from any of the dural venous sinus, ultimately majority of the blood is leaving the cranial cavity through jugular foramen. How? We'll see that. Now it's time to look at a collective picture of falx cerebri, falx cerebelli, tentorium cerebelli. Diaphragma cell we can leave it because there is no dural venous sinus as such. And I really hope that you understand this orientation now, guys. If you're seeing it from the side here, this is the falx cerebri, right? resting on tentorium. Tentorium is the horizontal plane, something like this. That is this side, and that is the other side. That's tentorium cerebri, right? Horizontal plane. Let me highlight this to separate it from the falx cerebri. This here is tentorium. That's tentorium. And the one that you see underneath the tentorium, here, this is falx cerebelli. Right? So each one falx cerebelli. So this falx cerebri and this falx cerebelli, they are obviously in the vertical plane, and tentorium is in the horizontal plane or the transverse plane. Right? They are in the horizontal planes. Now, what dural sinuses we discussed and see how they're running? What we already have discussed, that the superior sagittal sinus will be running in the upper margin of falx cerebri, and will be draining the blood backward, running in this direction. This is inferior sagittal sinus. Then this is the straight sinus going back, that is straight sinus. The one which is coming from below here, what was that? That was an occipital sinus coming from falx cerebelli, that is occipital sinus. Now you can see that most of the blood is getting collected at this point, isn't it? If you look at all these arrows, they are ultimately converging to this point here. That is why close to the internal occipital protuberance, this is not the protuberance, close to the internal occipital protuberance, we have a point which is called as the confluence of sinuses. We have this confluence of sinuses. Confluence, the meeting point. It's a confluence of sinuses, the meeting point of the sinuses, confluence of sinuses. Once the blood comes into the confluence of sinuses, we need to take this blood out of the cranial cavity. Well, how? The blood from here, guys, the blood from here will run through the attached margin of the falx cerebri. I told you there is no dural venous sinus in the free margin, only in the attached margin of the tentorium. So what is that? That is the sinus is running in what sulcus? It is running in the transverse sulcus only. So sinus is also called as the transverse. It is also called the transverse sinus. Okay, let me label these first here till here, then we go any further. So we said that this sinus here is the superior sagittal sinus. This one here, which is the free margin of falx cerebri, that is the inferior sagittal sinus. Inferior sagittal sinus, as you can see, it is below, it is continuing backward as the straight sinus. There is a straight sinus. The one which is going up, that is occipital sinus, carrying the blood from the occipital sinus, ultimately taking it to this one. What is that? That is a transverse sinus. Transverse sinus. Now don't bother about that, what sinus is coming and meeting with this. We'll come to that. Transverse sinus. Then what happens is we said transverse sinus will meet with the superior petrosal, and they form a sinus which will go down. What sinus was that? That was a sigmoid sinus. From there onwards, you will see the blood will run in this direction, and that sinus is called a sigmoid, which is passing from the jugular foramen. That foramen here is a jugular foramen. This is the sigmoid sinus. And of course, the foramen here is a jugular foramen. As I'm writing JF here, that is jugular foramen, the JF jugular foramen. And what other sinus will go out of the jugular foramen is the inferior petrosal sinus. See, superior petrosal, superior petrosal comes and joins with this, the transverse only. Inferior petrosal will also come out of the jugular foramen. How about if I just quickly show it to you? Look at this picture if you can. Here we go. This is the superior petrosal sinus which is going backward and meeting with the transverse. But when the transverse will go down, look at on this side. That's a sigmoid. Transverse going down the sigmoid. Sorry. And the sigmoid sinus is joined with the sinus coming from here. They've actually cut that sinus. It is shown here. This one is going below, downward like this. It will be coming like this downward here from the cavernous sinus, and that is called as the inferior petrosal sinus. See, it is in the lower margin of the petrous temporal. This was in the upper margin of petrous temporal bone, so we call it superior petrosal. This is the lower margin of this petrous part of temporal bone, so we call it inferior petrosal. And it is going to join with which one? Sigmoid. But it joins the sigmoid sinus exactly at the level or just below the level of the jugular foramen. It joins with it just below the level of the jugular foramen. That sinus is the sigmoid. That sinus is the inferior petrosal sinus. Look at this. Inferior petrosal sinus is coming out separately and then joining with the sigmoid sinus just below the jugular foramen. That is the inferior petrosal. So what is this inferior and superior petrosal? I'll discuss it with you in a while. And when they join with each other just below the jugular foramen, this is where, and this is how the internal jugular vein is formed. They are the two sinuses which fuse together to give rise to that internal jugular vein, which is the carotid sheath. We know the carotid sheath is merged along with the jugular foramen and carotid canal. So this is the internal jugular vein. I want you people to please write it down like this. And remember, for any major vein in the body, you take in the body, the formative tributary is very important. How they are formed. Internal jugular vein is formed by the two sinuses. Which two sinuses? The sigmoid sinus and the inferior petrosal. That's a question also, guys. It's an MCQ question. Which two sinuses together forms the internal jugular vein? One is the sigmoid and inferior petrosal. Please note it down. Sigmoid and inferior petrosal together forms the internal jugular vein. With this arrangement, whatever we are looking at here, so first understand here what is done and what is still left here. Guys, superior and inferior sagittal sinus, they are present on the falx cerebri, and falx cerebri is anteriorly attached in the anterior cranial fossa. Listen to what I'm saying. It is attached anteriorly in the anterior cranial fossa. That means the superior and the inferior sagittal sinus will take the blood from the anterior cranial fossa and they will keep on collecting the blood in its way, come backward here, and then we have the straight sinus in what fossa? In the posterior cranial fossa. See, the rest of the sinuses are in relation to the tentorium or the falx cerebelli. So they are in which cranial fossa? In the posterior. Straight is in posterior, occipital is in posterior, transverse, sigmoid, they are all in posterior cranial fossa. What fossa is left? Middle cranial fossa is still left here. Now what we have for the middle cranial fossa, we have the largest dural venous sinus in the middle cranial fossa, which is present on either side of the sella turcica, on both the side of the sella turcica or pituitary fossa, and that is called as the cavernous sinus. That's the importance of cavernous sinus. It is the largest sinus, and it has to It has to take the blood from the orbit also. It has to take the blood from the brain as well. So like different places that you collect the blood from you. And that sinus is the cavernous sinus. So our target now onward in this lecture is to see that how cavernous sinus is formed, walls, relations and everything. And also to understand that what are the incoming channels of cavernous sinus and what are the outgoing channels of cavernous sinus. How the blood will come into the cavernous sinus and how it will leave. Before I show it to you, let's have a very quick recap of the sinus on this image, guys. You already have an idea about the superior and the inferior sagittal sinus. There is a straight sinus here. Can you see that sinus which is below in the falx? Look at this. This is the falx cerebelli, a very, very small fold below. So this sinus, what? That is an occipital sinus. This here is a confluence. Look at that. That's a confluence of sinus. Now the blood goes into which one? That is transverse. Look at that. That is a transverse sinus. From the transverse, it is going downward into the sigmoid sinus. And then your sigmoid is meeting with the inferior petrol sinus. That together, below the jugular foramen, they will be giving rise to the internal jugular vein. Some few more sinuses over there which we were to discuss. Cavernous sinus, look at this. That is cavernous sinus which is present in the middle cranial fossa. The better picture to see the cavernous sinus obviously is the transverse section. Here we go. That is the cavernous sinus. This is the middle cranial fossa where we have pituitary fossa. You can see pituitary gland over there, right? Pituitary gland and the stalk of pituitary. And this dural fold which will be present here will be the diaphragma celli. Now you have a cavernous sinus which is present on the side. On the side of the pituitary gland, we have the two largest sinus. And what you see, that cavernous sinus, if I just show you the overall picture, guys, cavernous sinus is receiving the blood. You can see the veins are coming from the orbit and draining into it. Some veins for the brain will come and drain into it, which is not shown here. Some dural venous sinus will also come and drain into it. There are some dural venous sinus which will drain into the cavernous sinus only directly. And then it will collect the blood from the different sources. And then the cavernous sinus will give off the blood or drain its blood via superior petrol sinus which goes into the transverse, or by the inferior petrol sinus which goes and joins with the sigmoid to ultimately form the internal jugular vein. So let's talk about this cavernous sinus with the help of a picture like this, the cranial cavity, and we'll be discussing the relations and everything after that. Now first, I want all of you to presume a transverse section of the cranial cavity to understand the cavernous sinus and its tributaries. You guys, let us see this is the cranial cavity, and obviously anterior cranial fossa, middle and posterior cranial fossa all within. Just to reduce confusion, I'm just not drawing everything else here. This, let us say, I'm directly going to the foramen magnum. Here we have the foramen magnum in the posterior cranial fossa. Cavernous sinus was situated on either side of pituitary fossa. So the largest dural venous sinus, cavernous sinus, let us say, are present here in the middle cranial fossa. One on this side, one on this side. How they are exactly formed, their wall, how they are formed, we will discuss that in a while pages. That's cavernous sinus. Before we show the cavernous sinus connection to the sinus that we have, can we just quickly draw those? So we said we have a sinus which is running backward in the tentorium. That was what? That was a straight sinus. Now there's an important point to understand. Straight sinus is coming backward. Now although we presume that straight sinus is coming backward and the blood will go to the confluence of sinuses. Yes, it is having a connection with confluence, but the majority of the blood, now listen to me carefully, majority of the blood which is coming into the straight sinus backward is basically going toward the left side. And it will continue as a left transverse sinus. Most of it, not all of it. Like this. And the superior sagittal sinus which will come back here to this point will continue mainly toward the right side, and that is a right transverse sinus. I'll explain this to you. Let's look at this first. So here's the straight sinus. I'm writing S for the straight sinus here. And you can see it is mainly giving off the blood or continuing its blood toward which side? Toward the left side. That is the left transverse sinus. That is the left transverse sinus. Whereas when you look at the right transverse sinus, the majority of the blood coming into the right transverse sinus is coming from the superior sagittal sinus. See, superior sagittal sinus will be going backward like this, at this margin here, will be reaching there at the back, and then that blood will be seen continuing mainly toward the right side as a right transverse sinus. So superior sagittal sinus will continue mainly toward the right side, straight sinus will continue mainly toward the left side. Yes, there is no doubt about that they are communicating with each other also, that there is a communication between them, and this whole thing is a confluence. This whole thing is a confluence of the sinuses. But yes, if the question is asked, so it's better you write it down, guys, that straight sinus mainly continues as a left transverse sinus, whereas superior sagittal sinus will mainly continue as the right transverse sinus. And that is why the right transverse sinus is larger also, because superior sagittal sinus is a big sinus. It is having a lot of blood is coming into it. As a matter of fact, maximum absorption of CSF takes place in the superior sagittal sinus. And then it is running toward the right side. So obviously we have more blood into the right transverse sinus. You also note that the right transverse sinus is larger than the left transverse sinus. I hope you're writing all these points. Right transverse sinus is larger than the left transverse sinus. Then what was the story here? Where the story from here was, and again just using a different color so that there is no confusion. First, let me go with this. The sinus here is a sigmoid sinus, right? We said there's a sigmoid sinus which will be running like this through the sigmoid sulcus and then into the internal jugular foramen. That's a sigmoid sinus. And what are coming to join the sigmoid one? It's from the cavernous sinus we have a sinus which goes backward and it goes into the transverse. Make sure draw it toward the transverse here. And this was present in the upper margin of the petrous temporal bone. That was superior petrosa sinus. And the one which will come down and will also go out to the jugular foramen to join with it, that is the inferior petrous sinus. Superior petrous sinus, and I'm writing it here, that it is going to drain into the transverse sinus. Whereas inferior petrosal sinus is going to drain into the sigmoid sinus. I mean, it is draining into the sigmoid sinus, or you can say it is joining with the sigmoid sinus. Whatever, draining or joining with the sigmoid sinus. And let's say here is the jugular foramen. If I put the jugular foramen. Is that clear? I think there should not be any confusion till now. It's just about remember which dual fold, what these sinuses are running in. So straight sinus is actually going backward, and then toward the left side. Superior side sinus will come from above, will reach this point, and then will continue toward the right side. Then they're both forming the sinus here, that is the sigmoid sinus. This one here is the sigmoid sinus, which is receiving inferior petrosal, and transverse is receiving the superior petrosal. Now, superior petrosal and inferior petrosal both are coming from where? From the cavernous sinus. The largest sinus, the cavernous sinus. So this picture is telling me that whatever blood comes into the cavernous sinus, that is how it is drained. But the bigger question is where cavernous sinus is receiving the blood from. Cavernous sinus can the blood transfer, guys. Cavernous sinus will be receiving the blood. See what is there here? Here will be orbit. Obviously, orbit will be there somewhere. So it will be receiving the blood from the orbit. It will be receiving the blood from some meninges also, like some dural venous sinus will drain into it. So we can say meninges are also draining into it. And then it is having some veins which are coming from the brain as well. We cannot show all of them here, so let's write it schematically that the blood into the cavernous sinus is coming from the orbit towards the orbit. The blood into the cavernous sinus is also coming from the brain. Let's say B stands for the brain. And blood into the cavernous sinus is also coming from the meninges. Some dural venous sinus will directly drain into it. So three incoming sources of the blood to the cavernous sinus will be from where? From the orbit, from the brain, and then from the meninges also, I showed you. Let's write down separately. This diagram will get otherwise very complicated. Let's write down all these incoming channels of the cavernous sinus. Incoming channels are also called as tributaries. Coming inside is tributaries. The one which are leaving the cavernous sinus are called as the drainage channels. So incoming channels for tributaries and then the drainage channels. Let me write it here. Incoming channels. We still have to discuss the location of the cavernous sinus and how it is formed exactly in the relationship. But I'm telling you about the drainage channel first. So first is the incoming channels, also called as the tributaries of the cavernous sinus. Incoming channels of tributaries. As I said, incoming channels are coming from three different sources. First is O. O stands for the orbit. Now, what are the veins which are coming from the orbit and draining into the cavernous sinus? Well, the ophthalmic veins. We have two of them. We have a superior ophthalmic vein. We got a superior ophthalmic vein, and we got inferior ophthalmic vein as well. Superior ophthalmic vein and inferior ophthalmic. These are the two veins which are present in the orbit. When we will discuss about the orbit, you will again see all these things here. Again, guys, emphasizing the same thing. By the time we reach the orbit, we must have done so much about everything that things will become very easy. We already have an idea about the nerves in the orbit. You know how nasociliary nerve is running, how frontal nerve is there, how lacrimal nerve is there. We know there are two veins also. We know about the location of ciliary ganglion. So the things will obviously get easy by the time we reach the orbit. If we start directly with the orbit, then you have to we will be discussing everything there itself in the orbit, and we will find it a little difficult to grab everything together. Superior ophthalmic vein, inferior ophthalmic vein, they are definitely the incoming channels from the orbit. And then the third one, which is not always present, that is called as the central vein of retina. Not always present means the central vein of retina is always there. It is present inside the optic nerve, central vein of retina. But central vein of retina is not always draining back into the cavernous sinus. Central vein of retina, sometimes it keeps running in the optic nerve, it come backward and then directly drains into the cavernous sinus. So this, it may be or it may not be an incoming channel. But these two definitely are the incoming channels from the cavernous, from the orbit toward the cavernous sinus. Then we said D. D stands for the brain. There are some veins which are coming from the brain and draining into the cavernous sinus. One of them is called as the superficial middle cerebral vein. Superficial middle cerebral vein. And the other one is the inferior cerebral vein. Well, what are they, guys? Let's not discuss it right now because that's completely a part of the neural anatomy, so we cannot discuss it here. We'll be discussing it in the neuro part. Because there are certain veins of the brain. One of them is called a superficial middle cerebral vein, which will drain into directly into cavernous sinus, and one is which is present at the inferior surface. And be very careful, it is inferior cerebral vein, not internal cerebral. That's a different thing. It's inferior. It is on the inferior aspect of the cerebrum, so we call it inferior cerebral vein. These are the two veins which will come from the brain and drain directly into cavernous sinus. What is the exact location? That is not the subject of discussion right now. There's no point in discussing it right now. And then we said meninges. M stands for the meninges. Meninges means there are some dural venous sinuses which are coming and draining into the cavernous sinus. One of them is called as the sphenoparietal sinus. There is sphenoparietal sinus, and one is the middle meningeal sinus. These are the two sinuses which are draining into cavernous sinus. There is sphenoparietal and middle meningeal. Just to give you an idea about that, where the sphenoparietal and middle meningeal sinus is. Sphenoparietal, if you written is sphenoparietal sinus and middle meningeal sinus. Once again, I have to take you back to the pictures here. Okay, here's a picture which shows some incoming channels. And look at this, guys. This sinus which is running here on the margin of this, see, it is coming from the parietal bone above, and then you see it is running with the lesser wing of the sphenoid running backward and draining into the cavernous sinus. This is what you call as the sphenoparietal sinus. Sphenoparietal sinus coming from the region of the parietal bone and then running along with the lesser wing of the sphenoid bone, sphenoparietal. And then we have a main artery coming inside. We all know middle meningeal artery. Middle meningeal artery comes in middle meningeal vein. So one of the tributary of the middle meningeal vein. One of the tributary of the middle meningeal vein will also drain into the cavernous sinus. That is called as the middle meningeal sinus. Middle meningeal artery is there, so middle meningeal vein will also be there. There are two tributaries of middle meningeal vein. Anterior tributary of middle meningeal vein. Just remember that the tributary of the middle meningeal vein also drains the blood into cavernous sinus. So we call it middle meningeal sinus. See, what's the difference between the vein and the sinus, guys? When you say vein, it is having tunica intima, tunica media, tunica adventitia. But when you say sinus, then when any vein goes between the two layers of dura mater, it will lose the outer layer. Like tunica adventitia will be merged with the dura mater. Tunica media muscles will be gone, and only tunica intima will be remaining here. So a vein will go and merge with the dural fold of dura mater, and it becomes a sinus only, right? It becomes a sinus. cerebral vein. So guys, these are called as what channels? Incoming channels. These are incoming channels or tributaries. Outgoing channels, you already saw the two outgoing channels. Whatever blood comes into cavernous sinus going back through this one and this one. That is superior petrosal and inferior petrosal. But there's a small catch here. There's a small catch that you all need to pay attention to. We said these are all incoming channels. Fine. Now, if I write the outgoing channels of cavernous sinus, which are also called as the drainage channels, they include number one, let's write down the one we already knew, that is superior petrosal sinus, clearly. Superior petrosal sinus, inferior petrosal sinus, and this might surprise few of you, and that is superior ophthalmic vein. Yeah, bro, how come superior ophthalmic vein is an outgoing channel? Because we already said superior ophthalmic vein is an incoming channel. There we have it. We already write the superior ophthalmic vein as an incoming channel. Then why are we writing it in the outgoing channel? The reason is superior ophthalmic vein is an emissary vein. Emissary veins, the veins without valve. So if there is no valve in the superior ophthalmic vein, the blood from the outside can go into the cavernous sinus, and from the cavernous sinus it can come out also. And if you remember, when we talked about the dangerous connections of the face, one of the dangerous connections was superior ophthalmic vein, because it is connecting outside to the angular vein, and inside it is connected to the cavernous sinus. The emissary vein. It is one of the emissary veins without valve. That is an emissary vein. There is an emissary vein, and that's why it is counted both as an incoming and outgoing channel. Well, we also have some sphenoidal emissary veins also. Let me remind you of that also. Sphenoidal emissary vein. If you remember, guys, cavernous sinus having two dangerous connections to the face. One was to the superior ophthalmic vein, and one cavernous sinus is connected outside to a plexus present here called the pterygoid venous plexus. I hope you remember. There is a plexus of vein here called the pterygoid venous plexus. So it is connected to the pterygoid venous plexus, and that is another dangerous connection of the face. So sphenoidal emissary vein. These are the sphenoidal emissary vein which will go down and connect the cavernous sinus to the pterygoid venous plexus. I hope you understood about the incoming channels and the outgoing channels. Now there are some communicating channels also. Communicating means both cavernous sinus are communicating to each other also. Where? Let's look at the diagram. If I look at this diagram once again, how cavernous sinus are connected to each other? Cavernous sinus are connected to each other anteriorly and posteriorly. So there is a sinus which is called as anterior intercavernous sinus, and there is a sinus here which is called as the posterior intercavernous sinus, which is present in front and behind the pituitary gland. Pituitary gland will be somewhere in the middle here. Pituitary gland will be here, guys, right? So this sinus here is called as the anterior intercavernous. I'm writing in short, I'll write separately. Anterior intercavernous sinus, and this is posterior intercavernous sinus. Anterior intercavernous sinus, and similarly this is posterior intercavernous sinus. So basically the point is, if there is a more pressure inside a cavernous sinus, then it can relieve the pressure by sending some of the blood into the other cavernous sinus also. So cavernous sinus, they do communicate with each other. And again, these connections are valveless connections only. Between the two cavernous sinus, these are valveless connections here. Which at times is a problem also, because let's say there is any infection in one cavernous sinus, it can easily get transmitted to another also. So it's a disadvantage of. Advantage we have, they can actually share the pressure, but disadvantage is that obviously the infection of one cavernous sinus can get transmitted to the another cavernous sinus also. We have a little more to discuss here before we come out of this cavernous sinus thing and then talk about the formation of the cavernous sinus and its relation. Guys, there is a venous plexus which is present here. Now look at this. This part of the skull bone here, the slope over there is called as the clivus. Again, you want to look at the video, guys. The slope here is called as the clivus, where the brainstem is present, and we know the brainstem will come outward from this foramen magnum and will continue below the spinal cord. So there's the clivus over there. And there's a venous plexus that you will see present here in this region here, and that venous plexus is called as the basilar venous plexus, where the basilar artery is present. We have this venous plexus right in front of it. We call it a basilar venous plexus. Somewhere here, that plexus is called as basilar venous plexus, and that basilar venous plexus will be connected outside to a plexus around the spinal cord, which is called as a vertebral venous plexus. So very important and very interesting clinical coming up here. Let me just draw only this part separately so that you understand what I'm telling you. As I'm saying that if this is a cavernous sinus of the left side, that's a cavernous sinus of the right side. Here we have anterior and posterior intercavernous sinus. This is the posterior intercavernous sinus which I need for this discussion. And you have an inferior petrosal sinus which is going like this. As I said, I'm just drawing the one which are relevant here. There is an inferior petrosal sinus which is going through what? The jugular foramen. Where is foramen magnum? Let's say this here is the foramen magnum. This is foramen magnum, and just for the sake of discussion, guys, let us say this here is the spinal cord, which you can see out of the foramen magnum. Although brainstem goes out of it, but obviously below you can see the spinal cord. There is a venous plexus which is present around the spinal cord. In fact, it is present outside the lever mater of the spinal cord, inside the foramen magnum. You can see it from the foramen magnum and into the entire vertebral column. Whole vertebral column, there is a venous plexus which is present around the spinal cord, and this venous plexus is called as the vertebral venous plexus, also called as the Betson's plexus. Vertebral venous plexus, also called as a Betson's plexus. People who are reading abdomen right now, there is a good connection coming up here. And as I said, there is a venous plexus that you will see which is present on the clivus. That here will be the clivus like this, and there is a venous plexus present over there. This venous plexus is called as a basilar venous plexus. I'm writing BVP. BVP stands for basilar venous plexus. And this basilar venous plexus, how it is formed? It is formed by the contribution of that all that you see here, guys. We have directly we have contribution coming from the cavernous sinus. We have a contribution coming from the posterior intercavernous sinus. You will see the connection which is coming from the inferior pectoral sinus also like this. So they're all contributing to the formation of a plexus which is called as the basilar venous plexus. And this basilar venous plexus is in contact or in connection through the foramen magnum to what? To the vertebral venous plexus. To the vertebral venous plexus or Betson's plexus. And they're all valveless connection. None of them is having a valve. They're all valveless connection. Whether it is the basilar venous plexus or Betson's plexus or these connecting tributaries or whatever. All these they do not have valve inside. The point is guys, cavernous sinus is connected to the basilar venous plexus. Basilar venous plexus is connected to the Betson's plexus. Betson's plexus is present all around the vertebral, around the spinal cord in the entire vertebral column. In the vertebral column, in the lower part here. Then we have a plexus which is present around the prostate gland, the prostatic venous plexus. Around the prostate gland, there is a venous plexus, prostatic venous plexus, which is also connected to the Betson's plexus posterior. If this is a prostate gland, and this is the abdomen, we have a prostatic venous plexus, and this prostatic venous plexus is connected backward or draining backward into the Betson's plexus or vertebral venous plexus. Vertebral venous plexus above is connected to what? Basilar venous plexus, and basilar is to the cavernous sinus. So can you again see a dangerous connection here? That is the reason that the carcinoma of the prostate gland, the prostatic carcinoma, they can also metastasize into the cranial cavity. They can reach the cranial cavity also. Imagine the cancer of origin, which is of the prostate gland, using these venous connections. Prostatic venous plexus to where? To the vertebral. Vertebral venous plexus to what? Basilar. Basilar to what? Cavernous sinus. It can reach the cavernous sinus also. It can reach the cranial cavity or even to the cavernous sinus also. So this tells you about how the plexus which is present all the way below in the pelvis, the vesicular or the prostatic venous plexus, is having connection with the cranial cavity. So this is about how these dual venous sinuses are arranged. Before we talk about the relations of the cavernous sinus and this, which is very important because cavernous sinus, and again, this could be a short note again into a combined long question also. That about all the drainage channels incoming and the outgoing channels of the cavernous sinus. Cavernous sinus along with its relations and blood supply, the dura mater nerve supply, collectively can be a long question again. Let us first count down that what are overall sinus we have guys. How many paired sinuses and how many unpaired sinuses we have. Let's make a list and I want you to participate in this. Paired dural venous sinuses are very devious and unpaired dural venous sinuses. Let me tell you how many are paired guys and then we'll try to go with them. You know, there are 8 paired sinuses and there are 7 unpaired sinuses. Let's try paired sinuses both sides. The one which are very obvious. Let's start with the obvious paired sinus. The largest one is the cavernous sinus. Cavernous sinus was a paired sinus. Then the 2 tributaries, the 2 drainage channel of cavernous sinus, again those sides, superior petrosal and inferior petrosal. So we have a superior petrosal sinus. We got inferior petrosal sinus. Okay. What other sinus we have? The transverse is there. The sigmoid is there. Transverse sinus, sigmoid sinus. The 2 sinuses that we said, let me add 2 more to this list. 2 sinuses that we said are the incoming channels of cavernous sinus. We said that some meninges or some dural venous sinuses are draining into the cavernous sinus. Which 2 are draining back into the cavernous sinus? One was the sphenoparietal. One is the sphenoparietal sinus, and one was the middle meningeal sinus, middle meningeal vein, middle meningeal sinus. And the number 8, which we haven't talked about yet, just remember the name guys, nothing important here. The sinus which is present in the junction between the petrous part and the squamous part of temporal. When you see the cranial cavity, there is a petrous part of temporal bone and there is a squamous part of temporal bone. It is running between the 2, and that is called, that's why the name given to it is a petrosquamous sinus. That's a petrosquamous sinus. These are the 8 paired sinuses we have. This one you got to remember. Rest everything you've talked about somewhere. The paired sinuses. Unpaired sinuses. There are 7 unpaired sinuses. Obviously, the one which are in the midline: superior striatal, inferior striatal, straight, occipital sinus, anterior intercavernous, posterior intercavernous, basilar venous plexus, is of midline present. All these are the midline, and all of them are the unpaired sinuses. So we go with the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous, posterior intercavernous sinus, and then we said basilar venous plexus also. Count the basilar venous plexus also. So all these sinuses are unpaired. That again is a question here, that how many paired and unpaired sinuses we have in the cranial cavity. 8 paired sinuses, which makes it 16 actually, paired into those sectors, and then we have 7 unpaired sinuses. So if you understood this, how this cranial cavity, the dura mater, how this dural venous sinuses are there, and also direction of the blood flow, let's go into the more details of cavernous sinus. How cavernous sinuses form, what are its relation inside, outside, and about some very interesting clinical anatomy of the cavernous sinus as well. To understand the cavernous sinus in detail, the best section is the coronal section. Now, I want first of all to anticipate guys how this section will look like. If you take a coronal section of the skull, if you take a coronal section exactly from the pituitary fossa. Now imagine this is a pituitary fossa. This may have a pituitary gland or cover as pituitary fossa, and cavernous sinus is on the side here. We have one cavernous sinus here, we have one cavernous sinus here on both the sides of pituitary fossa here. That's how the picture will be. So we have a body of sphenoid, there is a sella turcica in it, pituitary gland will be resting in it, and then on the side we have the cavernous sinus. Okay. Let's draw it schematically and correct also. If this here is the body of sphenoid, and this depression here is the pituitary fossa. These are the sphenoidal air sinuses. No surprises there. That's the sphenoidal air sinuses. In the pituitary fossa, we said what is hanging here, the pituitary gland is like this. Here is the, let's say, the neurohypophysis, and let us say this here is the adenohypophysis. We said we have two layers of dura mater. We have one layer of dura mater which is adherent to the bone, and that is the endostel, and the one which is meningeal layer, which is going with the brain and its extensions. Look at this. To understand the walls of cavernous sinus, which wall is made up of what? If you see, the endostel layer of dura mater will be something like this. It is adherent to the bone. So this is the endostel layer. It is going along with the bone. There is endostel layer continuing here, and there it is. There is an endostel layer itself. Meningeal layer of dura mater. Let me use a different color for that. Meningeal layer of dura mater is this. That's cavernous sinus. So whatever I'm highlighting here, guys, this sinus, you can see red one here is the meningeal layer of dura, and blue one is the endostel layer of dura. These are the cavernous sinus which are situated. So the right and left cavernous sinus you're looking at, which are obviously made up of the endostel layer and meningeal layer. If I look at this carefully, the roof and the lateral wall is completely made up of what layer? It is made up of the meningeal layer. Medial wall is partly by the meningeal layer and partly by the endostel layer. Partly by the meningeal layer, partly by the endostel layer, and floor, because floor is by the skull bone. So floor is also by what layer? Floor is also by this endostel layer. What is to be discussed in the cavernous sinus? When you see the coronal section, cavernous sinus is like a sponge. If you take a section of a sponge, you have many pores inside it. The structures which are in relation to cavernous sinus, we have few nerves which are in the lateral wall of cavernous sinus. We discussed few of them. There are few structures which are inside the cavernous sinus, and again, there's a reason for that. Few above the cavernous sinus, guys. Now look at this. Let me just draw this entire thing, and then I'll write all about the cavernous sinus. So there are certain nerves which are situated in the lateral wall of cavernous sinus. There is a third nerve is there, fourth nerve is there, ophthalmic nerve is there, and if I go with the old text, maxillary nerve is also there in the lateral wall. But as per latest grades, maxillary nerve is not in the lateral wall. But I will still suggest you to write it, because all your textbook that you read in this, the fourth nerve is also mentioned. That maxillary nerve is also mentioned. So this one nerve, there is a third nerve, there is oculomotor nerve, the trochlear nerve, and this one we discussed, guys, ophthalmic nerve, and this I would say maxillary nerve. They are present in the lateral wall of cavernous sinus. Maxillary nerve, although as per the latest grades, it is not in the lateral wall of cavernous sinus, but I don't know if your teachers will accept it or not. So let's go with the BDC and Vishram Singh, whatever these books says. But this is for your own knowledge, that maxillary nerve is now not considered in the lateral wall of cavernous sinus. It is actually present below the level of cavernous sinus. They've done some micro dissections and they found out that it is actually present below the cavernous sinus. But let's check. Whatever the usual book says. So these are the nerves which are present inside the lateral wall. What is inside cavernous sinus? We have internal carotid artery running inside the cavernous sinus. The internal carotid artery is present inside the cavernous sinus, and we have a sixth nerve also which is inside the cavernous sinus, just inferior lateral to it. Relation should be correct. When you look inside the cavernous sinus, inside we're talking about, we have internal carotid artery. I'll tell you why it is there inside, and sixth nerve. And this sixth nerve is inferior lateral to artery. Inferior lateral to internal carotid artery. That is the sixth nerve. The abducent nerve is just below and lateral to the internal carotid artery. What is there in the roof? I'm drawing it and then I'll justify also, guys. What is there in the roof? In the roof, again you will see internal carotid artery in the roof. How can we see internal carotid artery above also? Along with optic chiasma. You all know what is optic chiasma? The decussation of the optic tract, that is the optic chiasma. So that optic chiasma is also seen. So what is that? That is the optic chiasma. Plus again internal carotid artery. Guys, in the floor there is a foramen present here which is called as foramen lacerum. In the skull there is a foramen called as foramen lacerum that is there in the floor here. I'm not drawing it here. Now let me first justify why internal carotid artery is seen twice in this relation. You're seeing it above also, you're seeing it inside also. How about if we quickly have a look at the picture first and then I will justify. Here, let's look at this, the coronal section. This here is the coronal section. Now can you see that's the roof, the lateral wall, the roof, the lateral wall here. There is a floor and the medial wall, right? There is a medial wall as well. And you can see there is an endostel which is along with the skull bone here, and that's a meningeal that you see which is surrounding the pituitary gland. It's meningeal. And what you can see here, that in the lateral wall, the nerves which are shown in the lateral wall here, the third nerve is shown here, the fourth nerve is in the lateral wall, ophthalmic nerve is here, and maxillary nerve is also there. Inside we have internal carotid artery, and you can see just inferior lateral to internal carotid artery is the sixth nerve. And the same internal carotid artery is shown above, along with this optic chiasma. You can see in the superior relation, optic chiasma is also shown. But actually, why optic chiasma? Internal carotid artery is seen twice. But the internal carotid artery, it enters into the cranial cavity from the foramen lacerum. We said in the floor, what foramen is there? Foramen lacerum is there. I'm just going to if you want to draw it, you can draw it. It's your choice. It's not. It's just for understanding. If this is cavernous sinus from the side view, if I turn the head like this and you see the cavernous sinus in this way, we said foramen lacerum is present like this in the floor here. Internal carotid artery will enter through the foramen lacerum. This is foramen lacerum. Internal carotid artery will enter through the foramen lacerum, goes into the cavernous sinus. Now the problem with internal carotid artery is same problem. Internal carotid artery, guys, it was a direct continuation of common carotid artery, and we know that the pressure in the internal carotid artery will be very high. It is directly coming from common carotid, and on left side especially, internal carotid or common carotid is coming directly from the arch of aorta. So this basically is a straight blood coming from the arch of aorta through the common carotid and internal carotid and going into the brain. If you provide the brain with such a strong pulsation, internal carotid artery pulsation is strong. If you give this strong pulsating blood into the brain, then it can damage the neural tissue also. So what happens is that this internal carotid artery goes inside, it goes forward, it comes backward, and then it goes into the brain. Like this, it goes forward, it comes backward, and then it goes into the brain. So that the pulsation of the internal carotid artery are slightly dampened, we dampen, reduces the pulsation of internal carotid artery because of this loop here. This loop here is called as the carotid siphon. This loop here is called as the carotid siphon. This is all we're going to discuss in neuroanatomy also because it's a artery supplying the brain. So that is a carotid siphon here. And carotid siphon का advantage क्या है? It is dampening or it is reducing the pulsation of internal carotid. And because of this carotid siphon, you are able to see internal carotid artery twice. Once inside the cavernous sinus, look at that, and once above the cavernous sinus. So when I take a coronal section, that's how it looks like. I'll see this artery here. This artery will be coming in front like this, and then going backward above the cavernous sinus. That's the reason you are looking at internal carotid artery twice in the relation, and that is because of the carotid siphon, which is just a compensation, which is just an extra loop of internal carotid artery to dampen the pulsation, so that the brain receiving the blood from the internal carotid artery will not have to face such strong pulsations. Right. So keeping this picture and the diagram that we drew in mind, how about we write down these relations, guys? Keeping that image, let me just put this picture on the side here, and let's write down these relations here first. Okay, if we start writing the relations first, let's start with medial relations. What, according to you, are the medial relations of cavernous sinus? Clearly, there is pituitary gland over there. जो दिख रहा है वो लिखना कुछ स्पेशल नहीं करने की जरूरत है. Pituitary gland is a medial relation. Sella turcica is a medial relation. Body of sphenoid, and that body of sphenoid is having what sinus? Sphenoidal air sinus. Sphenoidal air sinus. They are all medial relation and they are quite visible. They are all pituitary gland is there, the sella turcica is there. That's a body of the sphenoid. Obviously, these are the sphenoidal air sinuses. I'm writing it S-A-S over there. These are sphenoidal air sinuses. Clear? Absolutely, no problem. Now, lateral relation, guys. Now, understand one thing. When I say lateral relation and the structures in the lateral wall of cavernous sinus, they are two different things. These nerves are basically adherent to the cavernous sinus. Relation का मतलब है something which is outside here. What is outside the cavernous sinus is a part of the brain, is a part of a temporal lobe, and that is called as uncus. What is uncus? Just don't bother about it. It is a primary olfactory area which is just lateral to cavernous sinus. So the lateral relation of the cavernous sinus is called as the uncus. Lateral relation is the uncus. Uncus is a part of temporal lobe. It's a part of temporal lobe, and it is a primary olfactory area. Olfaction. It's a primary olfactory area. What is there in the roof? Now, posterior relation. What is there in the roof? Guys? In the roof, we have internal carotid artery and optic chiasm. Internal carotid artery and optic chiasm is there. What is there in the floor? Which foramen is there in the floor because of which internal carotid artery entered inside? That is foramen lacerum. Now, what relation I can't see here is the anterior and the posterior relation. I can't see anterior end and the posterior end of cavernous sinus. So I'll write it separately. What is anterior and posterior? I can see roof, floor, medial wall, lateral, but I can't see what is anterior end and posterior end. But what other ways of writing the relation? Now, after writing the relation, you should write down that nerves in the lateral wall of cavernous sinus. I'm just doing all this to tell you how to write down these answers also. Nerves present in the lateral wall of cavernous sinus, clearly there is a third nerve, fourth nerve, ophthalmic nerve, and as I said, a little controversial, the maxillary nerve. Then you should write down about these structures inside cavernous sinus. Structure inside the cavernous sinus includes the internal carotid artery and sixth nerve, abducens nerve. And we already said abducens nerve is just inferior lateral, side and below, inferior lateral to the cavernous sinus. Internal carotid artery is inferior lateral. That is about the relations. So when you write down the relations of cavernous sinus, that's how you write it. Medial, lateral, roof, floor, structures in the lateral wall, and then structures inside the cavernous sinus. Now, coming to a very important thing, that is an end. Anterior end of cavernous sinus and posterior end of cavernous sinus, and see why they are important. You understand that why they are important again by looking back here. Look at this image here. This is cavernous sinus. This is cavernous sinus here. What is the anterior end? What fissure is we have in that region? We have a superior orbital fissure there. We kind of discussed about that. Superior orbital fissure will be giving passage to many nerves. Even the nerve which is running in the lateral wall, ophthalmic nerve, the branches of ophthalmic nerve will go into the fissure. So anterior end or the anterior relation of the cavernous sinus is the superior orbital fissure. That's a very important relation. And the posterior end of cavernous sinus is related to the apex of petrous temporal bone. How about if I use a different picture here? Let's say this one. This is perfect picture to show that. Look at this. This is the cavernous sinus here. Now you can clearly see there is a superior orbital fissure anterior in the anterior end. And posteriorly, what bone is that? There is a squamous part and there is a petrous part. Petrous part of temporal bone and the apex. That's the apex of petrous temporal bone. That's the apex of the petrous part of temporal bone, which is exactly the posterior relation of cavernous sinus. So anterior end is a superior orbital fissure, and that relation is very important. So I want just nothing to draw that, just please write it down. That anterior relation, the anterior end is in relation to superior orbital fissure. It's very, very important relation in CV. And posterior end is related to the petrous part of temporal. Relations are something which I really want all of you to understand, because there's so many relations. People who are doing abdomen in their colleges or who are doing head and neck, you probably would have realized by now relations. I mean, there's so many relations, and it's not practically possible to remember all the relations or make a mnemonic and try to remember all the relations. So it's very important to visualize them. You have a picture in your head. You got to have this coronal section of pituitary gland of this cavernous sinus and pituitary gland set in your brain. Then you think of cranial cavity. Okay, cavernous sinus, superior orbital fissure. If you go posteriorly, the two outgoing channels are coming from there. There is an apex of petrous temporal bone. So you should be able to visualize that. This should not be just in black and white. It should be like an image engraved in your memory. We said, guys, anterior end relation is superior orbital fissure. Now see, it's such an interesting thing, you guys. Inside, look at me guys. Inside the cavernous sinus, we have internal carotid artery. Now it's presumed that if there is an aneurysm of internal carotid artery, you know aneurysm, right? There's a dilatation of the wall that is called as aneurysm. So if there is an aneurysm of the internal carotid artery, and let's say that aneurysm ruptures, if the aneurysm will rupture inside the cavernous sinus, then obviously internal carotid artery will start pouring its blood into the cavernous sinus. Internal carotid artery का अंदर rupture हो गया, तो blood will be poured into the cavernous sinus. And when the blood is poured into the cavernous sinus, when the cavernous sinus is filled with the blood, which is coming from internal carotid artery, what will happen? Every time internal carotid artery is having a very strong pulsation. Every time internal carotid artery will pulsate, what will also pulsate? The entire cavernous sinus will also pulsate. The entire cavernous sinus will also pulsate. And if cavernous sinus will pulsate, what is the anterior end of cavernous sinus? Superior orbital fissure. That means it will pulsate and it will push the content of the superior orbital fissure. The content of the superior orbital fissure are obviously facing toward the orbit. That means the entire structures of the orbit are pushed forward with every pulsation. And that will lead to a condition where your eyeball will be doing like this. It will keep on popping like this. That is called a pulsating exophthalmos. Pulsating eyeball or pulsating exophthalmos. इसको pulsating proptosis बोलते हैं. Like your eyeball will pulsate every time that you listen. Your eye will get protruded and then come back. Protruded and come back. So it's pulsating, pulsation of the eyeball, pulsating exophthalmos. Let me write that clinical for you. What I'm saying is that the rupture of internal carotid artery aneurysm inside cavernous sinus, will lead to the pulsation of cavernous sinus with internal carotid artery. Therefore, push the contents of orbit with each pulsation, and that condition is called as the pulsating exophthalmos. Either you call it pulsating exophthalmos or you can even call it pulsating proptosis. Exophthalmos word we usually, the term is used for the hyperthyroidism. So pulsating exophthalmos, clinics when you go and read in the ophtha part, they less commonly call it pulsating exophthalmos, they more commonly call it pulsating proptosis. But after you put exophthalmos, you can go with it. I mean, it's not wrong absolutely, but the more correct word is pulsating proptosis. Pulsating proptosis. Right? So this is about the cavernous sinus, incoming, outgoing channels, its formation, structures in relation you see, and you also talk about the clinical of this cavernous sinus. With the nerve supply first. Nerve supply of cranial dura mater. Because if I just draw it now, I don't have to write any unnecessary point. Everything will be clear in the diagram itself. That to which cranial fossa, what nerve is supplying. Cranial fossa, that is transverse section to cranial cavity. Here is the anterior cranial fossa, middle cranial fossa, and then there is the posterior cranial fossa. Of course, that is the foramen magnum. So let me just draw a midline here so that I can divide this cranial cavity in two halves. That's one easy way to show the nerve supply. This, what fossa is that? That is the anterior cranial fossa. This is the middle cranial fossa, and we got the posterior cranial fossa here. So we just got to look at the nerve supplying the anterior, middle, and posterior cranial fossa. Something that we discussed earlier will be used here, guys. When I say nerve supply, ophthalmic nerve, maxillary nerve, and mandibular nerve. Trigeminal nerve is a dominant nerve supplying the dura mater. Especially your anterior and middle cranial fossa is supplied by the trigeminal nerve, ophthalmic, maxillary, mandibular. Now, do you remember any branch of ophthalmic nerve which is supplying the dura mater? And that was the anterior ethmoidal nerve. Ethmoidal nerve, remember anterior ethmoidal, posterior ethmoidal nerve. Ethmoidal nerves are the branches of the nasociliary, out of which anterior ethmoidal nerve I told you it goes into the cranial cavity and then it comes to the nasal cavity also. So if you look at the nerve supply, anterior ethmoidal nerve is a branch of the ophthalmic nerve and that is supplying the dura mater. But where it is supplying it is supplying in the anterior cranial fossa, close to the midline. Let me just use a different highlight here, guys. Close to the midline in the anterior cranial fossa. This is where anterior ethmoidal nerve is supplied. Now just look at this, what I'm doing here. Maxillary nerve, there is a branch, although we haven't discussed it, but when you look at the maxillary nerve, there is a branch of maxillary nerve which goes back into the cranial cavity from the same foramen rotundum only. Main maxillary nerve goes out of foramen rotundum, but there is a branch of maxillary nerve which comes back through the same foramen rotundum. That is meningeal branch of maxillary nerve, which is supplying the dura mater, lateral part of the anterior cranial fossa, and some part in the middle cranial fossa also. Whereas predominantly the nerve supplying to the middle cranial fossa is by the mandibular nerve. Now this is how it is not. This is not the way it is explained in your books because I wanted to understand that which cranial fossa, where exactly dura mater is supplied to what nerve. Now look at this, guys. What is that? That is the area of what nerve? Anterior ethmoidal nerve. You already know anterior ethmoidal nerve is a branch of nasociliary nerve. And nasociliary nerve is a branch of ophthalmic nerve. So you should know. Just saying that ophthalmic nerve is supplying the anterior cranial fossa is not enough. You should know which branch. This blue color here, which I'm showing you guys, this here, it is the meningeal branch. There is a meningeal branch of maxillary nerve. I told you a branch of maxillary nerve comes back into the cranial cavity from the same foramen rotundum, and the important thing is it is supplying the dura mater of anterior as well as this middle cranial fossa. Middle cranial fossa predominantly it is supplied by the nervus spinosus. I don't have to tell you guys, nervus spinosus is a branch of mandibular nerve. We are looking at this nerve supplying the lower part, although this nervus spinosus is supplying the dura mater on the side and in front also. So basically anterior cranial fossa in the upper part, if you see the superior part of anterior cranial fossa, it is getting a contribution from the nervus spinosus also. Getting a point? So all, even if you just write that trigeminal nerve, ophthalmic nerve, maxillary nerve, and mandibular nerve are supplying the dura mater of anterior and middle cranial fossa, that is good enough for your answer. But for your understanding, because what we have already discussed these nerves, so I want you to like kind of correlate it, guys. Anterior ethmoidal nerve supplying the anterior cranial fossa close to the midline. Maxillary nerve is supplying the adjoining part of anterior and middle cranial fossa, and the main nerve of the dura mater. Middle laryngeal artery is the main artery, and nervus spinosus is the main nerve. It is supplying the dura mater in the middle cranial fossa, the predominant part of the middle cranial fossa. Whereas when you see the posterior cranial fossa, the way the nerve supply is explained or described in the P.D. Chaurasia or in Vishram Singh, it is not enough. I'm telling it from the grace here. How they explain the nerve supply of the dura mater in the Gray's Anatomy, that the nerve which are supplying close to the foramen magnum and away to the foramen magnum. Now this is foramen magnum, guys, of course. And here we have, this is the area which is close to foramen magnum, but the one which I've highlighted here. So first of all, away from foramen magnum, the posterior cranial fossa dura mater is supplied by the 10th nerve. It is supplied by the 10th nerve. It is also supplied by the 11th nerve. Again, if you go into very great detail, even facial nerve branches are supplying it, guys. Facial nerve branches also supplies the dura mater of the posterior cranial fossa. Some people say even hypoglossal. Hypoglossal being a motor nerve, but the C1 using the hypoglossal nerve comes in here. But I'll again go with the text of your books here. 10th nerve and 11th nerve, they're supplying the dura mater of posterior cranial fossa. Where? Away from foramen magnum. Close to foramen magnum, it is supplied by the C1, C2, and C3 spinal nerves. Not the cranial nerves, spinal nerves. C1, C2. First three cervical spinal nerve, they go from the foramen magnum and they do supply the dura mater of the cranial fossa. So I believe, although it is like it's a diagram here, you don't have to draw this, but it is easier way to remember the nerve supply because this like provides some logic here. The trigeminal nerve is somewhere in the anterior and middle cranial fossa. That is all trigeminal area. Posterior cranial fossa is over the 10th and 11th nerve, but away from the foramen magnum. And when you see closer area which is close to foramen magnum, it is supplied by the cervical spinal nerve, the C1, C2, and C3. So moving on, coming to the last thing, that is the blood supply. The blood supply. Now what is the blood supply of the cranial dura mater? Again, easier way. The cranial cavity, the three cranial fossa. Few people will really find these methods exactly ulta, exactly opposite to the way it is taught. Obviously, people teach about cranial cavity first, about the foramen, structures passing through the foramen, and then they obviously believe that we should actually talk about other things like cranial dura mater, dural sinuses, and arteries or nerve passing through it in the respective chapter. But everyone is having their own method. I very, very strongly believe, and I believe it like from the beginning only, that when somebody starts a topic like head and neck, and if you just give them a bone, if you give them a skull bone and you're looking at the cranial cavity or the base of the skull and you just try to like mug up the name of the foramen and you keep writing the nerve which are passing through them, this is more difficult. Somebody tell you foramen without knowing anything in the head and neck. Imagine you are trying to learn the structures passing from the jugular foramen. The jugular foramen is giving passage to sigmoid sinus, to the inferior pectoral sinus, 9th nerve, 10th nerve, 11th nerve, and then you later on you read these structures. Well, again I would say many people would say this is the right way to do it, but I feel that now just imagine for 1 second when you revise your head and neck. You already know in detail about 9th nerve, 10th nerve, and 11th nerve. All we have discussed here. Today we have discussed how sigmoid sinus and inferior pectoral sinus are joining with each other below the jugular foramen. So this will correct better. Now if you read osteology after this, after doing this, if you read osteology, then osteology will make more sense. Because when you're looking at a particular foramen, you already have an idea, okay, these are the structures which are actually passing through it, and I already know it. So one thing leads to another. When you will be looking at a jugular foramen, your brain will also try to find out where is sigmoid sulcus, where is transverse sulcus, where exactly the inferior pectoral sinus will come from. If you read the osteology first and you're looking at just one foramen here, then you are just focused about that what are those four structures, and you know nothing right and left to that, and you'll not be able to visualize other things in the osteology. So that's why I feel in head and neck, osteology should not be done like right in the beginning only. Pura shuru mein leke baith jao, I'll read all the norma frontalis, norma lateralis, and basalis, and keep on mugging up those structures. Or later on, people will find it like it's very boring. It will start making sense if you read the structures first. I hope people did not have much of a difficulty in understanding the cranial nerves without knowing about the cranial cavity. Now, if you look at the cranial cavity, it makes sense. You look at a foramen, okay, foramen rotunda, you know, the maxillary nerve is going through there. If you look at foramen, okay, mandibular nerve is going through there. So like you can connect the previous thing. So once again, let's divide this cranial fossa in three parts: anterior, middle, and posterior cranial fossa. There is the foramen magnum, and in front we have a plate called as a cribriform plate. I hope you know that there's a plate called as a cribriform plate. Cribriform, like a sieve. Olfactory axons will pass through it. Anterior cranial fossa. When you look at the blood supply of the anterior cranial fossa, ethmoidal arteries will be there. Now, when it comes to ethmoidal artery, both are there. Anterior and posterior ethmoidal artery both will be there. That's an anterior ethmoidal artery and posterior ethmoidal artery. Obviously, if anterior and posterior ethmoidal nerve are ultimately the branches of ophthalmic nerve, so anterior and posterior ethmoidal artery are all the branches of ophthalmic artery. And to tell you guys, ophthalmic artery is a direct branch of internal carotid, which we will be discussing again in the neuroanatomy subject, how internal carotid artery gives on that. In the middle cranial fossa, we discussed that foramen lacerum is present in the floor of the cavernous sinus. Now, somewhere here will be cavernous sinus, and in the floor of cavernous sinus there is foramen lacerum. I'm writing FL here, foramen lacerum. How about I write the name of the foramen on the other side? So this is foramen lacerum, and foramen lacerum is giving passage to the internal carotid artery itself. So obviously, internal carotid artery supply the dura mater of middle cranial fossa. Predominantly, this middle cranial fossa dura mater is supplied by the branches of the, not predominantly I would say, the branches of internal carotid will supply the dura mater of middle cranial fossa, especially the walls of cavernous sinus. Internal carotid artery is inside the cavernous sinus, so it is supplying the walls of cavernous sinus, and walls of cavernous sinus is dura mater only. Foramen ovale and foramen spinosum. We have foramen ovale and we have foramen spinosum. We have foramen ovale and just posterior we have a spinosum. Let me write that FO is foramen ovale, FS is foramen spinosum. Foramen ovale is giving passage to an artery, foramen spinosum is giving passage to the artery. this artery which is coming from foramen ovale is accessory meningeal artery, and the one which is coming from foramen spinosum, we all know that that is a middle meningeal artery, the main artery, middle meningeal artery. Accessory meningeal artery and middle meningeal artery, guys, they both are the branches of maxillary artery, which we will discuss in the next section after this. And maxillary artery is a direct branch, it's the largest branch of external carotid artery. Connect the dots, connect all these things. Accessory meningeal and middle meningeal are supplying the dura mater, obviously, of the mainly by the middle cranial fossa, as you can see in the diagram. And accessory meningeal and middle meningeal, they are the branches of maxillary. We will discuss that after this, which is the branch of external carotid. Do you remember one mnemonic I told you guys for foramen ovale? The mnemonic was male, M-A-L-E. And I don't know if you realized or not, we have already discussed most of it. What is M? Mandibular nerve. We discussed mandibular nerve. What is L? Lesser petrosal nerve. You know, lesser petrosal nerve is coming to the otic ganglion and carrying the secreted motor fibers to carotid gland. A, we just discussed that. That is what accessory meningeal artery. A is for accessory meningeal artery, and E is emissary vein. Like emissary vein are present at many places. There's another emissary vein passing through it. Male structures from foramen ovale, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. Okay, what else, guys? If I go to the posterior cranial fossa first, I'll come in there. If I go to the posterior cranial fossa, then the major artery which is entering from that is the vertebral artery. At least you know the origin of vertebral artery based on our last discussion, guys. Vertebral artery, vitamin C and D, was the branch coming from the first part of subclavian. So it's a branch of the subclavian artery. So you should know all these small arteries I'm writing here, they are the branches of which major arteries here, which is the branch of internal carotid, which is the branch of external carotid, and that subclavian artery giving of vertebral. And obviously vertebral artery branches will be supplying the dura mater of posterior cranial fossa. We have branches of vertebral artery supplying the dura mater of posterior cranial fossa. Now there is an artery, guys, which is passing from the several foramen in the middle and posterior cranial fossa, dono mein. I don't want to tell you the name of the foramen as of now, because that we can discuss in the osteology separately. All I wanted to remember the name of this artery here. What was the only medial branch of external carotid, guys? What was the only branch of external carotid on the medial side? That was ascending pharyngeal artery. So these arteries are called as the meningeal branches of ascending pharyngeal artery. Meningeal branches of ascending pharyngeal artery. They are also supplying the dura mater of middle as well as posterior cranial fossa. Guys, if you are not drawing this diagram, or even if you draw this diagram, it's your choice. Diagrams are always more impressive. If you're not drawing this diagram, please make sure when you write the answer and when you write about the blood supply of the cranial dura mater, please mention it at which cranial fossa. Anterior and posterior ethmoidal artery in the anterior cranial fossa. Internal carotid directly, ascending accessory meningeal, middle meningeal, meningeal branch of ascending pharyngeal in the middle cranial fossa. Vertebral artery and again meningeal branch of ascending pharyngeal artery in the posterior cranial fossa. That is how the dura mater is supplied. So this is the end of the cranial dura mater and dural venous anatomy. We will be talking about the side here, and we'll be looking at the infratemporal fossa. We'll be looking at this infratemporal fossa especially. Temporal fossa is also there, but there's nothing to discuss. The temporalis muscle is there. Infratemporal fossa is important. And this is such a crowded area, infratemporal fossa. But you'll be happy to think that maximum structures, not all, maximum structures of the infratemporal fossa are already in our grid. Let's see. So, this is the next thing we are discussing here. Let me take a help of this picture. Guys, this image here is the side of the skull bone you're looking at. See what they've done. Nicely, they've cut the mandible. It's a picture from the student's grades only. You have that book. They've cut the mandible here so that this portion of the mandible, the ramus of mandible, is kind of removed. And they've also cut the zygomatic process. So if I cut the zygomatic process, if I cut the ramus of mandible, I can peek inside. Now I can see here what this fossa here is an infratemporal fossa. What bone is that? That's temporal bone. So above the zygomatic arch, this here is a temporal fossa. This whole thing is a temporal fossa. Infratemporal fossa. So when you look at infratemporal fossa, the first question here is about the boundaries of infratemporal fossa. The people who have not seen the skull from the side, or if they don't understand osteology from the side, they find it really difficult to understand the boundary. Otherwise, it's very, very simple. Now look at this and you'll say it is such a piece of cake. The boundaries of the infratemporal fossa, let's understand it here, and then we're gonna like write them out. Anterior wall is by this. What bone is that? What bone is that? That is a maxilla, right? So I can say that maxilla, posterior surface of maxilla. Look at this entire bone is maxilla here. The posterior surface of maxilla is the anterior wall of infratemporal fossa. That's an anterior wall of infratemporal fossa, right? Medial wall. What is that? The medial wall. Can you see a plate over there? This is a plate which is giving attachment to the pterygoid muscle, the muscle of mastication, and that plate is called as a lateral pterygoid plate. Just like we have muscle of mastication, lateral pterygoid, the plate is also called as a lateral pterygoid plate. There inside will be one more plate that is medial pterygoid plate, but we are concerned with the lateral pterygoid plate. So this lateral pterygoid plate is forming with which wall? The medial wall of infratemporal fossa. We're looking at the bony walls, right? Roof. Now, if I look at the roof, look at this, and I need to highlight this part here. There we go. This whole thing is a roof here. The roof is by the, now what bone is that? That's a sphenoid bone, right? That's a sphenoid bone. But if you look at the sphenoid bone, this part of the sphenoid bone is towards the temporal fossa. And this part of the sphenoid bone in the lower part, it is facing toward the infratemporal fossa. So how will it say? I will say infratemporal surface of greater ring of sphenoid. The bone is greater ring of sphenoid only. This whole thing is a greater ring of sphenoid. But we are not bothered about this part of greater ring of sphenoid. We are looking at this portion of greater ring of sphenoid, which is facing toward the infratemporal fossa. So I can say roof of the infratemporal fossa is by the infratemporal surface, the one which is toward this fossa, infratemporal surface of greater ring of sphenoid. Infratemporal surface of greater ring of sphenoid, that is forming the roof. That is the roof. Done with anterior wall, done with medial wall, done with the roof. What about the lateral wall? Very simple, guys. What we have cut here? What is the thing which is cut here? The ramus of mandible is cut. So ramus of mandible which is present here, if I extend it above, the ramus of mandible is a lateral wall of infratemporal fossa. infratemporal fossa. So lateral wall is by the ramus of mandible. Posterior wall, nothing. Floor, nothing. Open. Posterior it is open and floor it is also open. That's the boundary of infratemporal fossa. How difficult was that? That's infratemporal fossa. This is the one. Okay. I'll be using this picture to explain you one more topic that we're discussing after this. That is about the maxillary artery. So there we go. This is the infratemporal fossa. The boundaries of the infratemporal fossa are boundaries. We start with the anterior boundary. Now, just say to yourself, what was the anterior boundary? Anterior boundary was by the posterior surface of body of maxilla. It was by the posterior surface of body of maxilla. Posterior surface of body of maxilla. Agree? That was the anterior boundary. Roof is by the infratemporal surface. The surface of the bone which is facing toward the infratemporal fossa. Infratemporal surface of what? Of greater wing of sphenoid. Infratemporal surface of greater wing of sphenoid. That is the roof. That is the roof. Medial wall. Well, medial wall is just by the plate that is the lateral pterygoid plate. It is by the lateral pterygoid plate. Plate is lateral pterygoid plate, but in the infratemporal fossa it is on the medial side. It's a medial surface. Medial wall is by the lateral pterygoid plate, and obviously the lateral wall is by something that you removed. And what we removed, that is the ramus of mandible. Posterior wall and the floor are open. So there is no bony posterior wall or there is no bony floor here. When we talk about the bones, so when we talk about the infratemporal fossa, we have to talk about the bony boundaries. So bones to here, posterior surface of maxilla is there, infratemporal surface of greater wing of sphenoid, lateral pterygoid plate, and ramus of mandible. So no bony boundary backward, no bony boundary below. Now, see, the interesting part is when you look at the contents. When you look at the contents of the infratemporal fossa, many of those contents we already have a good idea about. If not discussed it, and we will be discussing this in this chapter only. But many we already done. So let me write down the contents here. Infratemporal, I'll tell you, I remember that during my time, they asked us a long question, although it is probably not a very popular long question, and it is considered as a difficult long question. The reason people find it difficult long question because the contents in the infratemporal fossa are very variety of content. Putti ganglion is there, choroid nerve is there, and when you maxillary artery is there. So when it comes as a long question, you have to write about everything. You have to write about the maxillary artery also. You have to write things about choroid nerve also. You have to write about putti ganglion also. Write about the branches of mandibular nerve, branches of maxillary nerve. So it's a kind of topic. If they give it as a long question, then people who don't know about all these things, the nerve and the blood vessels, so they get stuck because it's an amalgam of many topics here. That's the only reason people find it difficult. Otherwise, question is, it's just whatever we discuss, we just got to put them together in this fossa. For you people, I really want this kind of questions to come because this will actually test the knowledge of the people that who read head and neck in a conceptual way, in a more continuous way, and not just as an individual topic and never able to correct them. Contents. Well, the contents of infratemporal fossa, first of all, because we're looking at the lateral pterygoid plate, and let me tell you guys, lateral pterygoid plate give attachment to what muscle? Lateral pterygoid muscle, and also to medial pterygoid muscle, which we'll be discussing in the next part, next time. Then we'll talk about the TMJ and the muscles of mastication. Both muscles of mastication are attached to lateral pterygoid plate, not to the medial pterygoid plate. So, because of the pterygoid plate should remind you, the lateral pterygoid plate should remind you that what muscle will be seen here? The lateral pterygoid muscle. Medial pterygoid muscle will be seen here. Okay, what is the nerve? The mandibular nerve. If you remember all those pictures that I showed you for the mandibular nerve, and we recognize all the branches, how to find out the auriculotemporal nerve, how to find out the lingual nerve, inferior nerve. So all those will be seen here. The mandibular nerve will be seen here. And if mandibular nerve is seen here, guys, which ganglion? Mandibular nerve is having two ganglion. To the trunk of mandibular nerve is putti ganglion. But submandibular ganglion is to the lingual nerve, which is somewhere here in the submandibular region here. So don't count that because we're just talking about the infratemporal fossa, not this part here. So when you have two mandibular nerve and which ganglion? The putti ganglion is also the content. You know about putti ganglion. I'll tell you more about the putti ganglion. Then maxillary nerve. Remember maxillary nerve when it comes into the pterygopalatine fossa, that's infratemporal fossa only. And which branch of maxillary nerve will be seen here? The branch of maxillary nerve which is piercing or body of maxilla. Let me remind you that again from the picture. If maxillary nerve is seen present somewhere here, which branch of maxillary nerve was seen here which is entering? That was the posterior superior alveolar nerve because rest was by the infrared. So maxillary nerve and posterior superior alveolar nerve. The branch of maxillary that is posterior superior alveolar nerve is also the content. If mandibular nerve is seen, we can see the mandibular nerve divisions, inferior alveolar. So I will be able to see lingual nerve also starting in the infratemporal fossa, and lingual nerve was joined by the chorda tympani nerve, which also will be the content of the infratemporal fossa. We also have the first and second part of maxillary artery as a content. But a maxillary artery, I'm going to discuss after this. That is my next topic for the day. Maxillary artery. The three parts of maxillary artery is the largest artery, largest branch of external carotid. First and second part will be in this fossa. Okay. First and second part of maxillary artery, and third part of maxillary artery will not be seen completely, but there is one branch of third part of maxillary artery which is called as posterior superior alveolar artery will be seen. Just like we have posterior superior alveolar nerve, exactly same location we also have posterior superior alveolar artery. We will see that. That will be seen here. The venous plexus here. The venous plexus is called as a pterygoid venous plexus will also be seen here in the infratemporal fossa. Imagine how dense or how crowded this infratemporal fossa is, having all these contents. Because these contents are they are in themselves. We need to know about all the muscles of mastication in detail, their attachment in detail, very precise attachment of muscle of mastication. It's a very important question for you people. You get a short note on a particular muscle of mastication also, and you get a long question on TNG and muscle of mastication combined. Mandibular nerve, we know about it. Otic ganglion, we've done it. Maxillary nerve, PSA, we've done it. Caudate tympani, we've done with this part here. So like we already know about these things here. Or we know that these two muscles, although we still have to discuss their attachment. So let us do one thing, guys. Let's talk about this part here. Let's talk about the first and second part and third part of maxillary artery. And let's see where those branches are, because that's an artery which is having 16 branches of its own. And again, this is a topic which is important for your conceptual understanding, because there are so many things we're going to discuss. Like we'll talk about the nasopharynx, the oropharynx, the auditory tube, the nasal cavity, the palate. So you'll see some branches of arteries are present here. And again, people don't have a good idea about where those arteries are coming from. So majority of those branches are coming from maxillary artery, and you need a very good orientation to understand that how maxillary artery will contribute to the nasal cavity, to the orbit, to the oral cavity, to the pharynx, and everywhere. The strategic location of maxillary artery is such. Okay. So one of the content of the infratemporal fossa is maxillary artery. So guys, maxillary artery, we all know it is one of the terminal branch. I should not only write branch, it is a terminal branch of external carotid artery. It's one of the terminal branch of external carotid artery, maxillary artery. This undoubtedly is the largest branch of external carotid artery also. It's a terminal branch, but it's the largest branch. And there should not be any doubt about this. It's the largest branch because it is having 16 branches of its own. This maxillary artery is having 16 branches of its own, which are given by the three parts. The three parts of maxillary artery. Once again, I'll be using this picture to explain you maxillary artery. Okay, guys, maxillary artery. See, if I just to first tell you that where external carotid artery entered the parotid gland like this, and then it was a superficial temporal artery which is going in this way. That is a superficial temporal. Okay? And maxillary artery will run forward in this way, in the infratemporal fossa. Now we said three parts of maxillary artery. First part is passing deep to the neck of mandible. Now mandible is cut here, so I can actually see the entire artery, but it is just the first part. The first part of maxillary artery is present deep, or you can say medial to the neck of mandible. Medial to the neck of mandible. Now I got to understand one muscle here before we go any further. There is a muscle which is present here and also going toward the neck of mandible, and that muscle is a lateral pterygoid muscle. One of the muscle of mastication is lateral pterygoid, and that muscle is spanning something like this. I'm just drawing it and I'll rub it off, guys. That is the muscle. That is a lateral pterygoid muscle which is present like this. That's the lateral pterygoid muscle. It is running backwards, so it is originating from the lateral surface of this lateral pterygoid plate, and also from above. Also, we see that. Don't have to go into that detail. And then this muscle, the lateral pterygoid muscle, is coming backward and inserting to the neck of mandible. So, the first part of maxillary artery is simply passing medial to the this neck of mandible. Second part of maxillary artery will be seen coming out between the two heads. We have two heads actually. We have two heads of this muscle, lateral pterygoid muscle. So, it will come out between the two heads and will be running here. So, you will see the second part of maxillary artery to be present in relation to this muscle, that is lateral pterygoid muscle. It is running between the two heads of lateral pterygoid. And then you will see maxillary artery will go through this fissure and then ultimately into this fossa. I hope you remember from our last discussion what is a fissure and what is a fossa here. This fissure here is present between the maxilla and pterygoid plate. So fissure is called as pterygomaxillary fissure. This fissure is called as a pterygomaxillary fissure. So third part of maxillary artery goes into pterygomaxillary fissure. And guys, what is the fossa there? That's a pterygopalatine fossa. You know palatine. Pterygopalatine ganglion is there. So that fossa is called the pterygopalatine fossa. That's the third part of maxillary artery. Where is the first part? Deep to the neck of mandible. Where is the second part? Between the two heads of lateral pterygoid. Between the two heads of lateral pterygoid. There is a variation also. Sometimes this artery completely is present deep to the lateral pterygoid also, but that is a variation. Usually it is between the two heads of lateral pterygoid. Third part is here and here also. So in what fissure? In the pterygomaxillary fissure and in pterygopalatine fossa. In pterygomaxillary fissure and pterygopalatine fossa is the third part of maxillary artery. Right? So I want you people first to draw a very easy and simple diagram here, schematic diagram to understand the first, second, and third part. And then I will be using this picture again and again to explain you the branches of maxillary artery, because I don't want you to simply mug up the names of the branches. You should again visualize that what branches are there and why those branches are present there, what are the neighboring structure they can supply. So then again, you don't have to mug it up, you can understand those branches. So if you understood that on the diagram there, guys, this. Okay, here we go. Let's say this is the neck of mandible. Don't have to draw the entire mandible for that. That's the neck of mandible. And the muscle that we said which is inserted to the neck of mandible and also to the capsule of TMJ, to the temporomandibular joint also. This muscle here is the lateral pterygoid muscle. So you're looking at the neck of the mandible, and on the anterior surface of the neck of mandible, the muscle which is inserted here is the lateral pterygoid. And then we said we got a fissure here. We got a fissure here which is called because this muscle is coming from what plate? From the pterygoid plate. So let us say if this is a pterygoid plate here, from where the muscle is originating, that is pterygoid plate here. So there is a fissure and the fossa. There is a fissure and the fossa. The fissure is the pterygomaxillary fissure. These names should not bother you. This is all logical. It is between the pterygoid plate and maxilla. The fossa is between the pterygoid plate, and we have a perpendicular plate of palatine bone. Cannot see it now, but there is a part of palatine bone which is there as well. So we call it pterygopalatine fossa. Pterygopalatine fossa. Right? So that's the plot we have. Neck of mandible is there. Lateral pterygoid muscle coming from that pterygoid plate here, and then there's a fissure which is present deep to the neck of mandible. Make sure you draw it dotted. That's the first part. Second part is running between the two heads of lateral pterygoid. Third part is running in the fissure and in the fossa. The first, the second, and the third part. First part, deep to the neck. Deep to the neck of mandible. You know, I usually try to invest more times in topics like these because this is something which I want people to visualize and keep it in mind. Later on, the topics which are from exam point of view more important. I told you this earlier, like parotid gland, thyroid gland, they're more important. Of course, they're more important. They are more likely to be asked. Thyroid gland or parotid gland is a long question in every alternate year. You take a paper of last previous year of your university examination, every alternate year, either there's a question on parotid gland or thyroid gland. So these are like fixed type of questions which you have, long questions. But the point is, whatever is there in the parotid gland, whatever nerves and blood vessels and the muscles we have in the relation, those need to be discussed very well. Then those glands become very important, very easy only. And now I'm discussing the maxillary artery with you. And when the time comes, I'll discuss about the nasal cavity and the paranasal sinuses and blood supply. You'll find your blood supply so easy because you already know the 80% blood vessel coming from where. You already saw ethmoidal artery is there. You can see the maxillary artery branches coming and supplying the nasal cavity. So whatever major topics are which are about to come, the nasal cavity, the oral cavity, the pharynx and the larynx, we are really building a very, very strong basis for that. Because by the time we reach those topics, you will say, okay, I know about this. I know where these artery nerve vessels are coming from. Directly discussing, again, same point, I keep saying that over and over again. Directly discussing them is like mugging up this. Lacrimal gland, I wanted to, again, need a reassurance from my friends here. Lacrimal gland is one topic which is done with the face, when the scalp and face is in. But when you people, general head and neck career, you have discussed the lacrimal gland. I guess nobody understood the innervation of the lacrimal gland. But now you know what is the topographic connection of a ganglion, functional connection of a ganglion, how the preganglionic nerve will come, how postganglionic nerve will go from the pterygopalatin ganglion and supplies the lacrimal gland. So you have a better understanding. So the day when we will discuss in the orbit the lacrimal gland, the difficult part is already done in the cranial orbit. So we'll be like easy stuff to discuss here. So its first part deep to the neck of mandible. The second part is present where? It is present between lateral pterygoid, between the heads of lateral pterygoid, sometimes deep to the lateral pterygoid also, but that's a variation. And third part is in the fissure, that is pterygomaxillary fissure and pterygopalatine fossa. Pterygomaxillary fissure and pterygopalatine fossa. Got it? I hope you have this picture in your head that where the first, second, third part are present. Now let me first help you understand that what are the branches coming from the first part, second part and third part. And I'll give you a mnemonic also for this. There's a very easy mnemonic to remember the branches coming from the first. Although there are 16 branches, 5 from the first part, then we have 5 branches from the second part, and then you have 6 branches coming from the third part. So like we have 16 branches in total, but the mnemonic is easy. But the mnemonic will not help you understand that what those arteries are doing there, what are they going to supply. This just will help you to remember the names of the branches. So let's use this picture once again. And I'm just going to focus on the first part of maxillary artery. And again, these pictures obviously will be shared with you. But try to understand, guys, that what are the neighboring structures and what exactly the first part of maxillary artery is doing there. Okay. If I have to draw only the first part of maxillary artery, there it is. Let's say this is the first part of it. I guess the red color is, I don't know if it is visible. Yeah, it is. That's the first part of maxillary artery. Just see, guys, again for understanding. We said there are how many? There are 5 branches coming from the first part of maxillary artery. 5 branches. 2 will go into the cranial cavity, the 2 which we just discussed in the dura and the dural venous sinuses. 1 from the foramen ovale, 1 from foramen spinosum, and both the foramen you can see. Look at that. Look at the shape. It's foramen ovale and foramen spinosum, both are in the sphenoid bone. So we have one artery that you will see entering into the foramen ovale, that is accessory meningeal artery, and the one artery which will enter through foramen spinosum and going into the cranial cavity, that is the middle meningeal artery. You know these two here. So that's an accessory meningeal artery, and that is middle meningeal artery, which are definitely the dominant nerves supplying the dura. They are the nerves supplying the dura mater, entering through foramen ovale and foramen spinosum, right? So as I said, just try to understand that what are the structures nearby and what will they supply. Similarly, we have the branches which are going toward the ear also. Now you'll see one branch which will enter from the floor of this external auditory canal, and there's another branch which will enter more deeper through a there's a fissure which is more deeper inside. I'm not telling you the name of the fissure here. There's a tympanic fissure which is more medially placed. So there are 2 arteries which are going toward the ear, and look at the name, guys. This artery which is piercing the floor of this external auditory canal obviously will be coming here and supplying the external auditory canal. Now this artery is called as the deep auricular artery. Now you will say, why are we calling it deep auricular artery? Because it is supplying the skin of the external auditory canal, and it goes and supplies a deeper aspect also. If you keep supplying the deeper aspect of the external auditory canal, you will keep going inside. Where will you reach? Tympanic membrane. And that's why this artery, deep auricular artery, supplies the external auditory canal and also the outer layer of tympanic membrane. This also supplies the outer layer of tympanic membrane. That's deep auricular artery. I'll write all these things later. I'm just explaining the branches here. Another artery which you see here is called as the anterior tympanic artery. Now don't be bothered too much about this name anterior tympanic, because inside the middle ear there is an artery called as posterior tympanic also. So we call it anterior tympanic. It is like entering, or you can say it is supplying the middle ear cavity from the anterior aspect. So we call it anterior tympanic artery. Tympanic word will remind you of tympanic membrane and middle ear cavity. Tympanic cavity means middle ear cavity. Deep auricular artery is supplying the outer layer of tympanic membrane. So but the anterior tympanic artery is more inside, will be supplying the inner layer of tympanic membrane and also to the middle ear cavity. That's what an anterior tympanic artery will do. external auditory canal and outer layer of tympanic membrane. The one which is called as the anterior tympanic artery, that means artery of the middle ear. So it will be supplying the middle ear cavity and the inner layer of tympanic membrane. Two for the meninges, two for the ear. Let's take one artery below, and you very easily can guess the name of this artery. What artery you expect to be going like this, running like in here, and coming out like this here? What was the nerve we discussed, which is a branch of mandibular nerve, which is running exactly like this? That was the inferior alveolar nerve. This is the inferior alveolar artery. That's inferior alveolar artery. Difference here, the inferior alveolar nerve was a branch of mandibular nerve. Inferior alveolar artery is a branch of maxillary artery. Inferior alveolar artery. And just like inferior alveolar nerve only, this also will give off a branch which will come down and supplies the mylohyoid muscle. So artery to mylohyoid will also come from it. Artery to mylohyoid will come from it. And obviously when it comes out of this foramen, what artery will that be? That will be the mental artery. Just like mental nerve, we have mental artery also. So that is the first part of maxillary artery. First part is 5 branches. 2 for the ear, 2 for the meninges, 1 for the mandible. Accessory meningeal, middle meningeal, deep auricular, anterior tympanic, and then we have inferior alveolar artery. Then we have inferior alveolar artery. If you could, as I said, if someone wants to remember these branches, the mnemonic here, like the mnemonic can be remembered as AADMI. Aam Aadmi. Aam Aadmi. Like the political party, I mean Kejriwal's party, Aam Aadmi. AADMI. A. Accessory meningeal, another A. Anterior tympanic, D. Deep auricular, M. Middle meningeal, I. Inferior alveolar. 5 branches coming from the first part. And once you know their name and once you visualize that what are the areas out close by, you can easily jump. Let's write down those about the first part here, then we'll come to the second part. So first part, we have 5 branches from the first part of external carotid. The base of the skull we have foramen ovale, that is foramen spinosum. I'm just trying to copy this place, that is foramen ovale, foramen spinosum. Behind that, obviously we have a mandibular fossa here, and then we have this external auditory canal. So this was the location of the first part of the maxillary artery. The branches, let's take one through the foramen ovale, let's take one into the foramen spinosum, let's take one which is supplying the outer layer of tympanic membrane and external auditory canal, and one deeper artery will be there. Let me put a dotted line like this. And of course, one artery which will be coming below. It will be better if I just draw the half of mandible here for that. That is the inferior alveolar artery. Let's take it inside the mandibular canal and make it come out through the mental foramen with a branch which is going downwards. Writing in short, guys, foramen ovale and foramen spinous. So this is the middle meningeal artery. Sorry, that's foramen ovale is accessory meningeal artery. This is middle meningeal artery. I've written these two names in short. We have anterior tympanic artery. Anterior tympanic artery. Accessory meningeal and middle meningeal, I don't have to write about them. Obviously, they are supplying the dura mater of the middle cranial fossa. Anterior tympanic artery, it is supplying what? It is supplying the middle ear. It is supplying a part of middle ear cavity. And what? An inner surface. Inner surface of tympanic membrane. Inner surface of tympanic membrane. Whereas the deep auricular artery, on the other hand, will supply the skin of external auditory canal. I've written EAC. It supplies the skin of the external auditory canal plus outer layer of tympanic membrane. I'm writing TM for tympanic membrane. Is outer layer of tympanic membrane. Right. And finally, inferior alveolar artery. I don't have to tell you anything about inferior alveolar artery. It's just like the nerve only. Inferior alveolar artery will be supplying all the gums and teeth of the lower jaw. Will be emerging from the mental foramen as the mental artery to supply the skin outside of the chin, and this here is the artery to mylohyoid. Just a copycat of the nerve base. The 5 branches from the first part: accessory meningeal from foramen ovale, middle meningeal from foramen spinosum, anterior tympanic and deep auricular artery supplies the ear, external and middle. Inferior alveolar artery, the only artery which goes down, that supplies the alveoli, comes out as a mental artery. So if you just roughly and schematically draw it once, you probably don't have. If the question is just about enumerate the branches of maxillary artery, obviously you will not draw all these things here. But that is for your understanding. This is for your concept only. Mnemonic which I told you guys, what was the mnemonic? The Aam Aadmi, right? Aam Aadmi. AADMI. These are the branches from the first part. Shall we? Okay. Coming to second part. The second part is the easiest. And I don't have to do anything in the second part, but still, we are doing this. How about? Second part is the easiest part to remember, and the reason is, second part is running between the muscle of masculine. It is running between the two heads of pterygoid, lateral pterygoid. If this is the second part, all the branches which are coming from the second part are the muscular branches only. So we have 2 arteries which will be supplying the temporalis muscle. 2 arteries supplying the temporalis muscle. It's a big muscle, so 2 arteries supplies it, and they are supplying the temporalis muscle on its deeper surface. So arteries are called as deep temporal arteries. These are deep temporal arteries which are supplying the deeper aspect of this temporalis muscle present on the temporal fossa. So there are 2 branches. There are 2 deep temporal arteries, both supplying the temporalis muscle as the name suggests. Then we have an artery called as a artery to lateral pterygoid. Artery to lateral pterygoid will be there. Artery to medial pterygoid will be there. Obviously, muscles are removed here, so we cannot see where those muscles are, but artery to lateral medial pterygoid will be there. So this is the artery to lateral pterygoid. Let's say this is artery to medial lateral pterygoid, artery to medial pterygoid. Then we have artery to masseter muscle. Masseter muscle is on the outside here. Masseter muscle is outside. So it will use a masseter notch, which I will discuss it in the next part. What is masseter notch? Where the muscle is attached. So that artery will come and supply the masseter muscle on the outside. So that is called as mesenteric artery. That artery is or artery to masseter, or you can say mesenteric artery. See, but जो muscle of mastication same artery guys. Deep temporal for the temporalis. Artery to lateral pterygoid, artery to medial pterygoid, mesenteric artery. Are these different? But there is one more branch here. There's one more branch here, and that artery will come here and supply the muscle in this region. And that artery is the buccal artery. Like we were emphasizing so much on the buccal nerve, we also have a buccal artery, guys. Buccal nerve, there was one buccal branch of mandibular nerve, there's one buccal branch of facial nerve, we have buccal artery also. Buccal artery supplies buccinator, of course, it supplies buccinator. Now you will say buccinator is not a muscle of mastication. Yeah, it is not. But buccinator muscle is considered as accessory muscle of mastication. And you know why? Let me demonstrate this for you. Why buccinator muscle, although it is not helping in chewing or anything, why we consider it as an accessory muscle of mastication? Because buccinator muscle helps you to inflate your cheek. Inflation of the cheek is done by buccinator muscle. While chewing, the food gets stuck into the vestibule between the teeth and the cheek. Food gets accumulated here. What tongue will do, guys? You must have noticed that you keep doing this thing when you eat like this. You keep running the tongue in between. What happens when you run the tongue in between the cheek and the rest of the vestibula here? So rest of the gums and teeth. So the food actually can be picked out. So the food can be picked out, and then it will push between the teeth for the chewing. So basically, buccinator muscle is helping the tongue to clean the food from vestibule. To clean the food from the vestibule. Every time you just run the tongue in between, that is helping. And how can the tongue run in this region here? That is only when you're able to inflate the cheek, and that is by what muscle? By the buccinator muscle. So buccinator muscle inflates, helps the tongue to clean the food from vestibule. I tell you, the patient with the facial paralysis, Bell's palsy, right? The patient with Bell's paralysis, if you hold their cheek and retract to one side, then you will see the food is found accumulated in that part here. Because the buccinator muscle is a muscle of facial expression which is paralyzed. So patient with the facial paralysis, they have this tendency of food getting deposited in the side, in the vestibule. So that artery here is called the buccal. We'll be discussing this thing again in the mastication part. So second part is the easiest part to remember because it is just about the muscles of mastication and accessory muscle of mastication. So these are the branches coming from the second part. Nothing to draw, guys, nothing, just write down the branches coming from the second part. So second part branches, usually we say 5 branches, and all are muscular branches. That's what you need to know, that all are muscular branches. So we have artery to medial pterygoid. We got artery to lateral pterygoid. We got mesenteric artery. Obviously, to the mesenteric muscle, there is mesenteric artery. And then I said temporalis muscle is supplied by what artery? It is by the deep temporal arteries, which are usually 2 in number. And there is a buccal artery also, which is going to supply this accessory muscle of mastication, which is actually a muscle of facial expression, that is buccinator muscle. Buccal artery to the buccinator. So you can say 5 branches or you can say 6 branches. Actually, there are 2 deep temporal arteries, doesn't matter. So sometimes both these deep temporal arteries come as a common trunk. It will come as a single artery, then they will divide into. So that's probably the reason they usually say 5 branches from the second part. Otherwise, you can say 6 branches also because there are 2 deep temporal arteries for temporalis muscle. These are for the temporalis muscle. Second part, guys, nothing in the second part. That's easy. Third part. Now, third part is a little challenging. The reason it is challenging is because you are not able to visualize all these arteries from outside. Pterygoperoneal fossa, pterygoperoneal fossa is such a deep fossa inside. It's not easy to look at those arteries in the simple dissection or simple view of the skull, the lateral side of the face. But yes, let's try whatever we can, whatever branches I can try to justify, I will. Third part of maxillary artery is here, like it is in the pterygomaxillary fissure and then the pterygoperoneal fossa. That's the side where the third part is present. How about if I use a different dark color here so that you can see clearly? That's its artery only, guys. I'm using a black color, that's an artery. See the branches from the third part, there are 6 branches. There are 6 branches, and those branches can be remembered with a mnemonic that is big pus. Now, this I would say is a good mnemonic, although it doesn't sound very good. The reason it is a good mnemonic because it is telling you the branches of maxillary artery more or less in a sequence. Like, although these arteries are very close to each other, but still a sequential arrangement is shown in this big pus here. P-I-G-P-S for pus. If you remember the nerve with the same name, there's an artery with the same name also. What was the nerve, guys? Posterior superior annular nerve. This is an artery here called as a posterior superior annular artery. Posterior superior annular artery. I'm using black color, just excuse me for that. Then what you'll see, this artery, there's a branch of this artery which will enter through the infraorbital fissure. If it enters through the infraorbital fissure, it will be running in the floor of the orbit. And will be coming out from this foramen here. Just like the nerve, what was that? That's an infraorbital artery. Look at this. D is done I. Posterior superior annular artery, and there is infraorbital. This whole thing is an infraorbital artery. And just like the nerve, it will do the same thing. It will also give the middle superior annular, it will give the anterior superior annular inside to supply the maxillary sinus. So it's just a carbon copy of what nerve is doing. The artery is also doing the same thing. G. Guys, G stands for greater palatal artery. But there is a branch which will go down, run in the canal that is called as a palatine canal, and then you will see this artery running on the palate like this, on the undersurface of palate. And from the foramen, there is a foramen in the anterior part of the palate here. It will enter into the nasal cavity also. This artery is called as a greater palatine artery. I will explain this to you separately. I have kept a separate picture for that, guys. So there's a canal which, again, I cannot discuss it right now. There's a canal which goes downward called as a greater palatine canal. So that artery goes downward into the greater palatine canal, and then this artery runs on the undersurface of palate. It It is running on the undersurface of palate, supplying the related structures. I will discuss that with you. Goes forward, and there is a foramen which is present just behind the incisors, incisive foramen. It enters through the incisive foramen and come into the nasal cavity. So it supplies the nasal cavity also, little area in the nasal cavity. Big pus, PAS. Now we have a branch. These are the branches which are actually running backward. There is an artery which is called as P, and there is an artery called as A. If I say P, A, and this big foramen here from where the artery go into the anteriorly actually, there is S, big pus. But a P is pharyngeal artery. Just don't go into the detail of that. Again, we will be discussing this detail in the pharynx. P is pharyngeal artery which is going backward and supplying the nasopharynx. This area will be the nasopharynx only, so it will supply the area of the nasopharynx. That's P. A is artery to pterygoid canal. Do you remember nerve to pterygoid canal? That is pterygoid canal. Look at that. That is the opening of the pterygoid canal over there, where A is written. So greater petrosal nerve and deep petrosal nerve are coming like this, and artery is running backward in this. So there is an artery to pterygoid canal which supplies the pterygoid canal and eustachian tube, the structures which are close by, auditory tube close by here. So nerve to pterygoid canal, ऐसे आ रहे होंगे, and artery to pterygoid canal will be going back. And then finally, S. S is the largest branch of maxillary artery. Out of the 16 branches, the largest branch of maxillary artery is S. This is called a sphenopalatine artery. It is a main artery supplying the nasal cavity. The people who have read about the nasal cavity in head and neck, they must be knowing sphenopalatine artery is also called as artery of nose bleeding, artery of epistaxis, right? And that's a big branch, and that is supplying the lateral wall of nose, medial wall of nose. It supplies a lot of structures in the nasal cavity here, which we will discuss obviously in the nasal cavity. But overall, 6 branches. The one which we can kind of visualize, I mean, the Helmholtz diagram is posterior superior alveolar, infraorbital, that's just like the nerve only. Greater palatine artery is also able, we can visualize that running forward and going above. If I show you the base of skull, look at this case. Greater palatine artery will come out from this foramen here. The foramen which is present here, this is the greater palatine foramen. So this greater palatine artery will come out from here and will be running like this on the sides. And can you see an incisive fossa anteriorly? There we are. It enters through this incisive fossa and then goes above into the nasal cavity to supply the nasal cavity also. That artery which is running forward is what? That is a greater palatine artery. That's a greater palatine. And look at that, we have some small foramen at the back of the greater palatine. There is a lesser palatine foramen. Look at this very small foramen there. That's a lesser palatine foramen. It can be one, it can be more than one. I'll tell you what that lesser palatine foramen will give message to. Let me enumerate the branches of the third part at one place. Again, no diagram needed for that because it is all like too much inside. So third part branches, and this time we would like to go with the mnemonic only, and that is big pus. P stands for posterior superior alveolar artery. Just like the nerve, I don't have to tell you guys, posterior superior alveolar artery will be supplying the molars and premolars and will be supplying the maxillary sinus also. Supplies molars and premolars and maxillary sinus. Is entering into the maxilla bone, so supplying the maxillary sinus as well. I is for infraorbital artery. Once again, infraorbital artery will give off the branches like middle superior alveolar artery and anterior superior alveolar artery. Just like the nerve, it gives off the artery here, middle superior alveolar artery, anterior superior alveolar artery, which are again going to supply what? Maxillary sinus and alveoli, upper alveoli, maxillary sinus and upper alveoli, that is infraorbital artery. And then we saw infraorbital artery comes out and supplies the face, like lower eyelid and the rest of the face also. So it also supplies the face and lower eyelid. The branches supplying the face and the lower eyelid also. Infraorbital foramen sabara. G, greater palatine artery. G is for the greater palatine artery. Now, just to remember the greater palatine artery, how about if I draw it in this way? This is the nasal cavity. Let's flip it sideways. This is the hard palate. This is hard palate. And we said on the hard palate we have a foramen that is greater palatine foramen, and posteriorly we have a lesser palatine foramen, something like this. Greater palatine artery, let me write GPA. Greater palatine artery will come down through the greater palatine foramen, will run on the undersurface of palate, enter through the incisive foramen and goes into the nasal septum. Not only that, it gives off a lesser palatine artery. Greater palatine artery gives off lesser palatine artery which will come down here and will go backward. So what is happening here is greater palatine artery gives off this branch which is called as a lesser palatine artery. Lesser palatine artery is a branch of greater palatine. What greater palatine artery is doing? It is coming out of the greater palatine foramen. It is supplying what palate? It is supplying the hard palate, of course. It is supplying the hard palate, and it is also supplying the nasal septum. By going through which foramen? By going through the fossa which is called as the incisive. It is behind the incisors. So it is going through the incisive fossa. It enters by incisive fossa. Whereas lesser palatine artery is going backward. Obviously, if lesser palatine artery is going backward, guys, what is the palate here? There is a soft palate, right? And we know below the soft palate we have palatine tonsil also. Again, it's very logical if you think of that, what are the structures there? So that's why the lesser palatine artery is going to supply the soft palate and the palatine tonsil. It is going to supply the soft palate and the palatine tonsil. Palatine tonsil. That's what the greater palatine artery is. If you come down to the palatine, greater palatine canal, will go out of the greater palatine foramen, runs forward mainly, supplying the hard palate and the related alveoli also. You can supply the related alveoli from the inside. And then the main thing is it's going inside the incisive fossa, supplies the nasal septum also. Lesser palatine artery is no different artery. It's a branch of greater palatine coming through a separate foramen called as lesser palatine foramen, which can be one foramen, two foramen, sometimes three foramen are also there. So we can have multiple branches of lesser palatine artery coming down and running backward. If they're running backward, think of which palate? Soft palate, and what we have below that is soft palate and tonsil. So lesser palatine artery supplies the soft palate and palatine tonsil. And then PIC is done. Come to the past guys. P is the pharyngeal artery. pharyngeal artery. Pharyngeal artery is mainly supplying the nasopharynx. It mainly supplies the nasopharynx. It's going to detail as of now. A is artery to what? Artery to pterygoid canal. Artery to pterygoid canal. It is running backward and going into the pterygoid canal. It is supplying the pterygoid canal, of course, and it is also supplying the eustachian tube. It is one of the arteries supplying the auditory tube also. It is going backward and going to supply the auditory tube as well. And S, the main artery, is the last branch, but the largest branch. That is the sphenopalatine artery. We will be discussing the sphenopalatine artery in more detail in the nasal cavity. That is not the right time to discuss it for now. Sphenopalatine artery, guys, please note, it is the largest branch. It's the largest branch of maxillary, and this sphenopalatine artery, obviously, it supplies the nasal cavity. It supplies nasal cavity, lateral wall of nose, medial wall of nose. It's a major artery there, also called as the artery of epistaxis. For the people who don't know what is epistaxis, but epistaxis means nose bleeding. You must have seen sometime in hot season, if there is some people start bleeding from the nose, and there's so much of blood which comes out of the nose here. Because this artery is a very rich branch, it's a branch of maxillary artery, so if the nose starts bleeding, it's a lot of blood which comes out. Artery of epistaxis, artery of nose bleeding. Epistaxis means nose bleeding. Right, so these are the total 16 branches of maxillary artery. I'm more bothered about the orientation, where those branches were and how they are present. So before we call off a day, just a very quick recap for the branches we said, guys. The first part branches, we said 5 branches, the arm Adni branches. 2 will go from the foramen ovale and foramen spinosum for the dura mater. 2 will come toward the ear. One is deep auricular, one is anterior tympanic, supplying the external auditory canal and outer layer of tympanic membrane. Other one supplies the inner layer of tympanic membrane. One artery which is going down, that is inferior alveolar, goes inside the mandible, comes out of the mental foramen. Inferior alveolar artery, mimicking the inferior alveolar nerve. Second part of maxillary artery, think where it is present on the muscle of mastication. So the function is to supply the muscle of mastication. It gives off branch to lateral pterygoid, it gives off branch to medial pterygoid, which we will be discussing in the next lecture. How exactly those muscles are present, what is their action, their detailed attachment also. It also supplies the temporalis muscle by the 2 branches called as the deep temporal artery, and it also gives off branch to the buccinator muscle, that is a buccal artery. Third part, which is more deeply located, going into the pterygomaxillary fissure and pterygopalatine fossa. The branch which you can actually appreciate from the outside, very well from the outside, is the posterior superior alveolar artery. Again, mimicking the posterior superior alveolar nerve, supplying the maxillary sinus and related alveoli. Infraorbital artery will go from the floor of the orbit. It enters through the it enters through the orbital fissure, the inferior orbital fissure, and then it will go into the floor of the orbit and comes out of the infraorbital foramen to supply the face. Greater peritone artery goes downward and that supplies the hard palate and goes into the nasal cavity, and the branch of that artery will go backward and supply the soft palate and tonsillecule. And then we have 3 small branches which are over there. Not small actually, we have 3 branches over there. 2 of them are going backward. One is a pharyngeal artery and artery to pterygoid canal, and one artery which will go medially. I would say it is going more medially inside and then coming to the nasal cavity. The major artery of the nasal cavity, that's the sphenopalatine